everyone. Very, very good warm morning and welcome to MedTech Summit Malta 2025. We're here in Malta, in the heart of Malta. Let's hear myself. We're here in Valletta at the Mediterranean Conference Center in the heart of Malta. And I'm very proud to say that this is the 5th edition of MedTech Malta, here in the hometown of MedTech and also the Sigma Group. MedTech Summit is a global hub known for connecting innovators, leaders, builders, KOLs, investors, regulators, and startups in the fields of healthcare and medical technology. And it's also a hub that is connecting continents, because then for the next, Dr. Dylan, something ready in Dubai, in Asia, and also in the US. So without further ado, I would like to invite to the stage the man behind MedTech, the man himself, the visionary, the CEO and founder and co-founder of MedTech, Dr. Dylan Attard. Please give a round of applause.
Welcome speech by Dr. Dylan Attard, CEO and founder at MedTech World.
Good morning, everyone. It's truly, genuinely a pleasure to be able to welcome you all here today. From what started simply as around 50 people in one room, back as a not-for-profit association, back then as an NGO, I still remember spending 1 hour holding a mobile, trying to get some live feed on Facebook to give some people some fear of missing out. I spent the whole session holding the live feed to what it became today. It was meant to just be simply an annual conference promoting Malta as a potential hub for MedTech and health tech companies to set up on the island. But since then we've grown. We've been doing events across different continents, regions, from Hong Kong, Singapore to Dubai. We've done a number of European cities in the form of a roadshow event, and eventually we've also set foot in North America, which I know there's a good majority of you who came from across the Atlantic to be able to join us on our simple rock in the Mediterranean. When I used to go to conferences in the US 4 or 5 years ago, I used to tell people where I'm from, and I'm like, Malta, a small island under Italy. Eventually, year in, year out, they were starting to get it. And I genuinely appreciate for you for trusting us with your time. I know for the majority of you, you go to a lot of conferences, you try to minimize the time away from your families, from your daily work, and I appreciate you spending the time to come here. When it comes to MedTech World, something that I've been trying to double down on is it's not just about events. I've given up my career in surgery, so there's a lot on the line and I don't want us to be simply an event organizer, doing events week in, week out in different cities, because I know that there is already too many. So what we're trying to double down is on genuine connections. We're trying to democratize the way we do events, trying to price them as fair as we can, welcome as many startups as we can, help push them beyond their limits to be able to speak to more investors, speak to more researchers, and even more so include more patients and clinicians, something that we've been seen lacking across many events throughout the world, because unfortunately they're usually the ones that have the least budgets to be able to attend these conferences, and that's something that we're trying to focus on. There's a good amount of friends here who have been helping me even from their own time. I'm seeing Ken here, and together with him there's a bunch of others who all take their time throughout the year, trying to help refer people, startups, investors to be able to join us. And I can't be more grateful than I can in terms of for the trust you're giving us. We have quite a big vision ahead. Next year we're planning 4 events. I spent the whole of October and November up until now stressed that I haven't started planning next year. I'm not stressed about this week. This is our biggest crowd yet. And again, it's not just about numbers, it's about the quality of people that join us, and that's something that we do care about. But it is our biggest. It is the biggest event in terms of the people joining us as guests, as attendees, as sponsors, as partners, and as speakers, and we do appreciate that. Next year's calendar of events is quite a full one. We're starting with Dubai in Q1, which we're doing during the same week of Arab Health. We do acknowledge the massive event during that week. And we're trying to help maximize the time you're spending traveling. So for the majority of you, some of which have never been to the Middle East, who are looking to come to MedTech World in Dubai, I'm like, let's try and help them by hitting two birds with one stone. If they're going to be there for 3 days of our event, the rest of the week there's going to be over 50,000 people flying in from across the globe. And that's something that we're trying to help is so that those coming over would be able to enjoy both. We're going to West Palm Beach, Florida in the US, and this is going to be the first time we're going to go ahead with a 3-day event on our own, so it's quite a big challenge for us and for my team. So far we've done a 1-day event joint with some of our partners in Houston last March, and then we've successfully partnered up with, I'm seeing Nicole here from MedTech Innovator. We've been good partners for the past couple of months, helping their startups connect to more investors, and we're quite excited to stick with Florida as our home base for the US. Later on, we're going to Asia. We've already successfully done events in Hong Kong and Singapore in the form of 1 day and a half events. And again, we're upgrading our Hong Kong event to a 3-day event. A lot of you in the room might have never been to Asia. They were quite keen to explore Asia. Some are skeptical about the whole IP laws, regulations around Asia. And that's why we're sticking with Hong Kong. I think Hong Kong has the best, or at least one of the best mediators in between the West and the East. And there's a lot of capital there, all who are quite keen to invest in Hong Kong. And even when it comes to the local ecosystem there, both public and private healthcare ecosystems who are quite keen to invite the West over, Europeans, North Americans, to be able to find Hong Kong as their base and eventually from then on expand into the rest of Asia. And finally, obviously close to our very hearts is Malta, which is where it started from. Again, this was just meant to be simply a side gig for me. When I started this out, actually in the first year, it was done in parallel with surgery. So I was trying to manage my hours in theater and at the same time trying to run to the office to start building something. And sometimes I do wonder, like if I knew what I was going to go into, the whole discussions, going up to my parents. I'm a first generation medical doctor, so for them, they've invested most of their whatever they could to take me to the best schools, private lessons, to then eventually be able to become a medical doctor, and I'm the prime jewel of their family, together with my brother, because I'm seeing him here. But it was quite a big step to be able to take that risk, and I do think it's finally pulling off. We're very much motivated to continue connecting more startups with capital, and even more so help more startups get to where they want to reach. The industry can be quite cruel. It's a very fast industry. If you're not succeeding at the rate the investors and the market wants you, they're gonna bear you down. And some of the ideas that are bared down are all very useful ideas, are all very valuable ideas to the patients, to the relatives, and that's something that we're very passionate about. We're filled in with 2 full days of discussions, panels, keynotes, government people joining us, from the Prime Minister who's going to be joining us in an hour's time. And that also goes on to consolidate how much the country is believing in us, and not just our mission locally, but even more so our international mission. Because everywhere we're going, we're promoting Malta as a potential hub for MedTech companies to set up here. It's a European country, euros are currency, strong economy. It's a very much good mix of genomes staying here, and we're not promoting Malta as a potential as a hub for companies to expand their sales revenue, but it's a very good test base from an R&D perspective, from having a European base, from taking on the rest of the world from here. And both the local and private sectors, governments, and the private industry, private hospitals, all lay down the red carpet for companies to do so. And I think that unfortunately we haven't started to tap into this yet. Where we left off 5 years ago, in which here barely no one knew of a medtech industry or a health tech industry, we've moved places, we've moved strides. There's a lot of keen interest in investment, and we're looking forward for the next 3 to 5 years to continue building on what we've started to do over the past couple of years. Thank you, everyone. I wish you generally a good 2 days of connections, pushing beyond boundaries, helping others, sharing your knowledge, and hopefully finding the right investment and the right connection to take you forward in whatever path you followed up. Thank you.
Thank you. Thank you. Dylan Attar, CEO and co-founder of MedTech World. Thanks, everyone. Wow, 2026 will be a very energetic, very vibrant year for MedTech, so we're looking forward to seeing you in all continents that Dylan just mentioned, and we're very excited to see you here today. I have to say it's a big pleasure to see a full audience. I'm sure all of you have rested good. Most of you have traveled from overseas, crossed the ponds to be here in Malta with us today, so we're very excited to have you for the next 2 days. As Dylan mentioned, we're going to have a set of fantastic panels, company showcases, case studies, keynote speeches. We're going to hear from the Malta government in an hour time, and tomorrow we start early at 9 a.m., so make sure to be here also at 9 tomorrow. And tomorrow we're also in the afternoon going to host MedTech Startup Pitch Competition, the most exciting part for these 2 days. Now, I would like to invite you to listen and watch to a keynote address by Honorary Dr. Jo-Etienne Abella, Minister for Health and Active Aging of Government of Malta. Thank you.
Good morning to you all. Welcome to MedTech World, welcome to Malta, and welcome to the Sacra Infermeria. Apologies for being unable to attend in person, but I have commitments abroad. I am honored to address you, and I am very glad that MedTech World has found a home in the Sacra Infermeria over the past few years. Built almost half a century ago, this magnificent building is testament to a past when Malta already excelled in medical innovation and when patient-centered care was practiced here before coming of age. Here, innovative pharmaceutical products were administered, and there was the use of contraptions that broke down bladder stones. These are not very unlike present-day devices. Here, novel suturing techniques to join bowel ends was done hundreds of years ago. Alas, I suppose the anesthetic department must have been woefully rudimentary, and gender inequality was still galloping. But the hospitaliers, imbued with experience on the battlefields, were innovators. They were communicators. This place had visiting lecturers from beyond our shores, and likewise, its faculty held prestigious positions abroad. I'll just mention one, Joseph Bart. Joseph Bart studied here in the 1700s and went on to become the first professor of ophthalmology in Vienna. He became the personal physician to the Habsburg emperors. Malta is still very much fond of new technology. We embrace innovation and digital solutions. In medicine, we take great care to ensure that our services are truly person-centered. We are also painfully aware that excellence in patient outcomes cannot come at the expense of safety, responsibility, and compassion. By inference, excellence in delivering care cannot come without the human touch, without that unique human perspective. What good is a wonderful digital health app when the person that may benefit most is an elderly person with no access to a smartphone? What good is the most advanced bionic chip prosthesis if its cost outstrips the budget of an entire rehab facility? Let's face it, in a national healthcare service like ours, the resources on offer necessarily reflect the country's GDP, its economic performance, and the tax harvest is crucial. I shall give some examples of technological and digital advancements that have served us well, and I shall mention the places we're going. The My Health digital portal has been growing from strength to strength. It is an interface that gives access and informs patients and primary care physicians and specialists in the community. Medical information may be shared across European Union member states. My Health is here to stay, and together with hospital-based systems such as the patient dashboard, guarantees continuity of care. It reduces the application of effort and reduces unnecessary costs while providing a pediment for safe practicing and safe prescribing. I look forward to a new holistic, more user-friendly and more robust digital medical record. Into it, we shall be investing a whopping 100 million euros over the next 10 years. This coincides with our launch of the first National Digital Health Strategy, which is up for public consultation before year's end. Earlier this year, I was very proud to announce the digital transformation in our histopathology department. Yes, our labs in Mater Dei have done away with microscopes. Who would have thought? 20-odd years ago, as I was studying my pathology, I swear, such a development would have been considered extremely unlikely, if not impossible. For the past 15-odd years, Malta and Gozo have been at the forefront of minimally invasive laparoscopic surgery of the bile duct, the bowel, the adrenal, esophagogastric, pancreatic, splenic, and gynecological surgery. We pioneered, audited, validated, and recently published our own versions of minimally invasive esophagectomy. Around 2020, we embarked on robot-assisted surgery, starting with prostatectomy. Then in 2023, we started offering colorectal, upper GI, and pancreatic robotic surgery regularly. This year, we performed our first 15 gynecological resections, and we look forward to further our robotic capability in the coming year or two in order to open up this exciting service to ENT and orthopedics. I look forward to the introduction of robotic assisting compounding in our hospital pharmacy in Gozo next year. This, together with drone delivery of pharmaceuticals and samples, will change forever the logistics inter-hospital, Mater Dei and Gozo General, Mater Dei and the Chansomoran hub in the south of the island. With regards to AI, we employed AI-enhanced endoscopic imaging some 4 years ago. We eagerly await the new generation AI-assist endoscopes, which have the potential to improve colorectal cancer screening. We aim to lower the entry age to 48 years this year and down to 45 years over the next 3 years. AI applied to radiology will revolutionize the service, so much so that our project in breast cancer screening shall lower the entry age from the current 51 years to 45 years. This is expected to have a huge impact on early breast cancer diagnosis and prognosis in our country. I am very proud of our novel 1400 urgent helpline for streaming and referral. This ultimate telemedicine project has already assisted over 11,000 patients since May. And the final phase in its implementation is the application of AI. These are truly exciting times, but a word of caution. Innovation is marching alongside the ugly side of social media, litigation, and out-of-court settlements. how well prepared, how robust are our standard operating safeguards and legislation in the face of this. And in parting, when we discuss new technology, we always seem to think of the person needing the care, our patient. This is how it should be, mind you. We are all caregivers after all. But what is to become of the care of the caregivers? Are we caring that well for our workforce? We are, all of us, prone to the same physical imperfections and ailments, just like our brethren. A recent WHO survey across European countries has confirmed what we've known, but perhaps never admitted. We are prone to anxiety, loneliness, depression, as much, if not more, than the average population. My proposition is work on innovative technology, work on digital solutions that enhance the healthcare workforce. Solutions that prevent, preserve our physical health. Solutions that help us cope better with our stresses, that avert crisis. And finally, a gentle nudge to check out the 4th edition of the Med in Pharma Symposium here at MedTech World tomorrow, the 14th. This year, it boasts a truly outstanding and star-studded lineup. With that, let me thank the organizers and let me wish you all a genuinely productive conference. Good day. Good morning to you all. Welcome to MedTech World.
Many thanks for the minister for the address. Hopefully next time he will be able to join us in person. While we're getting the stage ready, I would like to give you a heads up about the next panel, the first panel of today, that is going to focus on building and scaling MedTech startups with limited funds. When the resources are constrained, what it takes to make the fundraising smart, what to focus on, how to strategize partnerships, and create innovation in the conditions of limited funds. Now, I would like to start inviting to the stage our panelists for the first panel. So I think we are already set for the chairs and the microphones. It's the first panel of the day, so we are very, very excited to welcome our first speakers of the day. So, ladies and gentlemen, Dr. Hubert Zaitchik, CEO and co-founder and partner of Health Wildcatters. Ian McCulley, global head of MedTech of Morgan Latif. Ken Nelson, partner at MedTech Advantage Fund. Shahira Yansi, CEO at Research Lifecycle Solution. And Umayma Ahmad, CEO and co-founder at 52 North. Please give our panelists a warm round of applause.
All right. Appreciate being here, everybody. First one of the morning, so appreciate everybody making it here today. And I just wanted to say something before we start. This is my second MedTech Malta, and I just absolutely love this historic place that we're doing, this building, and really wanted to thank Dylan Attard. The fact that Dylan did all that schooling to go through to be a surgeon and then gave all of that up because of his passion for advancing care is really incredible. And I've gotten to know Dylan very well over the past couple years, and his passion for doing this is truly incredible. The events he's doing around the world are really amazing. I was a part of MedTech Dubai this year. Another great event. Highly encourage you to go to these other events with Dylan. And he does a great job with Yulia and the rest of the team. So Dylan, thank you so much for doing this. As startups and my background, so I was a implantable defibrillator pacemaker person first at Guidant and Boston Scientific. and was there for about 10 years, and then spent the back half of my career building what have become three of the four biggest players in the world in cardiac digital health and remote patient monitoring. The first was a company called iRhythm, which went public, and the second company called Biotelemetry, which was acquired by Philips, and then the third, Barty Diagnostics, which was acquired by Hillrom and Baxter, all in the cardiac patch monitoring space, and now on a handful of boards, on the Innovation Advisory Board for both American Heart Association and Heart Rhythm Society. I'm on a handful of public company boards, handful of private company boards, also invest in companies, but extremely passionate about this ecosystem that we're all here for today. Involved in a number of startup accelerators, including Health Wildcatters, and we're lucky to have Hubert Zajic here today, as well as MedTech Innovator, and have really collaborated with Paul Grand to help build that out over the past few years. But would love to start out with some introductions, and then we'll jump right into it. So maybe we'll start with Hubert.
Thank you. Thanks for having me. And it's a pleasure to be here in Malta. I'm from Europe originally, from Austria. And so it's great to be over here. Health Wildcatters is a healthcare seed accelerator. I started out similar to Dylan as a physician, and eventually drifted off into research. And now I'm doing work on startups, so I'm a startup doctor now. And startups in healthcare accelerators are always at the very beginning, at the bleeding edge, at the funding gap. And so we'll have a good time talking about this topic here today. Just as a snapshot, we're in Dallas, Texas. We've invested in 130 startups from 12 countries and 40 states in the United States, and those startups have gone on to raise over close to $400 million. So I'll go ahead and hand it over to you.
Thank you, and likewise, pleasure to be with you all today. So I'm Ian, I'm Global Head of MedTech at Morgan Latif. We are an executive search firm that help startups and scale-ups with attracting the right talent at the right time. I've been in the industry for just over a decade now, and my passion really lies in trying to transform the way executive search can add value, so moving away from kind of transactions to create meaningful impact for people, businesses, and the MedTech community. So, as I say, definitely excited for the conversation today.
Yeah, good morning. My name is Shahara Yancey. I am the founder and CEO of Research Lifecycle Solutions, and we are a global consulting firm that supports early, emerging, and startup MedTech companies, really with the commercialization. So we focus on your regulatory as well as clinical. By background, I've held leadership positions at Medtronic, Stryker, as well as Smith & Nephew, where I was the head of clinical and regulatory. So I've been in the industry about a little over 20 years, actually. So Research Lifecycle Solutions was founded with the mission of helping startup companies achieve success.
Good morning, everyone. My name's Emima. I'm CEO, co-founder of 52 North. We are a spin-out from the University of Cambridge, with a platform which is low cost and portable that measures cells. We've boarded about $12 million in funding to date, half of which has been non-dilutive, so very relevant for this panel session in terms of looking at creative ways of getting over the line. We have two core products. One is in the cancer space, so helping to identify cancer patients at risk of developing side effects from their treatment, particularly sepsis. And the second product is something we're co-developing under the NATO Diana Defense Accelerator Program, which is quite a different use case, but again, just talks a little bit to the sort of the need to be creative, but also look more broadly at technology. So really excited to be here.
Great, thank you so much, everybody. I think when you think about startups in general, money is always tight. You always have limited budgets. And when you think about the most critical elements of success, at least in my opinion, having been fortunately involved in a couple of companies that did okay, I think that the real true competitive advantage that these companies had was the people. So it all starts with the right people and then building the right culture. Such an important thing, especially when there's limited people within the company. your first couple hires are absolutely critical. Sometimes you have people in your network, sometimes you don't. But maybe we'll start with Ian as somebody that's what you focus your career on. Let's talk about the importance of finding the right people. How do you do it successfully? And when you don't have the right candidates in your network, what are some of the things you can do to find those individuals?
Yeah, for sure. So I think we've all heard the same saying over and over again that an A-grade team will do more with a B-grade product than a B-grade team with an A-grade product. And I think actually finding the right people at the right time is critical. What we're trying to do is be more consultative with that. So sometimes, as you say, it might be that actually now isn't the right time to hire. If it's just that you've got a regulatory gap, there are great regulatory consultancies. There are other ways, I guess, that you can plug gaps within your team. But when it comes to finding the right hire, and you want to lean on, I guess, utilizing external partners, things like these events, these are great. It doesn't have to be, obviously I'm biased, I'd love you to work with us as an executive search firm, but you can network. You can find people in the room that share ideas and share your values. And I think the values piece for me is a non-negotiable. So start building your value proposition from day one. And the pitch for investors is not too dissimilar to your pitch to trying to attract the right talent as well. So I think for me, as I say, the recommendation is to utilize the resources around you, utilize partners that there doesn't have to be a cost involved in everything that you're doing. And when funds are tight, the more creative you can be with that, the better.
So when you think about doing that and you get the right people on board, and then you think about how do you increase your chances of success? As somebody who's gone through a couple accelerators, I went through MedTech Innovator, which I highly recommend for you startups in the room. Also went through one called Health Tech Arkansas, which is now HeartX. So if you're a cardiac-focused company, I recommend that one also. But when you think about expanding your network, when you think about trying to figure out the right people to bring onto the team, the right consultants, I highly recommend you look at, as an earlier stage company, incubators and then eventually accelerators. And there's a difference between the two. There's lots of different types of incubators and accelerators. But maybe we'll have Hubert talk about this a bit. We both live in Dallas. I've gotten to know Health Wildcatters. It's an amazing accelerator in Dallas, earlier stage. But when you think about accelerators and incubators, can you kind of explain the difference to the group just so they know that? And then when do you recommend people apply to try to get into something like Health Wildcatters?
Yeah, thank you, Ken. I mean, first of all, there are no rules, there are no certifications, so anyone can call themselves an accelerator or an incubator and use it interchangeably, and it's still somewhat the Wild West in that regard. I did author an article in Entrepreneur Magazine on that topic a while ago, actually, and they've not pulled it down yet, so I guess it's something there holds. But incubators generally are first, so incubators are generally at your university or at your place of the discovery or in some sort of a municipality. They're usually not necessarily, some of them are now, but cohorts driven, which means they have, when you come up with something, they're here to help. They're going to give you space, they're going to give you some advice, they're going to give you even maybe a little bit of money, but generally not competitively. So you're just, I would say you're one of their children. So you're a student at the university. They're going to help you. It's a great way to stretch your dollars. It's a great way to get started. And there's usually a lot of academics there that can help you on the academic piece, and then some business advice as well. Accelerators are generally, and this is my classic interpretation of such, cohort-driven and then also competitive, as in there's private money involved and they're going to make an investment in you. They're going to be on your cap table. So incubators don't usually do that. Again, there's a lot of cross-bleeding between the two, but that's more the classic definition. And you don't start off as one of their children. And in our case, for instance, I think mentioned that earlier, they come from all over the world. And accelerators, too, have a competitive process. So we get over 500 applications on average in the last 3 years. And out of that, you gotta get it down from 500 to 10. So there are investors involved, and you got to whittle it down, and that is already a combination of your scientific opportunity paired with the commercialization chances. And that includes the team. So to that team is incredibly important. I always say it's the shiny object we look at. I mean, it's got to be something that's interesting, right? I'm curing cancer. I'm doing something special with heart disease. But then the second look is immediately, and who's doing it? And if you can't answer that right away with a, oh yeah, man, that's a killer team, then you keep looking and you know, working on it. We can get more into it later, but anyway, that's the basic differentiation, and both have incredible value, and I would certainly encourage people to look into that, especially incubators are often local. So that means there's a good chance there's something available in your region, and you can get started with a very low budget. And then accelerators draw from all over the world, in our case, all over as well. And so that's a bit the next step then.
So thanks, Hubert. One of the topics we talked about yesterday, which is always a big topic of discussion at these events, is fundraising. And one of the things that I like to really dive deep on is non-dilutive funding. I don't think we do that enough. There's some companies that do an amazing job of that. I'll highlight one that I'm on a board of called Epitel, which has raised something like 14 to 16 million of their first funds were all from non-dilutive sources. So people do it. It is available out there. There's another group that's raised 32 million. Casey Boutwell's company, I think it's in Velo Medical, I can't remember exactly the name, but Casey Boutwell's company raised 32 million from, I think, military non-dilutive funding. 20 million of that they were able to convert to revenue because they were contracts, so grants, but contracts for military funding, or the military funding that they were able to use as revenue, which is also amazing. But let's talk about non-dilutive funding for a minute. What are some of the sources? What are some of the things that the group has done and seen successfully done from startups?
So from my perspective, so we've probably utilized a few different avenues in terms of non-dilutive. So we've brought in about $6 million in non-dilutive since we were founded. And I think there's sort of two aspects to this. One is sort of ensuring that one thing you don't want to do when you're looking at non-dilutive is actually divert your focus as a business, because it is very tempting. There are calls or challenges put out there. We're UK based, so for us we had a lot of money from the government, sort of Innovate UK and SBRI healthcare, but then we've also had funding through programs like the NATO Diana Accelerator, and I think one of the key pieces of advice I would give around this is just while sometimes people may think it's a distraction, because you're sometimes proposing something slightly different to what you may be doing, actually it's a really good opportunity at zero risk to effectively try something new. And it enabled us, these non-dilutive opportunities, one, have enabled us to extend our runway significantly because, as you said, it's about how you then apply a lot of that funding. You can apply to your core business plan. It doesn't necessarily need to be new work. It can often be things that you already plan to do, and you're categorizing them within the scope of the project, which is completely fine and expected in most cases. But in some ways, it's enabled us to move from a single product company to being a platform play. And that's been really exciting, and not something we could have done with equity funding alone, because our pre-seed and our seed round were both focused on our core cancer product. And so, you want that to remain the focus of what you're doing, and that's what your investors will expect of you, your board will expect of you. But looking at opportunities like this, and I think gives you the opportunity to actually prove to your investors that there are other things your technology can potentially do, and really get their buy-in by using external funding before they then decide it's worth putting money into themselves or actually diverting time of the team. The only thing I would say is that to exercise a bit of caution in terms of time of the team. If you're limited funds, you've probably got a pretty small team, and you've got to be careful about putting too many applications out there. You can of course work with people who can help you write these applications, and there are a lot of companies, and I'm sure here as well, who can help with that. Just to echo your point, Ken and Hubert, around sort of accelerator help. We were on MedTech Innovator a few years ago, and it was fantastic, and it was a very, very cost-efficient way of getting a lot of local market knowledge. which we otherwise would have had to pay for, whether it's reimbursement or otherwise. And that was it was a game changer for us going on programs like that. But generally, if you can focus founder time on these sort of new opportunities for non-dilutive, and then bring other people in when you've got them secured, I think it's a very, very fruitful way. It's been our savior.
Yeah, great feedback, and especially now when it's a difficult fundraising environment, I think non-dilutive funding is definitely an area everybody needs to put some time into and try to get those funds, because at the end of the day, if it's not taking anything away from the company, why would you not spend time on getting non-dilutive funding? But there's too many companies that I know of that don't do it for whatever reason. I know it's difficult, but why would you not be going after those funds?
I think one of the common misconceptions is, and it's very not founder mindset, but I have heard it from founders, is we tried once or twice and we didn't get there. So much of this, and I've sat as a panelist, I've sat as an assessor in some of these grants, and I'm sure many of you have as well. But really, a lot of it depends on the assessor you get, how much coffee they've had at the point they review your application, how their week is going. It's just the nature of these things. So it's persistence is key.
All right, so you've recruited a great team, and then you've gone through a couple accelerators, and you're feeling pretty good about the company. You raised some capital, maybe hopefully some non-dilutive capital. You're ready to do pivotal studies. What we see over and over and over again is people don't design the study protocols effectively. So either they've only designed it to get FDA clearance or CE mark, and they haven't thought about payers, or maybe they've thought about payers, but they haven't thought about, can they actually get physicians to use it based on how they designed the study. So Shahira, tell us, what's your experience been? What do you see out there, and how do you effectively help companies make sure they don't make those mistakes?
Yeah, and that's a very good question, and a very good segue based on what the panel has talked about thus far. So I will start by saying, as a founder, as an innovator, make your dollars work just as hard as you worked to raise those dollars. It was not easy. So when you are a startup, the first thing we do when we work with founders is develop a commercialization strategic roadmap. This is what I recommend for anyone, whether you're a startup, whether you are emerging, stop what you're doing and develop a strategic roadmap. You would not build a house without a blueprint, right? So it's not about understanding as you go. When you have limited funds, when you have limited capital, you have to utilize those capital very efficiently. So first, understand there are 5 key milestones that any founder has to achieve in order to succeed. The first one, fundraising. Well, you're fundraising throughout the entire process, but first is fundraising. Next, you have to develop the product. Once you develop the product, you have to get the product to market. So we're talking regulatory. We're also talking clinical within that, because you're going to need evidence, whether you need it at that time to get it to market or if you need it later. It's not a matter of if you need clinical evidence, it's a matter of when you need clinical evidence, and I'll dig into that in a second. But after you get market access, you have to think about market adoption. How am I going to get this product utilized? So if we go back to fundraising and not having a strategy for that, you confuse investors. What are you raising funds against if you don't understand those key milestones? So when I talk about making your dollars work for each one of those milestones, developing a roadmap, understanding the timeline, understanding the cost of each of those items, and that's how you implement forward. So while you asked me a question about clinical or / regulatory, it's really understanding that regulatory and clinical are the cornerstone of the entire process. So if you're in fundraising, the investors, they're not investing in your hopes and dreams. They're investing in when are you going to get to market, how you're going to get to market, what is the return on investment. In order to know those things, you need to know your regulatory and clinical strategies. So that's just kind of a high-level point. But to your question about developing the clinical studies, every clinical study must be scientifically valid. What I am seeing a lot in the industry with founders is that they're running clinical studies before regulatory input, which causes a lot of rework. So you have to have a strategy before you do that. So scientifically valid, and it needs to be executable. Every clinical study must answer a question. You have to know why you're doing the clinical study. So that's kind of the high level of how we support and the things that you should know in terms of regulatory and clinical.
Great. Thanks for the feedback. Great answer. So when you think about all the startups in the room, and at every point in every startup, you get to a point where you've got no money left, you have very limited funds, you're trying to figure out where to spend your time. What do you, this is for the group, so anyone can answer this question, but limited funds, limited time, limited resources, what are some of the most impactful things you think people should be spending their time on?
Me? Oh, okay, great. So most impactful, as I just talked about, understanding that regulatory, again, is the cornerstone of what you're doing. That anchors every piece, again, from fundraising, from product development. You still need to understand regulatory, right? You need to know how to develop. Of course, you want to know how to develop the product based on the market, but how am I going to get this product actually approved? So you still need to know your regulatory components. When you do market access, whether you're working with FDA, a notified body in Europe, again, that's regulatory. When you're doing clinical, again, that's regulatory. No one runs a clinical study for the fun of it. You're running a clinical study because you're trying to get regulatory approval, or you're trying to expand claims, or you may run a study for exploratory to understand your product a little bit better. But at the end of the day, it's about compliance and regulatory. Market adoption, that's still regulatory and clinical study. You need regulatory to expand. So I believe that you should spend the most of your time and funds, because this is the most costly part of getting to market, is your clinical. That is not the time to cut corners. You should spend your time understanding your regulatory strategy and what evidence I need to convince the market to use the product. You can build a beautiful product, the most shiny, sparkly product, but if it's not being used, who cares?
And if it's not FDA cleared or CE marked, then you can't commercialize it, right?
I would probably just add to that I would start from the perspective of, as a startup who's been there, who's had £13,000 left in their bank account and not been paid for a few months, I think the place to start is looking at what your investors are looking for and what does their due diligence look like, and have you ticked enough boxes in each of those categories? So including regulatory, including financial DD, what's the due diligence that they do? Reimbursement, have you shown something? And where you've not ticked the boxes, what's the least amount of work that you can do to get the most value? And in some cases, like for example, most investors will want to see something around US reimbursement. And most European companies probably haven't really gone there. They've probably attended a few seminars. But you can pay less than $30,000 and get a great strategy in place to a consultant. You don't need to hire somebody to head up commercialization at that stage. So that's a very sort of lean way of then ticking the box so that the investor feels satisfied that you have actually hit that part and you have a plan. And so to me, it's sort of, I would be focusing on, with limited funds, what is the least and most sort of effective way of ticking those boxes so that you can raise and extend your pathway?
I mean, first of all, it's not if, it's when it happens. In almost every startup's life, this is going to happen, and it's going to be the true test of your team of what you're going to do about it. So number one is, of course, can the team sustain itself with limited funds, with limited ability to pay? I mean, as a founder myself, I didn't pay myself either when I got Health Wildcatter started, and that's just a fact. So are you in a position to do that, and can you, I think that we're getting shut down here, and can you make it happen? But ultimately, it's about the resourcefulness, and the question is, if you circle the wagons trying to figure out how can you move forward, I mean, you're really in a pinch. Who are your friends? How can you convince them of, like you mentioned, the milestones that you can put in place for them to be excited about the fact that you're still of high potential, but in a rough spot at the moment.
So apologize, we're out of time. We could talk about this for a lot longer, but appreciate all the feedback. Thanks, panelists, and enjoy the rest of the week.
Thank you.
To the first panel of the day. And now it's our big honor and pleasure to prepare the stage for the opening ceremony featuring the government members of Malta. We would be getting the stage ready in a minute. Okay, welcome. Ladies and gentlemen, welcome again to the 5th edition of MedTech World Summit here in Malta, in Valletta. We're here today on this fantastic island that has long served as a bridge between continents, a nation small in size but vast in its ambition. Malta continues to stand out as a destination where innovation truly meets opportunity, where talent and technology and trust converge to shape the industries of tomorrow. From growing life sciences sector to dynamic digital economy, Malta has really built an ecosystem that thrives on collaboration, creativity, and forward thinking. And hosting MedTech World is yet another reflection of this vision, one that places our country firmly at the heart of global healthcare innovation. Now, without further ado, it is my big honor and pleasure to invite to the stage co-founder and CEO of MedTech World, Dr. Dylan Attard.
Dear Prime Minister, Honorable Minister for the Economy, esteemed guests, fellow government partners, friends, colleagues, it's a pleasure to be here with you again after this morning's opening keynote. For me, for someone, again, like how I've started this 5 years ago, 6 years ago, from a theater room at hospital to eventually thinking it's just going to be a one-day annual event in Malta, to eventually it being a 3-day event, and even more so being rubber stamp supported and by the government, the Prime Minister and the rest of his team, giving us nearly any help that we could ask for, from when we're introducing them to fellow international partners, to anything that we're locally, and even more so taking when it comes to our dreams, like the whole vision of making MedTech Malta truly a MedTech Malta. As I was saying earlier this morning, we generally see the potential of Malta to be the prime jewel of the Mediterranean when it comes to the pure MedTech, health tech industry, from an R&D perspective, from an investment perspective. We're a European Union country. We have a very strong economy, and we're very close to the local partners and key opinion leaders. Like sometimes I message my significant others, friends, and they take hours to reply to me on WhatsApp. I message the Prime Minister on WhatsApp, within 20 minutes he replies back with anything that I need. And for that I'm truly, truly grateful. I'm pretty sure you have the whole country and the rest of the world chasing you for one thing or another, and I can't be ever more grateful for that. Thank you, everyone. Thank you, Prime Minister. Thank you, Mr. Silva-Skembri, for all the help you've done. Looking forward to continue working together for the next couple of years in which we're shifting from just being purely an event being organized on the island, but delivering on what we've promised from day one, nurturing a local MedTech and health tech industry. Thank you, everyone.
Thank you so much, Dr. Attard, for your address and for your commitment to placing Malta on the global MedTech map. Now, I have a big pleasure to welcoming on the stage the Minister of Economy, Enterprise and Strategic Projects, Honorary Silva-Skembri. Please give a warm welcome to the Minister. Thank you.
Honorable Prime Minister, Dr. Attard, distinguished guests, industry leaders, today's gathering reflects something important, that the lines between businesses, healthcare, and technology are no longer separate. They are coming together, creating new opportunities, new industries, and new ways to improve lives. Across Malta and around the world, breakthrough medical research, digital innovation, and entrepreneurship are transforming the way we grow our economies. And here in Malta, we are not standing on the sideline of that change. We are part of it and determined to stay at the forefront. And this is what Malta Vision 2050 is all about. It is looking beyond the present and working together to build a future where innovation strengthens our economy, opportunity is open to everyone, and progress is powered by our people. Our journey of digital transformation was built on clear policy choices. We made deliberate decisions early on to invest in connectivity, to nurture digital skills, and to build the right infrastructure. Today, those choices are paying off. They're not just improving efficiency, they're creating opportunity, quality careers, high-value sectors, and new businesses that are taking root and thriving here in Malta, on our island. Our progress in digital transformation has also strengthened the foundations of Malta's growing MedTech sector, a field that sits on the crossroads of two of our greatest strengths, enterprises and innovation. This growth is reflected in the continued success of companies such as Pharmadox and Baxter, both of which have expanded their operations in Malta. This investment is a sign of confidence in our skilled workforce and stable environment, and a reflection of Malta's reputation as a trusted place for high-quality manufacturing and healthcare. This is why we have established the Digital Innovation Hub to give startups and innovators the tools they need to grow. We have also invested in the National High Performance Computer, a powerful resource that enables advanced data analytics, AI-driven medical research, and precision diagnostics. It gives Maltese researchers and companies access to the same level of technology found in leading international centers, allowing, therefore, innovation developed here to compete on a global stage. We are also introducing a 175% tax benefit on eligible research and innovation expenditure. We want companies to consistently invest in research and innovation, turning knowledge into value and bringing ideas from the lab to the market. To support this growth on the ground, Indus is developing a modern facility for enterprises involved in health products, pharmaceuticals, light industry, and biotechnology, including marine biotechnology, a field where our island, surrounded by the sea, can become a very good point of reference. All these efforts, from empowering startups and research to investing in new space and infrastructure, help us building an environment where businesses have the freedom and confidence to grow. The MedTech sector captures this perfectly. It's not only creating quality jobs, but meaningful careers that reflect the skills and ambitions of our next generation. At the same time, Malta continues to strengthen its global connections, building partnerships and opening new opportunities for collaboration. At the heart of all this lies something far more important, their infrastructure and investments. It's our people. Behind every device, every code, every research paper, there is a human story. A patient whose life improves, a researcher who refuses to give up, and an entrepreneur who is ready to take that risk. And behind them stands a system, one that empowers what they can achieve, and that is Malta. Together, we are shaping a future where technology serves people and where businesses drives positive change. Because when we work with purpose and we believe in the talent of our people, there is no limit of what we can achieve. Thank you, and once again, I thank Dr. Attard and all your team for this wonderful experience that you're doing, and I commend your instincts in trying and investing in this sector. Thank you very much, and I will go for success.
Many thanks to Minister Schembri for leadership and for support. And now I invite you to take a look in the future, to look ahead and join me in watching a short video clip showcasing MedTech World Global Journey and Roadshow in 2026. Let's have a look.
In 2026, the world becomes our stage. 4 continents, 4 destinations. One movement connecting the global MedTech ecosystem. The journey begins in Dubai, the pulse of the Middle East, where innovation never sleeps and ambition builds the skyline. From the 11th to the 13th of February, the Intercontinental Festival City hosts MedTech World Dubai, setting the tone for what's ahead, where ambition, technology, and opportunity converge in one of the world's fastest-growing MedTech hubs. Next up, North America, the gateway to the Americas, where ideas are funded, piloted, and scaled. From the 11th to the 13th of May, MedTech World conveys global investors, US health systems, and breakthrough founders for 3 days of connection and collaboration, from the pitch stage to curated forums spotlighting technology ready to scale. From there, we journey east to Asia. What began in Singapore and rose in Hong Kong now evolves into MedTech World Asia 2026, uniting the region's brightest innovators, investors, and entrepreneurs for 3 transformative days of exchange, insight, and collaboration. Our journey concludes in Malta, the birthplace and beating heart of MedTech World. From the 11th to the 13th of November 2026, the Mediterranean Conference Center in Valletta opens its doors to a UNESCO-listed city of stone and sea, a setting where history and innovation stand side by side. Set between Europe, Africa, and the Middle East, Malta becomes a crossroads for global dialogue, where perspectives intersect and ideas evolve into action. Panels, roundtables, and working sessions ignite conversations that ripple far beyond the harbor, turning vision into strategy and connection into progress. This is MedTech World 2026, where borders disappear, connections spark change, and the next chapter in MedTech begins.
Thank you. And now, to officially declare MedTech World Summit 2025 in Malta open, I am very honored to welcome to the stage the Prime Minister of Malta, Honorary Dr. Robert Abella. Please.
Good morning to all, Honourable Minister Silvio Schembri, my dear friend Dylan, innovators, dear friends. It is indeed a great privilege to welcome you to Malta, and may I say what an exposition of innovation MedTech Malta has truly become. I look forward to visiting your innovations after these brief remarks. I would first of all try to kick off by congratulating Dylan for the inspiration and hard work he has put in to make this incredible venture a success, and in turning his original startup idea into the community of bright minds and doers that is today's conference. His personal grit and determination are indeed a testament to what Maltese talent and perseverance are all about. And why not? An embodiment of the why you should consider us over other jurisdictions as you decide where to place your investment. But let me start by answering one important question. Why Malta for MedTech? Malta's vision is clear: to establish our country as a leading European hub for MedTech, life sciences, and digital health, a place where groundbreaking ideas are transformed into real-world solutions that improve lives. It's a target that is central, as Minister Schembri mentioned before me, central to Malta Vision 2050, our national strategic foresight project, which shall be launched in the coming weeks. It reflects our belief that the future of health lies at the intersection of science, technology, and humanity. As government, we are fully committed to enabling this transformation. We continue to invest in research, clinical innovation, and digital infrastructure, providing the foundation for sustainable growth. We have introduced targeted incentives and support frameworks that empower startups, scale-ups, and investors to thrive in Malta. And we are ensuring regulatory clarity and agility so that technologies reach patients faster with no compromise on safety or ethics. Yet, we know and acknowledge that policy alone is not enough. True innovation flourishes when government, academia, industry, and healthcare providers work together in a single collaborative ecosystem. Institutions such as Malta Enterprise, the Malta Life Sciences Park, the University of Malta, and the Ministry for Health are working in harmony to create an environment where ideas grow, scale, and deliver global impact. People, of course, remain central to this mission. We are investing in education and workforce development to nurture the next generation of scientists, engineers, and healthcare innovators. Through partnerships with international universities and research institutions, we are equipping our workforce with skills in biotech, medtech engineering, AI, and digital health. We are also ensuring that Maltese talent continues to lead in the global innovation race. Malta's agility is one of our greatest strengths. Our country serves as an ideal testbed for digital health and real-world data platforms where innovation can be trialed and refined in live healthcare settings. Across our hospitals and clinics, projects in AI diagnostics, telehealth, robotics, and digital hospital transformation are already improving patient outcomes. Our strategic positioning remains a clear advantage. At the crossroads between Europe, the Middle East, and North Africa, Malta is a natural gateway for international collaboration. We are strengthening partnerships with research centers, hospitals, and global MedTech companies to accelerate innovation and the development of new treatments. Public-private partnerships with the University of Malta and Mater Dei Hospital, our national health service provider, are turning scientific discovery into market-ready healthcare solutions. While rising investor interest, particularly in oncology research and AI-driven diagnostics, reflects then Malta's growing reputation as a trusted EU base for high-value innovation. I hope that with this brief and quick overview, I have managed to elicit your inspiration as to what can be done here. Today, I invite you all, innovators, entrepreneurs, and researchers, to build the future of healthcare from Malta. Speak to our Malta Enterprise team present here, to Minister Silvioš Kembri, and all of our local companies and stakeholders. I am certain that you will find at least one way to collaborate with Malta, and as Prime Minister, I invite you to make that deal, to trial that project that brings idea to life. As together, I believe and am convinced that we can truly create technologies that heal, empower, and transform lives across the world. I wish you all the best of luck. Thank you.
Now we can consider the MedTech World Summit 2025 in Malta officially open. Many thanks to the Prime Minister and the Minister of Economy. On behalf of MedTech World team, I would like to express a heartfelt thanks for their continuous support. Many thanks. Please give a round of applause to the opening ceremony of MedTech World Summit in Malta. This is the best thing about conferences, and especially about conferences in Malta. You get to get in touch and talk to people right here, right now. So make sure to get in touch with the government officials of Malta, with Malta Enterprise. They have a big booth upstairs. And it's amazing to establish meaningful connections and network with people. And my big advice also, make sure to catch up with our amazing speakers that we will get to see on this stage today. Now, we got the stage ready, and we're ready for the next panel that is going to be focusing on European Union and United States regulations. What are the key compliance trends for MedTech? And it's my big pleasure to invite to the stage our panelists and the moderator for the compliance panel. Ainhoa Forteza, Vice President of Regulatory Affairs of MedTech Alira Health. Amra Radzic, Vice President of Global Government Strategy of Viva Systems. Christian Espinosa, CEO of Blue Goat Cyber, and Edwin Lindsay, Principal Consultant and Managing Director of CS Life Sciences, and August Savas, Head of Notified Body of Malta Conformity Assessment. Our dear panelists, please make your way to the stage. We get the stage ready. Grab your microphones, and the floor is yours. Thank you. Legend. Wait.
All right, good morning, everyone. We know we're not as exciting as the Prime Minister, but we really hope to bring some exciting topics here to the forefront. And I'm really honored to be here with these esteemed panelists, and I look forward to the conversation. But we will be focused on compliance trends, and really how to move from a reactive compliance to being more proactive and focusing on what we like to call maybe proactive excellence. Maybe before we get into the nitty-gritty, just very, very brief introductions. Edwin, why don't we start with you?
So, Edwin Lindsay, so I'm the Managing Director, Principal Consultant of CS Life Sciences. We predominantly work with startups, early stage companies, taking them to market with quality, regulatory and clinical.
I'm Christian Espinoza, the founder and CEO of Blue Goat Cyber. We make sure hackers can't hack into a medical device and harm a patient or kill a patient. And we also help medical device manufacturers bring their product to market faster, more cost effective, and more efficiently by considering cybersecurity early on in the process.
So, hello everyone. This is Oğuz Savaş. I am the head of Notified Body MCA. Thank you.
Hello everyone, I'm Ainhoa Forteza. I'm Vice President of the Regulatory Affairs MedTech Department at Alira Health, where we help MedTech companies to develop their products according to the appropriate regulatory standards and enter the US and EU market. Thank you.
Excellent, thank you so much. And my name, as you can see, is Amra Rasik, and I'm the Vice President of Global Government Strategy at a cloud-based software provider called Viva MedTech. So we'll be talking about compliance, but I think I would be remiss if I didn't mention that there is a lot going on in the world these days, right? In the United States, of course, you're all familiar, there's been a shift in administration at the beginning of the year, which has, of course, as every time we have a change, provided for some maybe challenging environment for the time being. There's been a reduction in force at the agency that has impacted manufacturers. Currently, there's a shutdown going on, which means for those companies that are in the audience that are perhaps ready to pursue a clearance or an approval at the FDA are not able to do that at the moment because the systems are, of course, not functioning until the government reopens, and it sounds like that may be happening soon. I do want to reiterate, though, regardless of change, restrictions, what have you, the agency does continue to really stand behind commitment to ensuring that patients have access to safe and effective medical devices in the United States and really worldwide. In Europe, of course, EU MDR seems like it's never ending. We're looking at reforms that will keep us busy and ensure that we have jobs, I think, for many years to come. But maybe we'll start sort of with the first question then. How can medtech companies really strategically balance some of these external pressures to streamline compliance with the critical technical requirements to have a robust quality system in place? Who would like to start first?
I'll start. So I think most startups, early stage companies, we all have to meet the same regulations, whether you're a startup or a strategic corporate company. For an early stage company, startup, the key to it, and I've found over the last 15, 20 years, is having people in position who's going to make decisions fast, and understand that if we don't make a decision, the company doesn't move forward. We can build robust QMS, we can build a regulatory strategy. They're all fairly straightforward if you get a good team involved. But as part of that, we need a team that can be able to make decisions fast and they'll know what the decisions are, but not just worry about what if we get it wrong. Startups need decision makers, and that the rest will follow on if your team is good enough to understand what the regulations are.
Excellent, good. Anyone else? Oğuz, you and I had a really good conversation earlier, and I know for you it's important to have a good sort of culture, structure in place to begin with.
Yeah, maybe I can touch down to the psychology behind it. I think we need to start thinking about creating a culture that is really, valuing the excellence in quality and regulatory. That is important. Sometimes we observe startups in different or the same levels, but understanding and the culture that integrate from the early beginning on the regulatory and quality part, it is really making huge difference that we can observe in the market. For that reason, I think we need to position ourselves in an, let's say, not defensive manner, because you cannot win a game with a defense. So that I can recommend in a psychological standpoint, we need to equip ourselves as much as possible with state-of-art solutions, and we need to stay quick and ahead, that I can say.
I know. How about from you? What are some things to be more proactive rather than reactive, right? When there's so much uncertainty going on and you really don't have control over the environment.
Yeah, it's true. I think that it's difficult to find a balance, no, between being reactive and proactive. I don't know, for example, there are a lot of, not only the regulations itself, but guidances, right? Articles, news, like companies that are just reacting, no, to all this information. It's overwhelming, I think. So I understand it's difficult, no, to find a balance. But, and it's interesting also to hear your view, no, from the notified body perspective, because our view from the industry is the same, right? Like being strategic, try to be proactive more than reactive, but, maybe, try to be more proactive. This example that I was giving about the documentation, no? the overwhelming guidances and information. Well, trying to be proactive from a perspective of understanding beforehand, being up to date on even draft guidelines, no? Or even draft regulations. So have that everything mapped so that you can understand even from the beginning, even if it's not published yet, but you can start understanding, okay, how this will apply to me. You can start with the planning, no? Potential mitigation. So I think that's one example, no, that could apply.
Excellent, good. Oz, I'm wondering if you can comment a little bit. Of course, the notified bodies are facing different pressures, right, to do faster with submissions, to review faster, to ensure that devices can access those patients that need them as quickly as possible. What are you doing to be more proactive from your perspective?
Yes, you're right. Especially at the early beginnings, there weren't much notified bodies available. Nowadays, the issue is somehow being fixed, but yes, you're right. The data is huge, and the regulation is complex, so the notified bodies also react fast. And for that, what we do, every day we're constantly working on creating new modules of digitalization, so increase our digital capabilities, that I can say. And we are also observing how we can adopt AI to the review system, especially for completeness checks and, some primitive assessments, not the detailed assessments. And we are observing how we can use AI in this ecosystem. And also, we find it very useful to have small sessions with the notified body, like you talk to the notified body. So you create 15 minutes of discussion on a specific topic, very structured. So you can have this ongoing dialogues that is also speeding up the system. Sometimes you cannot really come to a conclusion with written documents and so on and so forth. Both parties can misunderstand each other. So we use this, having these structured 15-minute discussions are very useful for that aspect too.
Are you guys using AI today in any aspect?
We are in observing phase. We tried in a demo some of the things. We see it working, but AI is also constantly changing. So we're gonna make a correct decision. Especially in today's world, we should discuss how we can use AI in an automated manner, right? So not only chat box, but how we can use automation with AI. So we want to make the right decision. It can work to a level. The human is always important and always going to be important. But we will use, but we want to use it smartly.
Christian, please.
I think from terms of uncertainty with cybersecurity, it feels very uncertain these days. A lot of manufacturers and startups are caught off guard because the rules were just solidified a couple years ago and the regulations in terms of cybersecurity. And a lot of manufacturers simply don't know, and we're still sort of playing catch up. But there's been a couple cases recently where patients have died because the device has been compromised, so now it's becoming more in the limelight. And part of our mission at Blue Goat Cyber is to raise that awareness, because I feel like in our industry it's an awareness challenge. Medical device manufacturers simply don't know what they don't know, and because cybersecurity is relatively new, not a lot of even regulatory affairs personnel understand the real requirements. So we are doing what we can do to raise that awareness, to help these medical device manufacturers get their product to market much faster and more cost effective, and avoid the frustration of a rejection from the regulatory body.
Maybe we'll stay on the topic of AI just for a moment longer. Advin, anything to add from your standpoint? You have a lot of access to manufacturers. What are they doing with AI, and how is AI being utilized to allow them to maybe be more proactive and sort of focus on the futuristic way forward?
We work with a number of companies with AI. We are struggling with some of them because they think that's the best way forward. It's going to solve everything. All the problems is going to be solved. It's going to make it easier. We're battling not just with the regulatory, but we're battling with the kind of the C-suite people who think this is going to save time, money, people, and it doesn't. We need to be able to educate them that it's a long road, that the AI will need to be educated as well, not just case of run with it and we've got this solution ready to go. It's going to take time. We see it both in manufacturing, helping with regulatory documentation, but also in the medical device as well. All of these will need time. As you look at the regulatory documentation and then into the medical device, it gets more risky. And if it's not right, we can kill people. So we can't rush it. It's going to take time. It's not going to be overnight. From what we see lots of issues. We see the AI going wrong. We see it making the wrong decisions, both internally and on the device. So it's still an education process with the C-suite, because they just see this as it can save us money, it saves us overheads, it saves us resource, and we can get to market quickly.
And it really is not a magic wand. It doesn't solve all of your problems. And I think one of the most important things with AI to keep in mind, of course, is that you need to have your data, your house in order, right, before you can take advantage of it. AI draws from the information that you give it, from the load, right, from the mountain of data that sits.
One of the things we do see is they think they're ready to go to market with very limited data, or they don't have a lot of data there. It's not been trained properly. We see issues with it, failures, but they think it's ready, or it may be different in different countries. They've gone one-stop shop across all the countries, and it differs from the EU to the US to further afield. So it's trying to educate them to actually start thinking early on, how do we control it, how do we control the AI, and how do we control the development, and obviously the training, and how it learns all the time, and how do they keep that going but without it falling down.
I was just with the FDA actually last week. I had an engagement, and something that was brought up really struck me. They said that there's some studies that have been conducted, I believe, with the World Health Organization, but something around 97% of healthcare data that's available, that's out there, is actually not used. It just sits in a mountain somewhere, and only with the information that we do utilize is only about 3% of what's available. I think that's pretty fascinating. I don't know, Christian, maybe you have more insight into that, but yeah.
Yeah, I think we're still a little premature for AI in healthcare. We tend to think about the use cases of when AI gets it right, but there's been several cases where, like a therapeutic app, where someone can get therapy and counseling with an AI-enabled platform. And there's a case recently where there's a suicidal patient. The therapeutic app, after a couple months, told the patient to go ahead and kill themselves. So that's an edge case that people didn't think about, because we always focus on the benefits of AI from the lens of when it gets things right. But like we're used to from a cybersecurity perspective and from an AI model perspective, looking at like what happens if something goes wrong? What happens if this fails or doesn't behave as intended? And I think that's one of the biggest challenges with AI in our industry. Even like the FDA in the United States has this AI engine called ELSA, which you submit a 510K and adjust it and tells you all the stuff that's wrong with the 510K submission, and it's notorious for tons of errors and problems. It's actually creating more work than a human just doing it from the beginning. So I think we need to like step back a little bit and really look at the maturity of AI, and specifically in the use case in the situation where we're trying to use it, and then look at, does it work as intended, and what are the real risks if it doesn't work as intended?
Yeah, I want to focus a little bit more now on maybe digging a little bit deeper into the reactive versus proactive compliance. I just came from a summit. We have our own summit. We had one in Madrid, actually just earlier this week, where manufacturers came together to really look at resources, opportunities. How can you be more efficient, right? How can you take into account that total product life cycle and reorganize, clean up your internal house, if you will, right? Before, so that you are ready to move forward with your submission. So how do you design quality into that total product life cycle from the beginning? And what is the primary function of technology and specifically quality, maybe digital tools like EQMS to get an organization started? We have a lot of startups in the audience here. From my perspective, it's never too early to have a good system in place so that you are ready as you're growing, as you're progressing to be able to execute quickly. What are some other things, and what are your thoughts on that? Maybe Oz, can we start with you?
Yeah, yeah. As I indicated earlier, we observe startups and how they evolve. And as you indicated, the digital solutions, in my opinion, in today's world, should be integrated as quickly as possible. Generally, the general thinking is that you can only have some digital solutions when you're a mature, grown-up company. But this is not the case anymore. And since we have lots of data, human is really becoming, lost in the data. And, regulatory process is too complex. And if you want to hire someone and, teach the regulation, it takes 5 years for them to really understand what the regulation and how it's going to be implemented. So these kind of solutions really makes huge difference. So I can really suggest that, and integrating regulation and quality in the real early phases, and that is making huge difference in my opinion.
Yeah, I know, please.
Sure. It's interesting, this point of view, because it's also difficult sometimes for startups to do this kind of investment, right? Early on, which it's something to be taken into consideration as well. But yeah, I think I agree though, I agree, but it's true that sometimes startups or medtech companies at early stages, they need to find maybe a balance on what to invest early. I agree though that it's a good resource. I think that maybe it's also about changing a little bit the mindset, maybe about using it not just for compliance, or not just for efficiency, but trying to use it maybe as a platform that is able to gather data that you may need for other uses, or for compliance in general, but not just because we need compliance from this perspective, as you were saying earlier, like checking boxes, and we are compliant. And I have one interesting example because we were advising a company that produces orthopedic implants, and it was interesting because they embedded into their electronic quality management system. They embedded in the complaints workflow, let's say, with the design risks that they identified pre-market. And it's interesting because the system is able to track this complaint, right, with which risk you identified at the beginning, and maybe with clinical endpoints as well. So I think it's a change in the mindset of not just it's more efficient or you have everything tracked. It's about understanding how you can use this data for other purposes. So you are not just managing a complaint, right? You are understanding, you are analyzing it and tracking it with your pre-market assumptions and your post-market evidences. So, yeah.
I think one of the things that I see over the last 15, 20 years is with startups is they've been told that they need to have a full quality management system and they've not even got a product, they've still got a concept. It's trying to educate them and say, like, we need aspects of that quality system. As you start to build a design, bring in risk, because the risk is all starting there. What's your intended use? We don't need the whole ISO 13485 at the start. We need small building blocks, because it can be overwhelming for startups early on. And if they're overwhelmed, they will never get to market. I heard somebody saying the other day, they were introduced to an EQMS and they've now got PTSD of the EQMS because it was so cumbersome. So we have to make it streamlined for startups to get to market, to start building their technology, developing it, but not being overwhelmed with paperwork, but getting it right early on. And that's small aspects. So there's EQMSs out there that helps you on that road that are cost effective. It's early stages, but you can build in risk, a small bit of quality, design, and that aspects of it at the start, so it gets them known about design control, risk management, because as they're starting to build it, what their intended use is. That's the key for startups, rather than going, right, we need a whole QMS, spend all their money on the QMS and go, right, where's my product? It's not there. It's a waste of time and money. It's bringing it in slowly, understanding they don't need it. They do get pressures from investors to say, we want 13485, we need a certificate, it makes it look good. It doesn't. It says you follow some records, doesn't mean you've got a device. It has to be fine-tuned to make sure that they understand it. As we go back to building a culture, because a lot of startups have never been in a quality environment, but it's also building up a startup mentality of how do we do it quick and dirty, but do it compliant and do it fast.
I think when it comes to a QMS, the QMS is the system that has your documentation, provides the history, the traceability. From my experience with startups, they often don't have any documentation. So a QMS is not really going to help them. If we step back and zoom out, understanding quality and what that actually means from a software development perspective, it means you document the requirements, the design, changes, all that, not just from software, but in anything with a device. Educating the startups a little bit more about quality and what type of documentation is required to demonstrate that quality, because ultimately those things are what go in the QMS. So I agree with Edwin. I think it's a little premature to implement a QMS because from my experience, it kind of goes back to what I said before. A lot of startups simply don't know what they don't know, and they don't understand the degree of documentation required to prove that quality.
So it sounds like we need to be organized, but maybe a full-blown QMS is not the right way forward, but something to sort of get you, again, getting your house in order. I keep referring to that, but I think that's really important, so that you can scale up as you grow, right?
Small steps. Small steps for them, because they're so engrossed in developing the product that if you give them too much paperwork from stuff that won't even be used until they're closer to the market, they're then going, do we have to use this? Do we have to use this document? It's giving them the key building blocks to take the product to market, as Christian says, give them where the documentation that links to the product, gaining control. The rest is fairly straightforward, common sense stuff. It's the product, what documentation, starting to generate risk management around what your device is, whether it's an implant, whether it's a cyber device, building that in so you're actually thinking what can go wrong early on as you're developing it. You don't need a QMS for that. You need structure. You need some parts of what is a QMS, but not a full sing and dancing one. You give them where they gain control of the device so they can actually get their device to market.
So how do you get that buy-in? So let's say you're more than a two-person company, right? A small startup, but you've scaled up a little bit. How do you get that buy-in to be proactive from your CEO, from the rest of your leadership? If you're a quality manager or quality leader in that organization, how do you get them on board to say, this is really important, we need that structure in place to move forward?
Well, what we do is I'm an advocate and Blue Goat Cyber is an advocate of having the startup reverse engineer the market they want to get to, the healthcare delivery organization they want to sell to, and all the steps required for that. And then, like Edwin alluded to, we should be taking baby steps initially. We can't take giant leaps if we're a 2-person company or 3-person company or we're a startup. So it's important, I know we need to do all these things, but we have to meet the startup where they are on their journey. And that's why I'm advocating maybe a QMS is too premature sometimes for a startup. Maybe all the cybersecurity requirements are too premature. We should start with just what's required for where they are on their journey. And even they've got the constraints from investors, right? They got fund constraints. So we have to consider all that versus try to get them to do everything all at once, which is not effective.
Oh, so I'm wondering if you can comment just a little bit as a notified body when you first got started. What are some things that helped you be organized and kind of get on the right path?
Our notified by journey, you mean? Yes. Well, it's a very specific knowledge because, there are 50 notified bodies in the world. So we are coming with 20 years of experience in this field. We learned too much in the MDD times, and we were a part of discussions when the MDR is being drafted and so on. So it's a real specific knowledge that is, making you move ahead in today. If you want to become a notified, but it takes 3 years. I can particularly say that, it's the history of being, being in the fight.
But also having that community of notified bodies to learn from, right?
Yeah.
And I think that same probably goes for manufacturers who are in the room. So events like this where you can collaborate, get on the same page, learn from one another, and maybe look at what mistakes others have made so that you don't repeat the same mistakes. Any other thoughts on that in terms of how to scale up?
I think the startups need to try and kind of go through the weeds and get to the other side where when they're talking to service providers, they're talking to investors, do they understand that how they work with a startup? Look, a lot of service providers say they work with startups, but they can't, or they've never been through this. A startup is a different world from a corporate. It's a different mentality. So it's like, as you say, coming to these events, educating the CEO on how we can manage it. They're under pressure from investors to deliver as fast as they can. They've got a certain budget, but they want to see get to market tomorrow. But it's then sitting down with them, understanding their problems, understanding what they're needing, and just trying to educate them, giving them. I always try and give them examples without telling who the example's about, and showing them. I've tried to create templates or just kind of example presentations of how you get to market to educate the CEO, even to educate some of the investors to understand that a startup, a 2-man company who's got a great device, or a 5-man company or is scaling up, how do we scale up but without killing people and without killing the company, and not getting to market. So it's sitting down, spending time with them. It might be time lost because you're not getting paid for it, but it's a loss leader for you, trying to educate them and trying to gain their trust. The biggest thing I've seen in this industry is trust. If you lose the trust of your clients, or people hear that you're not very good, you're not going to get there, because whatever you tell them, it's not going to be there. It's results. Yeah. It's results. Startups need results, and I go back to the first thing, they need service providers that will make decisions with them.
That's really good, and I think that's maybe your closing. I know we only have a little bit of time here left, but my next question was going to be maybe the single most critical strategic shift that leaders must take today to convert compliance from a regulatory burden to a global competitive advantage over the next few years. Is there anything else to add to that, Edwin, before I move on?
No,
that's great. Okay, Christian, please.
I think if you can become compliant faster than your competitors, then obviously it's a competitive advantage. So that's why I'm advocating for reverse engineering what you're trying to do, what market you're going into, and what's required, and then work backwards and take the steps in the right direction. And a lot of competitors or viewers that are trying to bring a product to market may not be doing that reverse engineering.
Owes, please.
I don't have anything to add for this. Maybe our time is limited.
Yeah, I completely agree with you all. Maybe something else that I can think of is, as I said earlier, as well as we've been discussing, trying to think more in terms of which evidence in general you need to provide, no? Instead of focusing on, okay, I agree with the step-by-step approach, definitely, particularly for startups, but maybe even if it's not focused on resources overall, but trying to understand from a global perspective, no, which kind of evidence you need to provide, and trying to make it fit all the regions or markets where you are interested. No? So trying to think more from an evidence generation and not just focusing on compliance here and there, no? Although I agree with the step-by-step approach.
So organize, strategize, collaborate, partner. Thank you so much. Appreciate it. Thank you.
Thank you.
Thank you.
You, fantastic panel. Thanks for your insights. Thank you for our compliance panel. Have a great day. Thank you. Well, the next session is a very interesting format. We call it a reverse pitch. We turn the tables and we have investors pitching their value to MedTech startups and highlighting what they bring beyond capital and why founders should actually choose them and not the other way around. So for this interesting activity and the panel, I invite to this stage our investors and startups. Anna Badurska, CEO and founder of 42 Global Ventures. Wait, you can, yeah. Thank you. I think I lost my, all right. Thanks everyone. Greg Madden, you can walk right to the stage and take your seat. Greg Madden, managing partner of SV Health Investors. Chris Yap, partner at Trimway Ventures. Shai Poliker, managing partner at Edge Medical Ventures. And Fred Ginnebaugh, executive in residence at KCK MedTech. Ladies, gentlemen, please have fun. The stage is yours. Thank you.
Reverse pitch, turning the tables.
Good morning, everybody. Thank you very much. And welcome to this special reverse pitch session, where for once it's the investors that are doing the pitching. So my name is Anna Badurska, CEO of 42 Global Ventures, and I'm really delighted to guide this conversation today. Over the past decade, I had the privilege to support hundreds of funders and investors across Europe, US, and Africa. And one thing that I learned is that great things happen when actually the founders and the investors stop trying to impress each other, but start building together. And this is where the lasting innovation begins. And today we are turning the table. Instead of founders pitching their hearts out, we have the investors that are taking the stage and explain how they support founders beyond the capital, how they support their journey, what makes them say yes or eventually walk away. So I'm joined by 4 remarkable investors, each bringing unique perspective on building, on scaling, on exiting medtech startups worldwide. Just a quick introduction, Greg Madden, managing partner of SV Health Investors, a leading health-focused firm with over $2.5 billion under management, investing in medtech and health-enabled health tech ventures. Chris Japp, partner at Tramway Ventures, a Santa Fe-based VC and a former MedTech executive with over 35 years of global leadership in corporate and in startups. Shai Poliker, managing partner at Edge Medical Ventures, an Israeli and New Jersey-based VC that Shai has founded after leading a MedX accelerator, where he helped to build a portfolio of around 150 million MedTech startups. And finally, Fred Guinebo, executive in residence at KCK MedTech, a later stage MedTech growth investor that he joined after leadership roles in GE Healthcare, Guidant, and where he focused on strategy, innovation, and commercialization. So welcome, gentlemen. So here is how the session will unfold. Each investor will have a few seconds, minutes, to reverse pitch themselves, just like a founder would. Then we will open a broader conversation on what makes an investor-founder partnership a great partnership. And because it's Malta and the organizers, they love to make things interactive here. They have asked upfront their online audience a couple of questions related to today's discussion that we will unveil as we go to just check if the perspective of our panelists matches with the views and the sentiment of a wider audience. So with that, let us get started. To kick the things off, I will ask each of you two very simple questions. So the first one, how would you elevator pitch yourselves? And secondly, if your fund was a startup, what would be your unique value proposition? So can we start with Greg?
Sure, thank you, Anna. So my group is multi-sector and multi-stage focused in medtech and in health tech. We will invest in venture stage, commercial stage, and even buyouts in the segment. We invest in not only medtech, but medtech-enabled services companies as well. And so with that breadth, we're able to see around some corners and see opportunities, and also advise our entrepreneurs in an increasingly complex operating environment, particularly in the United States, which is challenged by costs that are spiraling out of control and increasing needs for creative approaches and business models to deliver solutions to the healthcare system that deliver not only efficacious treatments, but ones that are cost effective and can be accessed by all patients. I think the Prime Minister had referenced this, that what use is a solution if it bankrupts the system or outstrips the budget of a hospital system. So that's where we're focused. We partner with our entrepreneurs. We're thematically driven and executive led, so we know what we like when we're talking to an entrepreneur. We validated that we like their sector. We're not going to have to learn it from them. And then we bring operators alongside us to help and advise them in ultimately making their venture a success.
Good morning, everybody. As Anna mentioned, we at Tramway Ventures are based in New Mexico, which is in the southwest United States. We're very geographic focused. Our biggest limited partner or investor in our firm is the state of New Mexico. So we like to try and find investments or partner with startup companies that are based in New Mexico or have a significant investment here or there. Sorry. So part of my pitch is either investing in companies there or trying to find a way to bring new startup companies to New Mexico. We're a fairly early stage investor, typically seed series or Series A. We invest across the spectrum in medtech, biotech, and health tech. And as part of our value proposition, and we do speak to a lot of companies that say, hey, Chris, if you write me a check, I'll move to New Mexico. And I wish it was always that easy. But what we like to say is where we're located, we have two of the largest national labs in the United States, Sandia and Los Alamos. We have tremendous early stage, very high tech capability for companies that want to relocate there. And what we do as an investor is we help make those connections. We also, very similar to Greg, we work very closely with companies. We always want a board seat. We'll help make connections with corporate strategics, of which myself and partners are very well connected, and help those companies develop along their pathway.
Hi everyone, and thanks for the opportunity. We are also a fairly early stage investor. We would invest in companies that are already in clinical stage. I think when startups talk to VCs, probably 99.9% of their interest is the funding, but we like to emphasize as well our hands-on approach and our support beyond funding. And usually if we don't see some angle where we can help the company, this will be a less interesting situation, I think, for us and for the company as well. Our unique value proposition is mostly in bringing those companies that are ready and ripe for the American market into the US. We have unique collaboration both with the Israeli ecosystem, where there is a vibrant R&D clinical trial activity, as well as with the state of New Jersey, where we have a base and an ability to support both in funding and in infrastructure companies that are just landing in the US, looking for a soft landing and collaborations, and the people on the ground that can help them in all of those stages. So this is mostly, I mean, we would invest in American companies as well, but we are mostly, I think, interesting for global companies, Israeli and others, that are looking to make that kind of cross the ocean step with doing that in a capital efficient way as much as possible. We also own our own venture studio, so we are creating companies with our strategic collaboration, which always are important for the next step of the startups as well. So.
Good morning, everybody. Thanks again to the MedTech World sponsors and creators of this event, and thanks for hosting all of us. About KCK MedTech, which is the firm that I work for, KCK is a late-stage growth equity investor, and we're a bit of a different animal in that we are a single-family sponsored evergreen fund. And so that means our capital deployment is far more flexible and far different from the traditional VC model. We really focus on building big, powerful growth companies, and we focus very specifically on the commercialization risk. Technical, clinical, regulatory risks, reimbursement risks are things that we like to see at least sufficiently retired, if not completely retired. But for KCK, we really like to roll up our sleeves very specifically and get into that commercialization. All of our team are ex-operators. The head of our fund likes to quip that we're first-time investors. That's a little bit of a misnomer, but we are definitely very focused in being deployed within the company. Like Palantir likes to say, we're forward-deployed executives, and I just completed a tour of duty of 4 years within a company, and that's very, very typical for our organization. So with that, we deploy our capital in whatever means that is most beneficial to the company, and we want to be able to partner by being directly in those companies.
Perfect, thank you. I would invest in all of you, personally. So now that we understand your unique value proposition, maybe we can see what the audience take on this topic. Can I ask to pull up the first question? What do you think founders value most from investors beyond capital? And we have directed the answers, so but interesting. Yes, this one, 57%, over half of our audience point to the industry connections as the biggest source of value. I think it's quite true. They must be right. These relations, they open doors to something that eventually leads to the unique, to the ultimate measurement of value, which is a successful exit. So to that, I would love to hear your insights on something that that ties directly to this point, which is how do you help your portfolio companies to prepare for and to achieve a successful exit? And also maybe if you can give an example of one situation where your support truly changed the company trajectory on this way. Chris?
Yeah, sure. Again, we try and help companies as they progress through the pathway. And because we're a fairly early stage investor, a lot of the companies we invest in is a technology founder. So it's someone and maybe a small team around them who have a deep understanding of a technology and they found a great MedTech application for it. Often in order to help them, what we will find is also help them staff the company. Very early on, and I know it's a bit of a cliche, it's often talked about, but it's so very, very true. The most important thing is the team and the founding team. And what we like to also look at is, for the founder, do they have enough, I would call it, emotional intelligence to understand, in some cases, maybe they can't take the company through all the different stages they have to progress through. So you may have a great technology founder, but when you get to the point of, starting to do your regulatory trials, clinical trials, getting to commercialization, it may need a different person. And we can help the company put that person in place. And as an example, and it's a very, very recent example, we do have a commercial stage company that we've invested in. The CEO of this company is extremely well known in the industry he is in. You walk into a conference, everyone knows this particular person in the technology that he does, but he's been really struggling to attract additional investment and take the company past where they are commercially. It's a capital equipment company, they are commercial stage, but they're at that kind of, hill of challenge where they're not bringing in enough money and capital to be able to sell enough of what they need to do. So I've personally stepped in as the temporary CEO of the company. Fortunately, I've got 35 years of operating experience in MedTech companies, and I'm working with them. I didn't supplant him, but I'm working with him to help attract additional investment, right-size the P&L, let's say, and take the company to where it needs to be more attractive for an acquisition.
Maybe I'll follow on with that same thought process, and maybe we should partner more directly, because having great leaders and making sure the appropriate leaders are in the right spot at the right time is obviously a very important component of any investment and any contribution that investors can provide. I'll follow that on. In a commercial stage company, there's maybe not the depth of experience that one would be able to rely upon to make sure that commercialization happens as effectively and as efficiently as one might hope. And for KCK, I mentioned my tour of duty, but our team really focuses on that commercial stage, and the commercial experience that we bring to the equation, probably 75 years amongst the team of different experiences in commercialization, and that institutional memory of being able to look at either other deals that we've participated in and how we've commercialized and supported that company prior, or in the partnership aspect, and I'll use this as the example that Anna was looking for. We sat down as a team recently and reviewed a potential engagement set with strategics who are coming to the table for a potential company. And because our team has done multiple deals on multiple occasions, very similar to, I'm sure, the rest of you, but for KCK, because we're going to continue to be partnered to that company in some cases for over a decade, we look at that with the mindset of how will this relationship help bolster the growth of that company and continue to support our investment thesis of building a big company, because ultimately success doesn't have to come in the form of monetization. It can come in the function of a continued growth trajectory. So that's kind of our thought process.
Fantastic. Shay, do you have something to add on that?
Yeah, I think we face the same situation where, technology-savvy founders with relatively smaller, kind of depth in terms of both commercialization and strategic relationship. There is definitely major support that they are getting from our combined years of experience and relationship building with strategic. We have like one LP, which is a strategic partner, and we've done deals with many of the others. So it's so much easier for us to open the door and make the initial connection. But on top of that, we also try to it's not always possible. Sometimes there is, as we know, you need kind of to add leadership to companies as they grow. But whenever it's possible, we try to, my partner likes to say that we grow people that grow companies. So some of those technology-based or originated people can grow to become, charismatic, money-raising founders. And when you find something like that, that's great, because if you help them do it once, they will come back to you for the second and the third ones. So that's part of our job, I think.
That's a good pitch.
Well, that's an interesting point. So we backed a founder who had been successful before with us some years ago. I was involved in the deal because he had been previously successful. He was able to bring his technology all the way through FDA approval on his own money. But when it wasn't bought, he needed a partner to launch commercially, and invited us to get involved. And so every situation is different, but we tend to focus, like everyone else here, on people, on process, and on performance. And we got involved in the company a little bit earlier. Commercial launch is difficult. We found out in the first year we didn't have the right model. And so we syndicated the first investment. We, within the first year, needed to pivot the business model. Required us to shift from a device-focused company to a device-enabled services company. And then we recruited a new chief commercial officer who was the moderator in the first panel, so he's done pretty well. But he helped us scale the business to a level in which we could help the team negotiate an exit with a large acquirer, and exited for $400 million. So great story at the end, but required a bunch of work in the middle. Required changing the business model, acquiring a services company that could do the Medicare and Medicaid billing and commercial billing for us. But ultimately, this entrepreneur was a driver of technology. I believe he has over 400 patents at this point, but he wasn't the right person for the commercialization, and that's what we were able to really help them with. Wish we figured it out prior to our investment versus taking the first year, but because we have, like some of the gentlemen on this stage, operating partners who work with us who have run companies, we're able to get involved on a hands-on basis and make a pivot within the first 12 months of an investment to ultimately make the enterprise successful.
Thank you. Sounds fantastic. Sounds like a very agile and hands-on team we have here. So, bringing us smoothly to the next area about factors of success in startups. We also asked our questions: what are the most underestimated factors in the success? If I can ask just to pull up this new poll. Yes. So, very clear winner here. It's founders' mental resilience. I think that we can agree at least on one point for the successful startups, that if they have something in common, all of them, it would be a founder that is too determined to quit. I would like to ask you, you already touched on that partly, but how do you guide or how do you advise those strong personalities, let's say, without interfering too much in the founder's vision? What's your secret sauce on creating a good combo? And also, maybe when do you decide to step back and let the founders make their own mistakes? Maybe we can start with Shai.
Yeah, first of all, I fully sympathize with the numbers here, but it's a very, very hard thing to predict. We have, unfortunately, the unique opportunity to examine the resilience of the leadership not in the regular tough times of, hard to raise money and operational difficulties, but also in 2 years of war where some of the CEOs just disappeared for a couple of months for, army service, and we had to step in, and you could see there some, super resilient people coming back, with uniforms, giving guidance to the team and going back. It was really an unbelievable hope we'll never have to repeat again situation. But the bottom line is this is a very tough job for the VCs, because if this is a repeat founder, then you've been there with him and you know it. If this is a first-time founder or somebody that you don't know well, these are things that are very hard. This could be excellent people in all other situations, but with a little bit of pressure, they may crumble. And you really, it's very hard to predict that. People surprise you in both directions sometimes. But if you can identify some spots there, then this is definitely the most important things. And we see ourselves a little bit in those situations as, we need to come and step in and try to help as much as possible. Kind of parents to a teenager that wants to do things themselves. The question, the last thing I would say is that the question of whether to allow them to do their own mistakes or not, it's a repeating questions. At the end of the day, we find that we can never afford to do too much of that. So sometimes we don't know what would happen if we would let them, fall into the hole completely.
Greg, what's your take?
I was just going to say, even little mistakes are expensive, and big mistakes can kill the company. So what we try and do is align the vision and economics at the beginning. Of course, we don't always get it right, and so things need to evolve, and the founder's vision needs to evolve. We try not to micromanage, but at the end of the day, we try and set up the relationship as a partnership, and we try and be as knowledgeable about the space as the entrepreneur is. And usually, if those things are all set up, you have that foundation, you don't get into conflict with founders. There are some personality types that are more challenging than others, but logic and facts are incredibly powerful to even the most narcissistic person. So,
thank you. Very deep insights and very honest. I think that we appreciate. Chris.
Yeah, I would just echo what my two colleagues here said. I couldn't agree more. We try at the outset to put together a very strong board, or help put together a very strong board for the company that'll help guide them. And again, we try and avoid any kind of mistake at all. If we see a concern coming or a potential mistake, we'll try and nip that in the bud before it happens. I did want to make a comment on the slide. I thought this was really interesting. Super agree that all these are important. And I would also agree that the founder's mental resilience could be the most important. But when I think about what is the most underestimated factor, I think it might be team chemistry. That would be my view. When we look at a lot of companies and we discuss investing in them, and the team comes in, and you can see there's something not quite right, or there's a disagreement, or one person might be the prima donna, that's a big red flag for us. So team chemistry, I think, is really important, because if that's the team that's going to carry it from early stage through commercialization to the end of the company, it's a bit of a marriage we're building. We're going to be working with them for 5, 6, 7, maybe 10 years, depending on the type of company. So that, I think, is super important, and we've seen a lot of teams that don't think about that.
And Chris, I completely agree with you. And if you think about the connection between the team chemistry and the founder's resilience, let's use Greg's example. You're going to change a business model. You've got people who came in thinking they were going to do one thing, and now they're going to do something else. How does the founder convey that message in a credible, consistent way so people want to get on that new journey And to your point, when you're changing a business model, somebody has to come up with that idea, has to have that conversation with that founder, or that founder has to have that conversation with that investor and make sure that there's alignment. And being able to do that gracefully and appropriately and well is an incredibly important art. I'd love to hear maybe some more of your comments, because we had to go through a business model change in one of our investments as well there.
Yeah, I mean, the idea is one thing. Logic, facts, experience, that helps influence. But ultimately, the founder has to believe it. And unless you, they can't pitch something they don't believe. And so ultimately, the founder has to trust you, and you have to trust the founder. And if that is in place, you can move a shared vision pretty quickly. But if any of that is out of place, you'll just spin your wheels.
Thank you. It's fascinating. We are very close to the time, but I just cannot. I promised the organizers to break the record from last year, where there are only 2 out of 6 questions could be covered. So very quick last question. But how do you know all of those things in the first 60 seconds of the pitch of the founder, which can maybe help the founders here to understand what to do and what not to do? Just to terminate this panel.
In 10 seconds, you don't. There's no way. And we don't know, in some cases, for 6 months, 12 months, even 18 months until we really get into the business. We'd be absolutely lying if we'd say anything else. But that's part of investing. That's why
even
we're here.
After 35 years of career in investment?
There's always something new to learn.
Yeah, I think it would be naive to think you'll know. I think one of the biggest predictors, though, is that the founder has payment and go-to-market sort of worked out, even at the earliest stages. That's a good way to determine that the team and the technology are both the real deal.
Again, fully agree. I think a founder that has had prior successes is a good green flag, but it does take time. You know, we get many founders that say, why is it taking you so long to make an investment decision? Well, it takes a long time to get to know not just the company and what they do, but get to know the people. That's a real key factor.
Yeah, I mean, sometimes you know that you need to say no after 10 seconds because all of those red flags that you guys have mentioned, but sometimes it takes, 12 months or 18 months until you find something.
And one thing I will say is we do try to get to a fast no whenever possible. If we do think it's no, we'll explain that and explain the reasons why. And we do encourage also founders to come back to us later if we have a certain number of reasons where we have a concern. The door is not always completely shut forever. It's, think about these things, work on them, and we're still here to talk to.
Fantastic. Thank you very much. Lots of wisdom in this panel, lots of discernment. I think everybody would love to have this kind of support on their cap table. So thank you also to the audience for your engagement and interest and curiosity. And I think that we can continue this other 4 uncovered questions during the coffee breaks. Thank you very much.
Big thanks to our fantastic panel. Thank you so much. Thank you. Thanks to investors. We're going to see more startups and more investors tomorrow at the Startup Pitch competition. Thank you. Now we have one more interesting presentation before we go to the lunch break. We're getting the stage ready for our next speaker, Ms. Roseanne Camilleri, the CEO of National Mental Health Services, getting ready to present on this stage. Okay, almost ready. Would you like to use the podium, yes? Yes, can we move the podium a little bit right here to the center? Many thanks, okay. We have the clicker ready for you. Thank you. Okay. Ladies and gentlemen, please give a warm welcome to Ms. Rosanne Camilleri, the CEO of National Mental Health Services. Thank you.
Keynote by Rosanne Camilleri.
I'm not exactly sure what I need to do. I need to press this? Oh, all right, okay, thank you. Okay. So basically, while they're fixing this, good morning to everyone. It's an honor and a pleasure to join you at MedTech Malta 2025. I stand here not to showcase what we've already achieved, but to share what we are determined to build. At the National Mental Health Services, we are at the beginning of a transformation, and we are here to say that we are ready to go. So, basically, I'll give you some information. Oh, here we are. Okay. So, I do this? Okay. Some background information about Mount Carmel Hospital. Mount Carmel is the only mental health hospital in Malta. The building itself is over 150 years old. It's beautiful. But the workforce is very young at heart and very forward-looking, and that's why we're here today. We have community mental health clinics, multidisciplinary team, and our challenges are similar to our international counterparts, namely professional workforce shortages, increases in demand for services. Our planned reform is that which is happening as we speak. We're moving forward to build a new mental health hospital, which will be part of, in the area where there's the National Hospital de Malta Day, a mega transformational infrastructural modernization project at Mount Carmel Hospital per se, shift from an institutional approach to community-based services, and 3 regional and 3 mental health centers to facilitate timelier accessibility and better quality of life. Our vision and commitment is to continue serving our communities with dedication and to improve our limited digital infrastructure to be able to reach out more effectively. We do not yet have AI diagnostics or remote monitoring or digital patient pathways. We are still very much paper-based. But we have something just as powerful. We have a clear vision. We are committed to becoming technologically smarter, connected, and patient-centric through the introduction of electronic health IT systems focusing on patients' individual needs. And together we are taking our first bold steps. Why we're here today? Okay, this one. Okay, sorry. We are here because we know we can't do this alone. We're here to learn from you, from startups, researchers, technologists, and fellow health leaders. We're here to build partnerships that bring innovation to life. We're here because we believe we can be more than a participant in MedTech. We can be a proving ground. Our future in focus, here's what we're working towards. AI tools to help clinicians make faster, safer decisions, digital platforms that empower patients to manage their care, predictive systems that prevent illness before it starts. We don't have these yet, but we will. Because we're investing in people, we're investing in platforms and partnerships to make this happen. As we speak, we're also collaborating with various ministerial departments on the EU Empower Me project, working on launching an AI social robot focusing on promoting mental health literacy among children in a fun, interactive, and child-friendly way. Our road ahead. Our journey starts now. We are mapping out a digital health strategy together with the rest of the Ministry for Health departments and hospitals. We are seeking collaborators to pilot new technologies. We are building the foundations for a future where care is proactive, personalized, and equitable. We also know that it won't happen overnight, but we're here, and we're here for the long haul, and we're determined to get it done. In closing, actually, it starts right here. It's not closing, it's just the beginning, and I'm sharing this with you. So today, I don't present a finished story. I present it out tomorrow, our future. We move forward, not from scratch, but from strength. So if we're building something that could change lives, we're interested. Through technology, we shape our future, where mental health is not a privilege, but a universal right, protected, prioritized, and powered by innovation. Thank you.
Thank you so much. Ms. Rosanne Camilleri, CEO of National Mental Health Services. Thank you so much.
Thank you.
You can leave the clicker here. Okay. I will ask my colleagues to get the stage ready for the next panel. We have one more very interesting session before we go on a lunch break. So the next panel is called Australasia. It's a clinical research destination. We're going to see how Australia's medtech ecosystem streamlines clinical trials, how it offers lessons on regulatory efficiency, patient access, and global collaboration. It's actually very exciting that from the middle of Mediterranean, we're moving to Australia, another part of the earth. And this is why we're so excited about MedTech World Summit. It's bringing together leaders and players from all over the world. Okay, the chairs are almost ready. I'm going to start introducing our fantastic panelists, making their way to the stage. Joseph Panetta, Chief Marketing Officer at Ascent CRO. Pedro Erdmans, Clinical Strategist. Vanessa Galwa, Senior Director of Clinical Affairs at HighLife SAS. And Youssef Biadilla, CEO of Bariatech Medical. Ladies, gentlemen, the stage is yours. We're setting the last stages, and you'll find microphones over there. We're providing. The floor is yours. Let's have a closer look of what's going on in the field of medical technology and regulation in Australia. Please, let's give a big round of applause for our panelists. Okay.
Australasia, a clinical research destination.
We're going to fix the microphone. 1 second. Let's double check. Can you try again?
Are we up?
Okay,
Excellent.
we're good.
So we're here to discuss Australasia as a clinical research destination. For those of you who are leading a startup technology company or a medical device company, you already know that quality data is the fuel that propels your next milestone, whether that's a new indication or a new round of funding or your next stage in your development.
What?
Today's panel is actually engineered for you specifically to hear from our experts on things like establishing a trial, selecting sites and PIs, recruiting and enrollment, and finally, the many facets of partnering with a clinical research organization. Speaking of which, my name is Joseph Panetta, and I work with Ascend CRO. We are a clinical research organization based in Singapore and Sydney, and we cover the APAC region. Taking us on this journey today, as our hostess mentioned, is Vanessa Galwa, who's the Senior Director of Clinical Affairs at HighLife, a transcatheter mitral valve replacement company. Pedro Erdmanns, who, I'm just going to truncate a lot of experience here, folks. Experience at Medtronic, so strategics, global CRO like NAMSA, multiple sponsor side, regulatory, and even quality management systems. And then finally, Yusuf Biadella, who is a veteran MedTech entrepreneur and CEO and currently leading Bariatech, which is a company that is treating obesity, correct? Thank you so much for your role today, panelists. Our goal for you guys specifically is to harness what you know and understand and share that with people who, as Christian on the last panel said, many startup founders don't know what they don't know. So our goal here is to help elucidate the many facets that go into clinical trial development, regulatory approval, and that. So an old boss used to say, the way to begin is to begin. So Pedro, when you think about starting clinical trial structure, where do you begin?
Yeah, thank you for this question. I always start with the basics, and a lot of companies don't think of that as what's your indication for use? For what are you going to use this device? And then also related to that, of course, is what kind of patient population. Very often it's seen very broad, and then you get a mix of patients in your study. So be sure that you're focused and clearly know your indication for use. And then you know the patient population that you're looking at. And then you start looking where to do this. And that, of course, is crucial. Another thing that you need to always think in mind, and that's what I know as an ex-head of notified body, is all the data, every data point is important. Although you think that this is just your first study, you will see at the end of the road, when you want to submit, you need those few patients. So you need to ensure that you did them correctly, robust data set, and that you can use them. And very important then also is where you do your study.
Excellent. Yusuf, when you are beginning the notion of executing a clinical trial, where do you begin? What's your first step?
In my case, all my experiences, and it includes 3 early stage feasibility studies in Australia in 3 different companies, is in our case, time is the most expensive commodity for a small company. And the main question is, how do you generate data in a sophisticated healthcare system that will be recognized in Europe and most importantly recognized in the US in the fastest and most economical way? And in most cases, 3 out of 5, it was Australia.
I couldn't have asked for a better segue down the road. Vanessa, when you are structuring your trials, when you're thinking about it as a trialist, this is the first starting point for you?
Yeah, I totally agree with both of your points. From a clinical and regulatory point of view, and it's been discussed in earlier panels discussions, I also take into account the regulatory pathway at the very early stage, because you don't want to end up with study endpoints that would not match clinical evidence that you need to provide for CE mark, FDA market access, etc. So I try to build that very early on and shape the clinical strategy based on that, and of course embed everything into your protocol designs, endpoints, etc. So that's also part of the puzzle that is also important to take into account.
Brilliant. One follow-on question to that. Does any of this change depending on the device designation, whether you're 510K, IDE, de novo? Do any of those considerations change as a result?
Yes, I think it's very important to know already your regulatory strategy. I think that's one of the things that often is mistaken with startup companies, that they're so focused on the clinical results that they forget where they want to submit this. And then also which regulatory pathway to use, and then very important also is which reimbursement pathway. A fast 510K route can be extremely bad for you if you want to have another pricing than your predicate device. So it's very important already to take that into account when you think of studies.
It's a very holistic approach, it sounds like. You can't just start at one point. You have to sort of start from all vectors, it sounds like. Yusuf, I'm sure you've done different kinds of device designations. Do any of these things resonate with you? Do you feel like you need to start with the holistic viewpoint of regulatory, CMS, and clinical at the same time?
In my case, most of the devices except one were all IDE PMAs. So it's not like we had a choice in terms of the regulatory strategy, because these are implantable devices and some of them life-sustaining. So our thought process was a lot easier. It was, where can we start as fast as possible in the most economical way, in a very sophisticated healthcare system with data that can be recognized when presented to the FDA, so that it allows us to go straight from a first-in-human to an IDE PMA without having to go through an early feasibility study. So the idea is your chances of getting that discussion going with the FDA and your chances of getting that data recognized by the FDA without having to go back through another early feasibility study really goes up a lot when you present data, for instance, either from Europe or Australia. But Europe, even for a company based in France, in Europe, is much slower now to generate. So Australia becomes a natural choice.
Thank you. Vanessa, any thoughts on this?
No, my experience is really the same as Yusuf, because I've been working in medtech companies where it's about implantable class 3 devices, so the pathway is pretty straightforward. But to resonate with what you were saying, Australia is one of those countries that stands out in terms of model, and it's not just about how fast you can get your study up and running, but it's also a combination of factors where you're generating the data that will be reliable to an FDA or competent authorities in Europe, and also very predictable in terms of estimated timelines, site contracting, site budgeting, you name it. Enrollment capacity is also very predictable, I've found so far working with Australia. So it's really a destination where it hits a lot of bullet points.
Excellent. I'm sorry, Yusuf, did you want to add to that?
Yeah, I think that's a really good point. Having done studies in early feasibility and even clinical trials in Brazil, Germany, a few other countries, the advantage of Australia is that you're only dealing with one contact point, and everything is streamlined. And even for coming up for timelines, whether it's for budgeting or even for discussions with investors or strategics, it's a lot easier to present timelines or schedules that are going to match with the reality versus dealing with other geographies where you have to deal with ethics committee, hospitals, but also health authorities.
And a large part of that is also reliant on the CRO you choose, because you want those that have relationships with and can help assure your smooth entryway through ethics committee, governance understandings, the regulatory body, labeling and import. These are all areas that you want your partner to have seasoned and tenured experience handling for you. Pedro?
Yeah. I fully agree with you. I always talk about several types of CRO. You have the ones that only execute. You give them something, they push it through to the ethics committee or the competent authority, and they execute the study. And you have CROs that really help you with, is this the right submission? Did you do the correct thing for the ethics committee? As said, in Australia, you only have an ethics committee. I just want to jump a little bit back on that. In Europe, you still have several competent authorities you need to go to. Although the MDR dictates or says that there will be in future one country that will take the lead as competent authority, reality is that you still have to go to the several countries, and they all can have their own questions and remarks and demands. So that's a big thing, and then to have a CRO that can handle that and help you with that, I think they're extremely rare. I'm still waiting for the one that can do that. And that's the thing with Australia. It is very easy. If you work with a CRO that will do a due diligence on your material, you can have a very fast approval process.
Yes, well, that's what real partnership looks like. I want to build on something, Yusuf, that you were talking about earlier, and that was about time and how time is money. And we mentioned speed to trial. And so to that end, I want to talk about time to first patient in. Vanessa, can you talk about that?
Yeah, so, I think speed is important. We're in an environment, startup environment, where time is money and money is tight. So how can you hit, your first site initiation, first patient enrolled, and how fast you can hit that is critical. And it also helps, maintain investors' confidence, your competitive positioning, et cetera. So it's really key. And how you can achieve that is, I would say, preparation, preparation, and preparation. The more prepared you are, the better. And if you take, for example, the submission timelines to get there, well, it's not just about, okay, how fast you can get your study up and running again. It's how well prepared you are to achieve that. And having a good understanding, a local CRO partner that helps you along the way, really makes it stand out as an advantage. And it really becomes a clinical advantage, but also a financial advantage and a competitive advantage to start early. So again, if you have all the combination and everything that models in, it really helps.
Yeah, I'm going to tie that back to our prior two panels, where Ken on the first panel said that, I'm quoting here, that the most important thing for a startup's focus is funding. And then we just heard from the VC partners that they're looking for those milestones and a clear understanding and a predictable way to deliver them. But when it comes to, speed to trial in a smart way regarding data and data quality, Yusuf, you touched on that when we spoke last week.
Yes. I'm still unable to find a place or a geography that allows you to go from first discussion with the authorities to first patient enrolled, other than probably Georgia or in that geography. And the advantage of Australia is that you're able to go really quick from those first contacts to first in human. And it's not just to generate early feasibility study. You also have to think about your discussions later on to do like in our case, an IDE PMA route, is that same site or those same sites in Australia can be your first recruiting sites in your pivotal study as well. And that's really important to take into account. So you actually do save some time, not only to generate your initial clinical data, but later on also when you're rolling into and getting involved into a much bigger multi-center, multi-geography clinical study.
So we're going back to that whole holistic thing again, right? So Pedro, I want to focus on the whole speed to trial conversation with you. Like, what are the factors that can affect speed to trial?
Yeah, of course there's several. I think very important is the agreements with the hospitals. Hospital agreements can take a lot of time, and the bigger the hospital, the more lawyers, the more time it will take. I think that is, we talk about 3 months, but it can go really 6-9 months. So that's very important. And then if you talk about like Europe, competent authorities can take a lot of time. There are certain countries where we always say don't go there because of this, the lack of speed. And of course the ethics committee. Maybe going back to the first in human, I think when the first in patient in, we all celebrate when the first patient in for a millisecond, and then we wait to celebration for the last patient in. So it's very important. It's often a press release. The first patient is enrolled, but I think it's also very important to see how fast can they enroll and what kind of patients can they deliver on a speedy time.
You know, I'm going to borrow from something that you said, because I want something from you too as well. When we talked last week, you mentioned something I'd never considered, which was competition. That in some countries, there are so few sites and PIs available that your device is actually in line with a bunch of others to recruit patients, to get on the timeline, the schedule. It seems odd, but have you ever run into that in Australia?
Maybe I can start. Well, I personally never really encountered that in Australia. So there's, it's a big country, big sites, a lot of key opinion leaders, infrastructure to enable research and have, potentially competitive trials running in parallel. Now, it's never great, that's not something you enjoy having, of course, but it's in a bigger setup, it makes things a little bit easier. And again, I think the overall infrastructure and people working in clinical trials in Australia are very dedicated and motivated, and what I've seen so far is very engaged in clinical trials. And this is also something we look at in terms of parameters to go to a certain country and initiate trial in that country. Because, okay, cost, speed are all very good factors, but it's not the only factors you need to take into account. And the people, the engagement, the motivation that will drive enrollment capacity is as important as your speed to initiate the trial.
That makes sense. Yusuf?
I would second that. In past experience, when we've done early feasibility studies in Germany, for instance, we had to go to a KOL, but because that KOL was influential and experienced, we had to basically line up with 2 other companies in structural heart doing exactly the same indications. I had a similar experience in a similar device, structural heart, where in Australia we didn't have that. We were the first and the only ones doing a clinical study with the KOL. So from a lot of people think of population size, Germany, or for instance, Germany being I think 80-90 million people, and Australia is probably like 20, I think 20.
It's bordering on 30 now. It's like 24, 26.
Yeah, but at the end of the day, if you're dealing with one KOL who who is dedicated to your clinical trial at the time, your recruitment is going to go much faster than other geographies.
Yeah, I also felt the pain from that, because what can happen with competition that you get, let's say, the worst patients. That you just have an inclusion criteria that is not with the others, so they go first to the other studies, and then you end up with the worst patients, and that can really, sorry to say, screw up your data.
Yeah, it's going to damage your outcomes. And I think what we're really getting at here is one of the key differences about Australia as a clinical destination is that clinical research is a passion and not just a job, right? And I think that's important. And it's very clear that it's a passion because the country itself, this is a very big message for you who have startup technology companies looking for your first trial. The country of Australia, the government, offers a 43.5% tax rebate for trials done in Australia. Practically speaking, that means that a $300,000 trial costs you $178,000. And I don't know about, only my panelists would know this. Are there other countries that offer such aggressive incentives for research?
Not that I'm aware of.
Yusuf?
I think France could do that, but because for French companies doing innovation, you get about the same amount. The issue is that it's almost impossible to do early feasibility study in France for high-risk, class 3 medical implantable devices. So,
I think the key differences, though, is it's rebates. It's not tax credit. So that allows really companies to reinvest that money in maybe another R&D project, extend your runway. So I think this is really key for startup companies, and it's really a big advantage with Australia. Yeah.
Thank you. While we're on the subject of other countries, one of the things that was brought up during our discussion last week was the fact that there are labs and hospitals and physicians and sites in many countries throughout the world that are capable of executing research. But then there are factors that can thwart that research. I believe one of you brought up a country where some political instability sort of caused a stop to things. We're not mentioning names. But I think it's important to understand that in some countries you have to send your own physician to do the procedure. But if you have a medical device, don't you want to know how easy it is for other physicians to use it? I'm just curious, in terms of like other factors that may thwart your ability to get good quality data?
Yeah, I agree. If you bring your own physician, he already thinks it's a good product and that everybody can use it because he was one of the inventors often. So you will not get any good data out of that. So it's a waste of time, to be honest, to do that. Another thing that you see in certain countries is that they have certain technologies, diagnostics, etc., that are not on the same level as other countries. So it would be good to have a very good imaging device that maybe is not there in that country and that will also will not help you in getting correct data. So it is important to know, or you have countries where they have an incentive to use a certain technology because of reimbursement. So let's also use this next to it because that's what's paying us. So you then get extra diagnostics, extra other tools used because that's where the money is for those physicians. So you need to be very careful and you really need to understand, well, per country is what's the standard of care, what's the kind of technologies that they have in-house that they can use. It's so often that I saw deviations, protocol deviations, because certain tests were not done. Yeah, because we don't have this machine in this hospital. It's terrible that this site was selected to start with, but it happens and you have a lot of loss of data. And if you then go to a notified body or an FDA and you show all those deviations, then you need to be very good in trying to fix that problem.
Wow, Yusuf.
To me, the one aspect that sometimes people underestimate is the KOLs you're dealing with. So typically, if you're doing early stage, what you want is you want a really good ambassador. And I find in Australia that you have fantastic KOLs that speak the language, are comfortable presenting to large panels, etc. And especially for companies like, I think all of us, the biggest market is the US and will remain the US for the foreseeable future. So you want people who are super, understand the culture, are very comfortable in English and are able to present. And you find a lot of, because of the regulatory environment in Australia, you find a lot of fantastic KOLs that are absolutely, eloquent, understand the business sides, and also understand are comfortable with new technologies. So when they're treating their first patients or their first few patients, they're comfortable with a certain level of uncertainty that you're not going to find in other geographies.
It's critical. Vanessa, I want to start with you on this question because right now you are running a multi-country trial, which means that your regulatory bodies are different in different countries. So I'd just like to understand how you, and all three of you, by the way, have had to do this, where you've had to navigate multiple countries against a single protocol to a specific set of endpoints. So talk to us about that kind of hurdle.
Yeah, I mean, it can be really challenging because each country, especially in Europe, has their own specificity on what they expect in a protocol, study design, etc. And as I was saying earlier, you also need to embed all the reimbursement requirements ahead of time to make sure you hit those when you get your CE mark or FDA approval, market access. So this is where it's kind of tricky to pull everything into a study protocol, go through those rounds of submissions, answer a lot of questions, and sometimes there's requests to maybe add additional language that is specific to that country. And that takes time and energy. And when you want to start your study fast, well, in Europe, it's complicated because of that. While, going and targeting Australia, for example, as your first country to be initiated is much, much easier. So you kind of need to sequence each country timelines, make sure those timelines are pretty predictable because there's a big variability in Europe in terms of submission timelines and approval timelines. It can shift by months in some countries. So you need to really be strategic on the choice of the country you choose to go with.
Yikes, if what Yusuf said, with time is money and money is time, if you've got to wait months to institute a change, that's tough. But as a former regulator, Mr. Erdmans, can you talk about this?
Yeah. Yeah, well, I can imagine if you're a startup company, you're very proud with your first protocol. But when if you come to a notified body and you have like 7 protocol amendments, I want to know why. What happened with the first patient that you had to change your study? So I start to feel uncomfortable when I see a lot of change. And I also think that scientifically it's poor that you have to make those changes. And of course, you don't know this up front. You're happy, you have a good KOL that wants to start, you do your first patient, then you think, let's now go to the other countries. And suddenly you get all those questions and those changes you need to do. And as I said before, you know, you have Protocol 7, Amendment 7, 8, 9. And for being the medical director at DECRA, evaluating this, I have a lot of questions that you need to answer.
Got it. Yusuf.
To address that, what we do is we use a very useful and a free resource, and that's called the US FDA. We typically do Q-subs before we even touch a first patient, and we present a protocol, and then we use the basis of that protocol to build our clinical protocol and SOPs to collect data outside of the US so that we can present that data and use that data to go and directly into an IDE PMA without having to go through an early feasibility in the US.
You bring up a really good point, and a lot of people are unaware that because the TGA, which is the regulatory body in Australia, is very aligned to the FDA, which means that the FDA regards Australia as a center of excellence, delivering tier 1 quality data. So when you have multi-country submission to the United States, yes, the US FDA wants to see the preponderance of data from US sites. However, it will accept up to 50 to 55% of the data from Australia and other countries that are deemed a center of excellence. So that's an important thing for you to know. I want to turn to Australasia specifically as we wrap up, now that we're sort of ending this, and just sort of ask you what you like about Australia as a clinical destination. And most of you have already said, but Yusuf, could you recap for us?
So when we talk about Australia as a destination, even from some investors, first thing is it's super far. It's a 7-hour time difference compared to a 9-hour time difference with California. So, if you can save 3 months, 4 months, 5, 6 months in approval time, I believe that 15-hour flight is well worth it.
Couldn't agree more. Now, Vanessa, Little Bird told me that in this multi-center trial that you're executing, Australia out-enrolled multiple EU countries combined. Could that be a reason that you like Australia?
Yeah, it's definitely one of the reasons now. In our studies, Australia has been one of the top enrolling countries, so very pleased with the outcome. But it's not only that, as we were saying, it's really a combination of factors that drove the decision to add Australia to the studies. We discussed a couple of those already, and ultimately, you need a little bit of foot in the ground, and you need your local CRO partner to be the extension of your team, because when you're based, as Yusuf was saying, in Europe or the US, the time zone difference makes it very difficult for you to manage that yourself. So of course you need your local CRO partner, and you need your therapy development team also on the ground. And whether you can do that internally or externally through a local, again, CRO can offer that also. But this is really key for driving the entire process. You need to build the relationship with those sites, key opinion leader at a very early stage. And again, having that local presence help you stand out with that and make it happen.
I might know a CRO that could actually help you with all those things, in fact. Wrapping
Sure
up, I indeed. Pedro, given your broad experience set, one would imagine that you have a lot of reasons why you might like Australia.
Yeah, I think key for everybody is predictability. Also, when you have your milestones to your investors, 9 of 10 times you will not reach them with clinical studies because things took longer. So I think predictability is really key for a lot of things we do in life, but especially with clinical studies. So if you go to Australia, you know how long it will take. You don't have the competition with other studies. So I always say when a physician says, I can enroll 20, he can maybe do 5. In Australia, I have to say I can enroll 10. He will probably do 8 or 9. So I think it's very important that predictability that you have with like going to Australia would be for me one of the key factors, next to the fact that almost half will be paid back in cash.
There you go, yeah. All right, I'm going to wrap up now as we're sort of running over, but I do want to echo a couple of the panels that went before us. Ms. Yancey said something very important. She said that every clinical study must be scientifically valid. It must answer a question, why? And then you need the data to back that up. Another important quote, clinical is not the time to cut corners. So when you're looking at other lands that may be less expensive, where you can go and quickly get something done, maybe that's the right place to go for internal data. Maybe that's the right place to go for gathering a clinical signal. But if you are looking for first in human, pivotal or PMA, you want tier 1 quality data, dialing back to how we opened this session. So that's where I would invite you to consider Australia as a clinical destination. Thank you.
Thank you, everyone.
Thanks a lot. Thank you. Well, on that positive note, I would like to announce a little break. We have a lunch break now. We're going to see you back on this stage at 1:15. Make sure to be here. Don't be late. I know lunch break is very tempting, but make sure to be here. 1:15, it's MedTech World Summit in Malta. I'll see you here in 1 hour. Many thanks.
I'm delighted to be here in MedTech Malta, and I'm hoping to meet investors for our seed round and also other startup companies in the space.
And it's my big pleasure to invite to the stage our next panel. So that is tagged Fueling MedTech Growth, Equity, Debt, and Everything in Between. As we know, there's no single path to financing MedTech innovation, and startups have to navigate a whole spectrum of capital options, from early stage equity to loans and growth financing, while actually tailoring their strategies, market, and region. So now this panel is going to explore how equity and debt can complement each other in building medtech startups and companies when venture debt makes sense to compared to a traditional VC. US and European capital availability and strategy differences. And it's my big pleasure to invite to the stage our panelists for this session. Please welcome to the stage Chris Church, Director of BlackRock, David Kyriakis, Managing Partner of Wyndham Capital Partners, Dr. Nargis Sheikh Ansari, Executive Advisor and Public Health Expert, Gary Gershoni, Founding General Partner of Baymat Venture Capitals, and Luke Starmans, Partner at Brightlands Venture Partner. Please, a big round of applause for our esteemed panelists. Please welcome.
Fueling MedTech growth, equity, debt, and everything in between.
If you want to match your headshot, yes, please.
I'm gonna switch.
Oh, thank you.
Best looking is supposed to be in the middle, Gary, so
Obviously.
the wisest.
So why aren't you here?
I'm just enjoying my corner side, but thank you for asking that question. Thank you so much for being here today. Lunch is very tempting, so thank you so much for walking over your temptations and being here with us. Without further ado, we are hopefully going to start. So I had a very tiny chat with Gary before here, and I thought that would be a very good introduction into why we are sitting here today. Gary has been on both sides of the story. He has founded and co-founded startups, very successful ones. And he has also been investing in startups for quite some time. So why don't you tell us, how has that journey been for you? What were the key challenges as you were speaking about them as the major important matters in learning, and also the key learnings that you've had throughout your journey?
Thank you very much. Thank you very much, Dr. Sheikh Ansari, for allowing me to participate on this esteemed panel. And thank you for asking me about the journey. We've all had journeys. Mine has been particularly bumpy, at least in my view. So it started as a practicing interventional cardiologist for 20 plus years. And during that journey, like many clinicians, I faced challenges, clinical challenges that did not have optimal solutions, so-called unmet clinical needs that I thought were relevant. And along with colleagues and partners, was able to find solutions that then achieved good product market fit, led to the formation of 2 medical device companies that had successful outcomes. One, a little bit unusual, actually had a successful IPO, less common with med tech companies in the US, most of whom exit successfully through M&A rather than through an IPO. And then a second company that followed the more traditional path of an exit through an M&A, both in the interventional cardiology world, although my current involvement is primarily across medtech, all different clinical verticals. And having been involved with both of those companies, really did experience, I believe, all the scar tissue that one can accumulate going from back of the napkin to a final exit. We spoke earlier about the issue of what do you learn from that? Well, you can learn not from the successful part in so much as what you learn from the challenges and the bumps along the way, and from your failures and from your mistakes. So that to the extent that I can share some of that during this panel, I would be delighted to. And then ultimately, as I moved along in my career, I decided that I wanted to stay close to innovation and close to the healthcare field. And so making that transition to the investment side, I think, was the right choice for me. Something I did several years ago, and I'm actively involved now. Primarily wear the hat of an investor. So it allows me to stay, as I say, close to the innovative space, close to healthcare, and all of those things. So thank you very much.
Thank you. Wow, such an inspiring journey. And then you mentioned investment was the right choice. And of course, investment is what startups are all seeking at different stages. With early stage startups, what is it that you are looking to make sure that those kind of ideas are worth the money?
Yeah, hi everyone. My name is Luc, partner at Balance Venture Partners, early stage VC. So we invest in early stage companies. And at the early stages, it's team. First of all, because you know the path is long, there will be many ups and downs, like you mentioned also. And you need the teams that are able to pivot, to regroup, that have stamina to continue. So I think that's very important. Another aspect also mentioned by you is unmet need. Are you solving a real problem, or are you starting with a technology and try to search a problem? The latter, not recommended. So try to start with a real unmet need. And finally, from a VC perspective, you want to have a potential for a good financial outcome as well. So I think those three things for early stage VC are important. Knowing at the early stages that any forecast you make, you have one guarantee: it's wrong. So don't spend too much time on the financial model and those kind of things. Try to look a bit more big picture, I would say.
Super. How about the late stage ones, David?
Yes. So I'm David Kariakis. Thanks to MedTech World and the Maltese government for supporting this event, to Dylan for organizing such a great group of people and to have me included in that. I get to come in a little bit later when a company is really going to market and scaling, which is a risk that's often overlooked and a real substantial risk. Wyndham Capital Partners has been around for 18 years. We invest in growth stage, medical devices, software, digital health, and then the convergence between the two in tech-enabled devices, where a lot of people don't feel comfortable entering, and it's still very siloed within healthcare. I haven't fully articulated this, but I'll venture into trying to. What I discovered, so I review and personally bring in 500 or so deals a year, opportunities, and I invest in 2 a year. And so there is a big top of funnel and a screen. And what I realized I was doing is there's roughly 8 material buckets of risk. You have to assess a business as if it's the same across the board, even though it's dramatically different, but it's the same dollar going into those opportunities. And management is probably the biggest bucket of risk, but really the greatest driver, and correlated with highest correlation with success. So management, market, competitive dynamics in the market, regulatory, reimbursement, clinical trial risk, manufacturing and supply chain risk, and there's an 8th there, but it just at least those, if you can take at least 2 buckets of risk with yellow flags, if it's red, you really have to dive in and assess and understand the risk that you're taking, but you could fairly price the risk reward profile and look to drive investment returns, which is what we're all trying to do. The lights stay on. But more importantly, there's very few industries where you can have as great of an impact on your neighbor and your community as what we do. And so you have to view the impact that you're going to have and could enable in this space.
Absolutely. Thank you for sharing that. I know that things are usually different across the pond. So coming to you, Chris, how is it different between the US and the EU in terms of the risk appetite, deal sizes, investor expectations?
Certainly in Europe, we do see smaller rounds. Part of this, I think, is simply depth of capital markets. If you want to raise a round that is north of 50 or 100 million, you are really looking to the US market and US funds because there is the size and scale. At different points in time, you can IPO in European markets to raise these kind of sums as well. It is getting incrementally better. I think 5 years ago, you would struggle to raise a 30 million round in Europe. That's very much changed. There are funds that are raising larger and larger amounts. There are a handful of quite scaled funds at that kind of growth stage, but it's still a challenge. It's not necessarily easy in the US, but you've got a lot more options in terms of finding that capital. Part of that is just a willingness to take risk that is greater there, but I think fundamentally it's the depth of the capital markets here are just simply not as strong.
Wonderfully said. Luke and I was having this conversation before coming to the event about why almost every medtech company is US first. And then we deducted that to the policies and frameworks that are in place are not very helpful in how much room is there for startups to grow or perhaps to scale up or to be adventurous in the areas that they really want to dig into. Luke, would you like to elaborate on that view?
Yeah, so I think almost all medtech companies, also European ones, have to have a US first mindset, also our portfolio companies. And that has to do with multiple things. I think at the top, strategic value, FDA clearance, commercial traction in the US, and I think that's the main driver. But what's also not helping in Europe is the MDR, which is, not very transparent. You start a clinical trial not exactly knowing whether it will be okay. With the FDA, you get, a stamp of approval when you start, and you know what you're getting into. And then if you are commercial, obviously in Europe, every health system has its own reimbursement schemes, reimbursement codes. You have to, if you have bad luck, to do multiple clinical studies in multiple countries to match sort of the criteria. This is where the US has obviously a gigantic advantage. I think this is also why the strategics value the US so much more. And that trickles down to late stage and then early stage. So even the early stage investors worry about sort of, can we get this to the US? It's almost a starting point at that point.
Well, I'd like to follow on with that a little bit as well. So we invest primarily in the US and Israel. We see about 1,500 companies a year. We don't invest in Europe or in Asia simply because of bandwidth issues. But there is no question that when we look at most of the companies that we're interested in, their focus has to be, and again, it sounds provincial, from a global standpoint, but from an economic standpoint, it's not. They have to be laser focused on the US market from a ClinReg standpoint and ultimately from a commercialization standpoint. And there are several reasons for that. One of the key reasons is that for most of the medtech companies, the exit strategy or the liquidity event is going to be an M&A. There are exceptions. Companies can do IPOs in their countries of origin and where they're domiciled, but overwhelmingly it's going to be an M&A. And most of the acquirers that are going to acquire at the scale that we would consider a success are going to be focused on the US or be US-based companies. So they have to be laser focused on the US market, on the ClinReg pathway and commercialization. Number two, 5% of the world lives in the US, but over 30% of all medical resources are consumed in the US. Again, I'm not going to make any judgment about it. You're the public health expert. You can say that Americans are gluttonous about consuming healthcare, but when 30% of the world's market, healthcare market, is consumed in one geographic location, that although we call US healthcare fragmented, the reimbursement is not so fragmented, particularly when you look at certain types of healthcare that are consumed perhaps by people over the age of 65 and it's controlled by Medicare. Medicare is the largest insurer in the US. It insures all people over 65 and certain others as well. So again, the size of the market, where the strategics are, the known clinical regulatory pathway. I've done battle with the FDA over the years, but I will say that they are arguably the most important regulatory agency in the world. Even though the EU might control more jurisdictions or may have an impact on more jurisdictions, I think the FDA is at least critically important in terms of understanding the pathway. So for all of those reasons, I think that companies, whether they're based in Europe, whether they're based in the Middle East, whether they're based in Asia, and certainly in the US, need to have a US #1 strategy. Now, that's not to say that some of the clinical work, first in human studies, can be done elsewhere to accelerate the process. But I think the speed to the US market is critical in understanding both the pathways there, the ClinReg pathway, and ultimately, perhaps the biggest risk of all, if the exit is going to be dictated by their commercial launch, we view that as the biggest risk. Very few companies navigate that one well.
Yep.
Many can navigate the ClinReg well, but navigating the commercial scale, understanding it, moving through it, and doing it well, and then being acquired as a measure of how well they do commercially, we view that as the biggest risk facing any of our companies.
I can't tell you how many entrepreneurs come to us at our stage and says it's de-risked. All we have to do is commercialize. And it shows a lack of appreciation or understanding and sophistication. But I will be critical of how dysfunctional the U.S. healthcare system is. You weren't. You took a different, more positive approach. But $4.7 trillion is what we spend in the U.S. It's the third largest global economy in and of itself, and grossly inefficient and dysfunctional. So as an entrepreneur, there is no more inviting environment when capital is flooding into the space. We all need it, and we need it in our most vulnerable time, and it's incredibly inefficient. And so
we're 100% aligned. I wasn't talking about the quality. I called it a gluttonous healthcare system, which for investors is wonderful, right? So we're 100% aligned on that.
Chris, would you like to add to all of that?
Pile on.
Heated debate.
I think we've seen a change in our portfolio companies really with MDR coming into play. So the pathway used to be the US was absolutely the #1 focus. But on the way, you would get CE mark, you would do some proof of concept sales in Europe, and you would test the market. It was, frankly, partly a clinical trial that was funded by the ultimate consumer. Now it's just not even on the table. There are certain industries or areas where it does make sense, but either because you're running a trial in both locations anyway, but generally it's a pure focus on the US, and I think that's unfortunate for Europe in terms of bringing these technologies to market. They may ultimately come here if the business is acquired, but you're probably talking about 5 years, 10 years later, which is a shame for the market, and particularly for the market where those technologies are being generated. Often these are coming out of universities. This is institutions where there is substantial funding coming from government or other sources, and the benefit to the consumer just won't be there for a long period of time.
And do you think strategic partnerships could kind of better the situation? Maybe if pension funds, for example, are more interested in investments that go towards MedTech ideas in the EU region, maybe that could drive up the enthusiasm or somehow the interest. Do you think that would be helpful? Or maybe if academic institutions are coming in, joining in for better alignment with fit for market, trainings, and then preparing the students, preparing the graduates for the market. Do you think that would give EU an edge?
I don't think there's a lack of ability to commercialize here if you so choose. I think the challenge is it's at least as hard to take something to market in Europe now as it is in the US. There's probably a cost difference in the US, but the reimbursement here is fundamentally not as high, and you're spread across many, many locations. And so can you conceptually have a pension fund that says, I will invest in you if you do this, and if you launch in my location? Yes, but it's a bit disingenuous to your underlying pensioners, where really they need to be generating profits to fund their pensions rather than saying, launch my device in the Netherlands.
Absolutely.
I think you're raising the question, is funding the problem, right? And is capital availability? the problem. And unfortunately, right now in this market, it's a constricted market, right? And not many people are talking about this, but a lot of funds aren't being raised. A lot of funds are going out of business. And it's, looking back in 20, 21, and 22, when capital availability was flush and it was saturated, too many of us lost a lot of money in this space. And so there's been a restriction, right? And the tide has gone out, which means that you have to make that dollar go even further. And you have to be far more efficient with that capital. I don't know if capital availability or if additional capital comes into the space, we just witnessed it, means greater levels of success, if that's the problem. But there's a misperception that you do need to raise these massive financings. You have to raise $20, $30 million to start commercializing right after you get your FDA approval or an EU approval or wherever. That's the route. And oftentimes we get pitched and it doesn't quite yet make sense why you would get a bolus of capital when you don't have the proof points yet defined or the understanding of how the product fits into the market. The value proposition isn't well defined and articulated. And I often challenge that thought and suggest raise 2 million, raise 5 million, which would be available, a lot easier to get, a lot shorter of a time to raise. Prove that out, and you preserve so much more in equity for yourself versus give it to us because of how expensive our capital is. Demonstrate that you can, $1 into the machine means 3, 4, 5 in sales and marketing growth, and then you can pour a lot more money into it with a lower profile of risk and a higher probability of success. So.
Makes absolute sense. And at what stage of the journey of a startup do you think family offices start showing interest in them?
I think all levels. Yeah, I mean, I think family offices have stepped in for the lack of capital that's in the space. We talk to a lot of family offices, and we actually end up becoming a healthcare analyst for them to help solve and figure out what to do with these investments, because they ended up taking on more than what they knew they could do, and it becomes more of a challenge for them as they don't have the many don't have the specific expertise. But find a family office, find an angel investor that it resonates with, and somebody that you really can trust and value and appreciate their involvement and support. And I encourage it. I mean, capital is very hard to come by right now, and so.
To follow on that, I would say, in a very, at a very high level, you really need to divide the family offices into two groups. Those that generally will allow others to invest on their behalf. So our investor base, to a large extent, is family offices, and so we invest on their behalf, and we invest according to our investment thesis, which would be perhaps later stage than a so-called angel investor or super angel might invest. And then there's another group, I would say, at a very high level, of family offices that have both the breadth and potentially in-house sophistication to do direct investing on their own. And those are two, obviously very different models. I think for many of the startups that we are involved with, given the entry point where we invest, the family offices are generally not part of the more current, they're part of the cap table, but they're not part of the current investment. They may have been at an earlier stage, functioning as either angels or super angels. And I would agree also with what David said, that I think that if you can find family offices that the message resonates, a particular disease, whether it be cardiovascular, whether it be oncology, they can be an important part of a very early round of financing. They could even be the lead if they're willing to do direct investing. But I think it really depends on the family office.
And then following on that, you touched on it, David mentioned it, this market fit seems to be missing in some innovative ideas that come up. They are very noble, very genuine, but then they're not essentially meeting a right immediate need in the market. What is that true innovation that we really need in the medtech and digital space at this moment? And what is it that we are oversaturated with? Luke, would you like to take it?
This is a difficult question. As an early investor, you always have a long view out, right? We are in at least 5 and more likely 10 years for every investment we do. So you really try to project 10 years ahead. And I think with all the workforce shortages in Europe, but I think also in the US, anything that can contribute to more efficient care, whether it be surgery, but also just in a general ward. So I think robots, for instance, not only surgical robots, but care robots. It could be very interesting. I think it wouldn't surprise you, the other side of the coin, what's saturated. Everything .ai is very saturated at the moment. Every medtech startup obviously is trying to spin into AI to not only tap into the medical device venture capitalist, but also the generalist. Because the medical device venture capitalist, as you mentioned, is just very constricted at the moment. So logically, I think founders are looking for different avenues to get funding as well. And I think that's a saturated market where you really need to pick wisely, because there is a lot of not so credible AI stories out there as well.
Thank you for that. You very well touched on my next question for Chris. With all of this AI and literally everything that we're living with, where do you think the future of medtech is going? Do you think there's going to be more AI? That's a risk investment. Is there any sign of interest from the investors into more AI-heavy solutions? How do you see this?
I think it's a huge area, and we're very much at the start. Almost every company that we're investing in at least has some level of AI enablement. I think you have to do that to drive efficiency and to test more, to drive better outcomes. I have no doubt there will be substantial losses for certain companies that are AI-centric. And I think you really need to dig down into why is this unique and what is your moat? There's many companies where it's simply a wrapper on top of an existing AI solution that is much larger, that's much better funded. But we're very much bullish on digital health as a segment and the enablement that AI is bringing there. Because if we don't utilize these solutions, if we don't drive substantial efficiency into the health system, we simply cannot afford to pay our healthcare costs. We see that in the US, you see that in Europe. The percentage of GDP that we spend every year continues to grow, and it's only going one direction. And as we have an aging population, that only gets worse.
Absolutely, yeah. The future will tell how we're going to do. And David, you have led investments where the companies were later acquired by major giants. How do you see the role of strategic investors in between of all of that? Strategic investors, venture capital coming from companies.
So I mean, Gary referenced this earlier. We invest to have a liquidity event, right? We're beholden to investors who have a timeline and so on. But I think we often get caught up in where that finish line is or where we perceive it to be, and we're sprinting toward that line, and we don't think past it. And I've always, for my North Star, is you build a business to be bought, not sold. And so you can't set the finish line. You have to grab everything you can before you start running, pick up stuff along the way, thinking and preparing for a marathon type distance rather than a sprint. And oftentimes there are flaws, there's the lack of infrastructure and holes that a strategic stumble into, and they do want to acquire you, or as you start a process, that are voids and will they're really easy to pick up. When you see as many companies as we do, let alone strategics, and they start evaluating, they know whether you're ready or not. And when you have that strong infrastructure in place, you don't need them, and you're not for sale, and you're running a marathon and building a good business, that's where the magic happens. And that's where the premium multiples are paid, and being able to tell them we're not for sale, but we're beholden to, we have a fiduciary responsibility. So if you'd like to put in an offer, we'll happy to entertain it, but we're building a business and something that's impactful and will be, stand the test of time. That's a much better place to be in. And, rather than sprint and then have to figure out you're running a marathon, it's better to be prepared and think about it that way.
Super. Gary, I started with you, and the last question also goes to you. You mentioned that you have seen unmet needs during your earlier years in this journey, and that's how you started your first companies. Again, we touched on it quite often in our conversation on unfitness for lack of fitness for the market, or lack of the right skills for navigating the commercialization stage and all of that. What would you name as the missing, the major missing skills that clinicians with noble ideas could learn perhaps or can master in order to really be successful in this journey of scaling up?
Yeah. So I hope I'm going to answer the question, in the way that you were articulating it. But yes, it all starts with the unmet clinical need. And I think that's been well defined. It's been well defined academically by programs like the Stanford Biodesign Program and other such programs. And I think that understanding that there is an important clinical need that is both important because of how challenging it is in a given patient and the breadth of it, that it's not a niche, that it's a very large addressable market. I think a lot of clinicians that are involved in the early stages, in the ideation stage, they may encounter a problem and they consider it to be a significant one, but they don't think through how big a problem it is in terms of breadth. How many patients are impacted? How many geographies? So I think it has to be both a deep problem, a clinical need for a given patient, and something that is a common problem so that there's a big market. It all starts with that. And then it flows from there, developing a differentiated technology, particularly in MedTech, that will address it, and having the right leadership, which is often not a clinician. It needs to be someone who is 100% focused on developing the technology, building a company. It could be a clinician, but they have to be as focused on this as they would be in their clinical practice. All of those elements have to come together at the beginning and have to continue through. I'll come back to what David said early on. While the unmet need is what we look for at the beginning, we really place a very high premium on the leadership, on the senior management team, because time and again, that has been shown both in terms of experience as well as in terms of data that has looked at this. The Kaufman Institute has looked at this in the past. This is an institute in the U.S., venture research arm. And without question, the quality of the leadership team is the single most important predictor of a successful outcome for a startup. So kind of coming back to basics, that's what we look at. I hope that answered your question.
That very much does. And we have to thank Luke for mentioning it the first time. Yeah. So if there are any startup funders in the room, get your team right, basically. That's what gets you everything. I do see a question from a member of the audience. I'm not sure if we can take questions. Yeah? Okay, perfect. Could we have a...
Is
perfect.
it? Okay, just one question. Sure.
We promise.
Sure, one short question. Nastya Preradovic-Visic. I help family offices invest in MedTech and Biotech VCs. So I would love to hear from the partners here who are investing in startups, what is your value add and unfair advantage? Very short one.
But if you give us the opportunity to talk about ourselves, I think we can take up a lot more time. We take a lot of pride in adding more value than the cost of our capital. So I helped run the investment arm and innovation arm for a large health system. So the visibility into where the bottlenecks and inefficiencies are within a health system, and then being able to make those customer introductions and help influence the outcome is something we pride ourselves on.
maybe
I
to
hope
follow.
Oh, yes, please, please, yes.
So we early stage VC. I'm a biomedical engineer by training. I think we try to understand really the technology, the problem, and then really try to work with the founders to get to the next stage, to be interesting for later stage venture capital firms and make them as attractive as possible to get there.
I think that all VC firms are different, but I think the goal of, let me go back for a moment. For many years, I was on the other side. I was a company founder. I was looking to raise capital from venture capital firms, less so from family offices. And what struck me in those days, and it's changed actually, because this is 10, 20 years ago, is that many of these firms, the classic model was partners that perhaps did some kind of training in a technical space in undergraduate, and then they went to a prestigious business school and may have had no experience running companies, or really, particularly in the MedTech space, have knowledge, true deep knowledge of the discipline in which they were trying to solve problems. But that's changed a lot. And so many VC firms now have partners with operational experience. They have partners with financial experience. And so that they cumulatively have the kind of skills that really can be almost like a government in waiting, if you will, for a startup. They can really provide value add in many, many different functional areas of a startup. We do that. In our firm, I bring obviously a technical background as a clinician, an operational background. My partner was a financial investor for over 20 years in some very large funds. So we bring a level of professionalism and expertise that we think brings a lot of value to our startups. And we're active investors. We don't just invest money and walk away and wait for the outcome. We're very involved with our companies in every area. There's one company we're involved with now, for an example, that I feel like I'm almost the CEO, and I'm hand-holding our CEO because he's now in an area, the company has progressed to a point which is really beyond his skill level. So I think it's the professionalism, it's the depth of experience that I think should be what you look for in a VC firm if you're a startup.
Chris, would you like to add to that?
Yeah, so we've been in the industry for probably 10 years now. It was a firm called Creos Capital that it was acquired by BlackRock. And I think the difference we see with BlackRock is just the platform. So largest asset manager in the world, we have a lot of different pockets of capital, but also a lot of people that are specialized in different areas. So we can tie people into the right kind of advice, the right kind of person that's done this before, be it support at the board level, be it access to other companies that we've invested in or somewhere else in the platform has. And so it's really just scale.
Super. Thank you so much to my fellow panelists.
Thank you.
Yeah, thank you. Thank you so much.
Fantastic panel. Thanks a lot. It was a little bit of a reverse speech again. Thank you. Thanks. All right. Now we move from theory to practice, and in the next half an hour, we're going to be having a case study and a company showcase from two companies, and we're getting the stage ready for the first one. I know it's very, very exciting to talk to investors. This is why we're here for. But I would like to focus on our next session, which is a company showcase by Check for Cancer. And it's my pleasure to invite to the stage the Chief Medical Officer and the CEO of Check for Cancer, Professor Gordon Wishart. Please make a big round of applause for Professor Gordon.
Company Showcase by Check for Cancer.
Thank you very much. Check for Cancer is not a startup. We're an established UK company providing cancer screening and diagnostics. Skin cancer incidence is increasing worldwide, and we have international shortages of dermatologists. So recently we've used data from our own teledermatology pathway to build a skin cancer AI model for skin lesion classification. So it's called SkinTel. It has two inputs, a dermoscopic image, which is a standard high-quality magnified image used by all dermatologists and skin cancer nurses. We were lucky to have extensive clinical information associated with each of the 80,000 images that we used, and we've taken that down to 7 major risk factors, and we've developed a novel risk score. The model classifies the images as suspicious or not suspicious. Those with a suspicious lesion go straight to a face-to-face assessment, and a clinician decides whether they need a biopsy or not and performs that biopsy. Patients with a non-suspicious classification are reassured and discharged. So we've recently validated this model in 36,000 images that were not used to build the model. If you look at column 1 here, you can see that we were able to correctly identify 99% of the skin cancers that were in that group, with individual results for melanoma of 97%. Now in green are the published results for experienced dermatologists doing a face-to-face assessment using dermoscopy. And if we toggle our specificity, as we've done to 80%, as we've done in column 2, you can actually see that actually we're very competitive, and really for non-melanoma skin cancer, we hugely exceed what's possible by human reporting. Now, despite missing a lot less cancers than experienced dermatologists, we're always going to focus with AI on missed cancers, and we missed 5 out of the 502 cancers. So let's look at why that happened. So this is a table showing the confidence of the model in making a non-suspicious classification along the bottom. And then these are the missed cancers. So as you see, as the model gets more confident that this is not suspicious, we miss less and less cancers. And in that model validation, the model settled at 86% for deciding above which something would be not suspicious. But if we increase that threshold, and if we get up to 93%, we don't miss any cancers. So is there a way of harnessing this change in threshold to use this effectively within a terminology pathway? So if we could introduce this before any human reporting into our teledermatology pathway, this is what it would look like. What you would do is you'd identify the suspicious group in red, and they would go straight to face-to-face assessment and possible biopsy. In the pathway on the left, autonomous use, you could reassure those patients because their threshold is 93% or more. There are no cancers in that group. And then this middle pathway is for a non-suspicious diagnosis which falls short of that 93%. The 5 missed cancers are in this group, but in this group, the healthcare professional can use the output of the AI model as a decision support tool. And we know that they will find those 5 cancers because they were diagnosed by human reporting when they were originally diagnosed. So let's put some numbers on this from that 36,000 images. And what you see is just almost 12% go straight to face assessment. Greater than 50% can be reassured without missing those cancers. They will need some kind of follow-up or contact at 3 months to make sure nothing has changed. The remainder, which is just over a third, come down this healthcare professional using it as a decision support. Now, these were 36,000 images in over 19,000 patients. So let's see what happens to the patients if you map them to this process. Here we are. So 17% of patients go for face-to-face assessment. That's pretty close to what we do in the current teledermatology pathway without AI. 60% are reassured. That's almost 80% of this pathway now being automated, with the remainder coming down the decision support tool. So I think there is a way to introduce AI effectively into this particular pathway. By streamlining a lot of it and making this pathway more efficient, we can scale this up, make it more widely available to people, because that's one of the challenges with this rising cancer incidence and the reduction in the shortage of workforce. Because you're going to diagnose cancer earlier, the costs will be much less. And because you're introducing huge efficiencies in the pathway, the costs will be much less. So as we go forward, we're going through regulatory approval in the UK and the US. We're very interested to partner with people who can work with us to validate the model in populations outside the UK, and we look forward to having those discussions over the next 2 days. Thank you very much.
Thank you, Professor Gordon Wishart, Chief Medical Officer and CEO of Check for Cancer. Thank you so much, Professor. We are on to the next one, and now we have the company showcase by Auctus Surgical, presenting John Ashley, the CEO. Please make a big round of applause for John. Thank you.
Company Showcase by Auctus Surgical.
Good afternoon, everybody. I'm John Ashley, the CEO and co-founder of Auctus Surgical. I'd like to start by introducing you to Maya. She's the daughter of a close MIT. Good afternoon, everybody. My name is John Ashley. I'm the CEO and co-founder of Auctus Surgical. I'd like to start by introducing you to Maya. She's the daughter of a close MIT colleague of mine. I've known Maya since the day she was born. She was a very active, vivacious young lady. I watched her ballet performances and soccer games and saw her and skied with her on the slopes. But at the age of 11, Maya was diagnosed with scoliosis, an abnormal lateral curvature of the spine. It's a progressive disease, and before she turned 12, she was prescribed a torso brace to support her spine while she continued to grow. The goal of a torso brace is to prevent further degeneration, and it does help a lot of children, but not all of them. Unfortunately, before Maya turned 13, she underwent a fusion surgery. She was cut open from her neck down to her hips, her skin and muscles flayed open. She had 2 solid titanium rods and dozens of screws implanted in her spine. Yes, her spine was straightened, but it could no longer move or grow, and there was no more ballet, no more soccer, and skiing became a very sedentary sport for her. She had to reinvent her life, and she faces a lifetime of potential complications. I spoke to an investor last month who in his 50s, 35 years after having this surgery, he got an infection, had to go through a huge operation to get everything taken out and treated. We're changing that with our dynamic tethering system. It's non-fusion. It's a flexible tether attached to the side of the spine, and one end of that tether is connected to an adjuster, which is shown in this inset image in the box. That adjuster can change the length and tension of that tether after the surgery in the doctor's office without going back into the OR. The doctor takes an x-ray, he takes a handheld device and holds it up against the spine and changes the implant and allows it to grow with the child, creating a personalized solution for every patient. There are 2 static tethers on the market which have a high failure rate, just like the rods in fusion. When we compare our product to them, we are less invasive and motion preserving like the static tethers, but our tensile strength is 2.5 times the static ones and 10 times the durability to eliminate the failure rates they're seeing, and we can adjust it non-invasively so it grows with the child. This isn't just a great solution for these children, it's a huge market opportunity. Our beachhead market in the US is almost $1 billion itself, and we can expand into adult applications after that. The other exciting thing about the pediatric market is it's very focused. These are complex surgeries. They don't take place in every hospital around the world or country, and they're not done in ambulatory surgery centers. They're done in children's hospitals and really large academic medical centers. It's very focused. We have great relationships with a lot of these centers. That plus a very high reimbursement rate creates a rapid sales ramp and profitability within 3 years after launching. We've done a lot on a very little so far. We have issued patents covering our technology around the globe. We have 3-month preclinical data showing that we can do these adjustments and change the spine curvature non-invasively after the implant. We have FDA breakthrough device designation, and we've done 4 other pre-subs with the FDA, gotten feedback on our clinical and preclinical protocols. We know exactly what they want to see. We have strong interest from lots of surgeons, and several of them have invested in our company. And we're a very, very experienced team. We have 90 years combined in the medical device industry. That includes 8 startups that we've exited from, 2 of those with IPOs generating over $1.7 billion in investor returns. And importantly, myself, my Chief Science Officer, Dr. Kadaba, and our VP of R&D all work together at another spine startup, CoAlign Innovations. CoAlign developed an expandable interbody fusion cage for low back surgery in adults. After 2 rounds of funding, we sold that to Stryker at a 16x multiple. We've got great top leaders from around the world in the spine space, both pediatric spine surgeons and adult spine surgeons, because we will expand into the adult market as well. I have a booth upstairs, and I'm happy to answer any other questions that you might have. Please stop by today. Thank you so much.
Thank you. Thank you. John Ashley, CEO of Octus Surgical. Thank you. Okay, and one more company showcase by Orthosan, inviting to the stage the CEO, Richard Simmons. Please make a round of applause. Do you like that one or the podium? Okay.
Hello, thanks for sparing me 6 minutes. We've only got 6 minutes, so I really want to make this count. Which one do I press? No, I pressed too many. Okay, so I really want to make this count. So I want to tell you about an impact treatment that will affect millions of lives with a platform technology. I want to tell you about the team and how we have many years of experience between us in MedTech, and specifically my CTO, who only last weekend had his first exit at $1.5 billion. We're well funded. We're looking for a 15 million round, of which we've raised a little more than half, and we've got a clear plan and a panel of global patents. Let me get into it. There we go. So back pain. Back pain is the medical device problem that nobody's really talking about. It's the leading cause of time lost to disability globally. And in the US, the Journal of American Medicine found that $135 billion is spent on the treatment of back pain. That's the largest of any of the 154 healthcare conditions. So we believe it's a priority. We've identified a $1.8 billion obtainable market in the US alone for this technology, and an almost $6 billion global opportunity for this technology if we look at the platform more broadly. And what is it? So this is a MRI of an intravertebral disc. It could be yours, it certainly could be mine. It's degenerated a little bit. So you can see a little bit of the structure in the center is beginning to degenerate. That's called the nucleus. The annulus around the outside you can see kind of like a tire. And that's also a little kinked, a little flat. And this is a disc that's could be giving the patient some back pain. What we've developed is an injectable, anatomy-sparing implant that will provide a conservative care treatment for this patient. What happens is we inject the implant into the nucleus through a very small needle, 0.6 millimeters, sparing the annulus. The implant itself does no harm to the nucleus. It interdigitates, sets down roots within the nucleus, within the disc. to restore a little bit of height if you want to, but certainly to restore the mechanics in the disc. So we've got an implant that's anatomy sparing on the way in. It works with the biology. It restores the mechanics, but also rehydrates the disc. And that has a pretty dramatic effect on the biology too. It's a procedure that can be performed in an ambulatory surgery center or in a hospital. It'll be less than 30 minutes on the table, and the patient would be sedated. So the team. There's actually a team of 14 of us based on Science Park on the south side of Oxford in the UK. The leadership team is myself, as CEO. I founded the company, raised $15 million to date for the company. We're partway through our Series 2A round with $5 million, an additional $5 million in the bank, and we're now looking to raise another 10, of which we have a book of 6 or 7. I work day to day with my co-founder, Professor Kousios, who will actually be here tomorrow telling you all about his experience taking his first company, Organox, from bench to $1.5 billion acquisition by Terumo, which went through last weekend. And finally, my chair, Ken Reali, who knows many of you guys already. He's 3-time CEO and has taken those companies through exits, through IPOs, and through acquisition. We've done, the main message being, we have done this before. And I think one of the things that we've talked about is this is a repeated theme, for any technology to fit within the workflow. And I have back pain. Mine's worse in the morning, so I'm okay right now. But if someone says to me, go for physiotherapy, sure, I'll agree. And even a minimally invasive injection, sure, I'll agree. But a lot of surgeries, for back pain alone, you're going to take a look at Google and you're probably going to talk your way out of it. And what's happened is it's left this gap in the treatment regime where patients are not happy to have those invasive surgeries, but instead are looking for the minimally invasive options. But those minimally invasive conservative options don't give a durable relief. Often that relief is temporary. And into that hole has come opioid pain management, amongst other things. We've identified an obtainable $1.8 billion opportunity to be as safe as a conservative care option, with the patient up and around the same day, but at giving durable relief with a biostructural implant that's giving mechanical support but restoring the biology too. If you like, the last conservative care, first durable treatment option for back pain. With that 15 million round, we will take the company through its North American first-in-human safety series. That will allow us to finalize the large animal in vivo program. It will allow us to complete all of the preclinical work, get us into a US and Health Canada approved first-in-human program. So what I hope to do is redefine the treatment of back pain with a safe and durable treatment which we can scale. The moment to invest is now, before strategic investors move in at the next round and bring us a big value inflection. Thank you.
Thank you so much, Richard Simmons and Orthosan. Thank you. Okay, ladies and gentlemen, we are now ready for the next panel that we have for today. I would like to ask my colleagues to get the stage ready for that one. Okay, I'm going to hold this. Okay, so the next panel is going to focus on digital ORs and robotics that are transforming surgery and dentistry, imaging and integration, intelligent, minimally invasive procedures, and enhanced precision, leading to, of course, better patient outcomes. Making their way to the stage, our esteemed panelists and the moderator, Kashif Ikram, VP of Surgical Robotics and host of our MedTech Lives podcast, Olga Krivchenko, CEO and co-founder of Qualium Systems, Paul Roberts, CEO of Lupin Dental, Peter Gorham, Chief Commercial Officer of BHS Technologies, please have a seat, and Stan Kalinian, Editor-in-Chief of Good MedTech News. Ladies, gentlemen, have your have your seats. You probably want to follow the overlay on the screen if you want to. Yeah, this is the plan. Okay. Very good.
Digital OR and robotics. From imaging to intelligent surgery and dentistry.
Looking great. Perfect. Perfect
right.
match. Thank you.
It's almost Good. like we planned that. We tried. Excellent.
We don't want to get people confused as to who we are.
So it's very nice to see all of you today in Malta. Great event so far, and I'd like to welcome our panel. Perhaps since most of you are in MedTech, you know how big robotics market is, how it evolved over the years, and certainly the numbers are just staggering. I mean, just to give you an example, recently, in the last 10 months, over $700 million investment was made in early, late, and late-stage robotics companies. So this in particular space is growing. We've got 4 prominent leaders who have witnessed it all. And I would like each of you to start introducing and sharing our thoughts and our visions on the robotics sector so far.
Starting with, you want to start?
Peter, let's start from you.
Okay. I would say that we start with the youngest, but that's almost certainly not the case. Thank you very much, Stan. Great to be here. For those that don't know me, my name's Peter Gorham. I am Chief Commercial Officer at BHS Technologies. We are a small company based in Austria, developing a large product, a robotic digital microscope that's used in surgery, in neurosurgery, in ENT, and plastic surgery mainly. I'm the oldest guy in most rooms now. When I go to my office, I'm certainly one of the oldest guys. I've been around 20 years. I've worked in robotics for the last 7 years, I think. Been fascinated by it since I joined the industry in 2005. I'll start as I mean to go on. I couldn't believe that Intuitive Surgery had developed such a good business model, such a good company out of a product that seemingly didn't add a great deal of value to the operating room. And I loved them for it, rightly or wrongly, but I've always had an interest in the industry. So I'm really glad to be on the panel and look forward to talking to everybody.
Grand. So my name's Kash Ikram, and thank you very much for the invitation and the chance to be here and speak. So I'm 30 plus years in the business. I know I look very young, and you can't tell. Started off in orthopedics. I've done intensive care. I've done radiotherapy and surgical robotics. So launched multiple products and new sectors like minimally invasive cardiac output, lots of different hips, knees, sutureless cardiac valves. But more recently, I launched the Hugo robot for Medtronic. I then did a relaunch of Distal Motions robot. I've Corindus, the vascular robot for cardiac and neuro procedures. And recently I joined Microport with their launch of the surgical robot as well for the European market. Microport is a Chinese, quite large corporation present in lots of areas. And it's an area now where we're seeing lots of new competitors entering the market. So we're very much into the growth phase of the marketplace. So yeah, pleasure to be here.
Thank you. My name's Paul Roberts. I'm CEO of Lupin Dental. I don't know what age I am, seeing as that seems to be the topic we're all opening at relative to you guys. But put it this way, I worked out I've done 18 years in surgical robotics in one form or another. I started off my life as a consultant, actually, and spent a happy decade going up the complexity tree, starting with lap instruments, then powered lap instruments, then robotics, and that led to the good fortune I had to co-found CMR Surgical. So that was a happy journey as COO and then Chief Customer Success Officer. After I left that, I moved up the body and into the mouth. So I'm here today as CEO of Lupin Dental. We'll get into this, no doubt, in the conversation, but automation and robotics is something of a passion of mine. I'm an engineer by training, so obviously I believe that technology will solve the world's problems. But actually, I think we're coming to the point in time where finally the technology and the medical need is beautifully matched.
Hello everywhere. My name is Olga Krivchenko. I'm CEO and co-founder of Column Systems. Happy, absolutely excited to be in here. We are from software part, so we are trying to be the best software partners of our hardware colleagues, and we are from immersive field, so we are developing immersive solutions for education, for learning and for operational rooms. So actually we trying to help users of these amazing devices to understand how to use it and not to break it from the first time. Again, happy to be here. Thank you for inviting.
Thank you. I'd like to add that with age comes wisdom. So it's great to have 4 leaders from the robotics. Like I said, I know you guys, you saw it all. And perhaps I'll start from you, Cash. I know you spent 20 years in MedTech. Sorry, more than 20 years in MedTech. And the last 10 years really dedicated to commercialization of soft tissue robotics. So what can you tell about the early adoption, how the industry evolved so far, how the technology evolved? Could you just share your thoughts and views on that?
Yeah, especially in Europe, the adoption really follows Rogers curve, right? You see the early adopters coming in. There's definitely a chasm that catches a lot of companies before you get into the early majority stage. And I think surgical robotics, at least soft tissue surgical robotics, has definitely crossed the chasm because of what Intuitive has pioneered over the last 30 years. But that doesn't mean that new incumbents to the market will not fall into the chasm, right? And what are the barriers that you have to overcome? I mean, I'm not teaching anybody anything new here, but reimbursement, I would put top of the list. And I think the recent change from MDD to MDR has been a significant barrier. In the past, companies always used to launch their products in Europe. So we used to have a lot of product launch specialists in Europe. Now everybody's switching and launching in the US, which is kind of very new for us. And don't get me wrong, I think it's extremely important to have a very high bar when it comes to regulatory, because that protects us, our family members, everybody in society. But the process is taking too long, right? And the process needs to speed up. It's taking a long time to get innovation to the market, at least in the European. Then when you launch a product, you've got to make sure there's some reimbursement, right? There's some great ideas out there, but if there isn't a pot of money or a way to get that money to your company in the form of some form of reimbursement or pay for that product and service, then you don't really have a business. You have a great idea and maybe a great product, but not a business. So that's very important. Workflow, are you going to slightly change the way they're doing things now, or are you just wiping the slate clean and saying we're going to change? Can be a lot of resistance to that, especially in cultures where they're risk averse, where they prioritize patient safety over new innovations. Examples of that, for example, in Germany, when you want to sterilize robotic instruments, the bar is extremely high. And a lot of robotic companies have fallen foul to Germany's sterilization rules and had to either withdraw their product or really go back to square one. I think recently, data protection, cybersecurity with some of our products is a huge barrier to overcome. There's a lot of risk averse. There's a lot of things we need to prove. And then I think finally, distribution and logistics. If you're launching a product that needs infrastructure change in the hospital, if your hospital is an old building like this incredible building, like you see in Italy, in Greece, in France, in many places, are they equipped? They might love your idea, but there's no way they can get your equipment in. So all of these things you need to think through when it comes to adoption.
Thank you. Peter, from your point of view, what new tools and robotic features were the biggest over the last few years, and how does the industry cope with the demand of the surgeons and of the hospitals?
So, I think I'll start with what I don't think straight away. When you think of features, I don't think there's been any, if we look at the major platforms, I don't think there's been any breakthrough features that have really changed the game. I think Intuitive Surgical told us for 28 years that you didn't need force feedback, that the 3D vision was feedback enough for the surgeon. And then in Da Vinci 5, feedback became a feature and it was the most important thing. But it hasn't allowed a surgeon to do more surgery. It hasn't allowed new procedures to be done. It hasn't solved any problems. And I think when you look at the leaps, the advances, the most important thing is actually having an impact on the patient. Is what you are doing moving the needle at all, or is it just making things slightly better? And so I look at companies that are really focused. I think specialization over the last few years in robotics and digitalization is really the key change. So companies like Procept, who focus on the prostate, its aquablation for prostate, so a relatively small patient population. Yes, it's half the world, but they're really, really focused. Same with Quantum Surgical, based in France, focused on liver surgery, and I think it's these robots that are really moving the needle, because it's all very well and good being super general, but I think being super specialized is what's really important. And that's what we're trying to do at BHS Technologies. It's to try and find where we can have a real impact, not just on ourselves, but really on the end user and the patient themselves. And it's challenging. I think you've really got to be able to demonstrate a clear difference. And that's definitely happening. And I think the companies that are really differentiating themselves, that are saying, yep, I'm going to go over this side and I'm going to look directly at this patient population, I think they're the ones that are going to make the difference.
Thank you. So far we've covered perhaps some of the aspects of the soft tissue robotics primarily, and we start to look more into the specialization. So we know robotics have come a long way, so it's no longer just about general surgery ward. It's now getting into some other modalities, and dentistry is being one of them. So Paul, could you just tell us a little bit more about your company, what you do, and how you envision dentistry robotics moving forward?
Yeah, thank you. I agree with many of the comments that have been made, and I would say dentistry is perhaps 20 years behind in terms of surgery. So seeing as we seem to be measuring things by the Intuitive Surgical benchmark, we're in the year 2000, I think, in dentistry. So today there are 3 approved dental robots, 2 in implant placement and 1, us, Lupin Dental, for restorative dentistry. And I think if I tried to add it up, and you know better than me, Cash, but I was saying at least 50, covering all the disciplines you mentioned. So we're well behind. But I suppose one upside of that is that there's no 1,000-pound gorilla. There's no single company which is actually, although I have a ton of respect for Intuitive, like you do, Peter, actually delayed innovation a little bit. Hugely. It wasn't the intention, but that's what happened. And I think one interesting thing about dentistry is the digital revolution has happened in reverse. Because I'd say the digital revolution happened in surgery after the robot. So you're sitting here with the hardware guys, but actually in dentistry, over the last 10 years, the technology has digitized. So when you go to the dentist, if you've not been recently, don't be surprised if you get an intraoral scan. This is structured light. It's high technology, doing a very precise, I think 10 micron accurate 3D scan of your mouth. That's standard of care in most dental practices. And the fabrication technology you need to actually make dental restorations is, again, standard of care. Dental ceramics exist that are really very similar to the natural tooth and enamel that we have. And there are CAD/CAM software and milling machines to fabricate those. The missing bit is the human element. And we all love our dentists. I'm not against dentists. I'm pro-dentists being doctors. being folk who have a duty of care to their patients. But actually, we ask our dentists to do some pretty manual stuff, which if you pre-plan and if you automatically execute, significantly drives clinical benefit. So I'd say we are in the year 2000, but actually some of the bedrock and the ecosystem that will allow robotics to really thrive is already present. So I reckon 2025 is going to be a turning point in the calendar of dental robotics.
Thank you. Excellent. Olga, when we think about the robotic systems, we typically picture capital equipment. So something big, something fancy, something that every surgeon probably wants to have in their operating room environment. But fundamentally, it doesn't work without the software. So from the software specialization point of view, how far are we in adoption? What has been accomplished so far? And how do you envision, from the software company point of view, the robotics adoption across the world?
Yeah, you're absolutely right that quite long time, all this robotic things, it was about big machines and equipment. But let's be realistic, hardware without software doesn't work. And also very important thing that software helps to integrate all the things to hospital infrastructure in different ways. For example, just integrate robot to healthcare or hospital systems. It's one thing. Another thing, it's providing data to surgeons, for example, using immersive or not immersive things, but it also in a software layer. Of course, robots or microscopes collected, but software make its useful information for surgeon to making fast decisions, immediate decisions. And of course, important things, it's educating of staff, educating of surgeons, doctors, young doctors, operators, and is where software really helps to make it easy and really make it more democratic and more acceptable to different levels of hospitals or medical institutions, of course. So I can say that robots began the revolution, but software make it affordable for people, for hospitals, and for young specialists who started its careers here in robotics and newest modern medicine.
I like it, thank you. I think we starting such the point of democratization. And I'd like to read an article that Cash actually wrote for my magazine, and I'm really truly fascinated how you put it together. And imagine not having to be taken by an ambulance to a hospital for a stroke treatment if you can be treated in the ambulance when it arrives. Or a surgeon being able to operate on several patients in different rooms without having to wait for operating room turnaround. Perhaps you live on an island and don't savor for the thought of traveling far away for weeks to be treated with your family and loved ones and being close by. A surgeon in the future could potentially treat 4 patients in 4 countries without having to queue up in a single immigration line at the airport and surrender their fingerprints. So I really like that. So Cash, from your perspective, I know you're really big on telesurgery. How do you see the democratization occurring in the market? How does it help the robotic industry to democratize it?
I think this is a really interesting area and a new development for us. So essentially, what our companies are doing is they're putting a high-powered computer between the patient and the surgeon or the dentist, right, or the healthcare professional. And the question then becomes, well, what can you do with that, right? And we're market leaders when it comes to telesurgery. We've done over 400 telesurgeries. And this is not tele-mentoring or tele-proctoring. This is actually the surgeon who's sitting in one location operating on a patient who's in another location. In terms of distance, we've done from Shanghai to Morocco, we've done from Shanghai to Kuwait, we've done from Orlando to Angola So we can cover vast distances, right? And there's a lot right now about longest, farthest, furthest, like when aeroplanes were invented, right? So it's fascinating, right? The question then goes to what can we do with this technology? And that's the subject of democratizing healthcare, right? So we was at a big robotic congress in the summer, and it was one of the large companies, person was talking, and someone from Latin America asked them, "You're not deeply penetrated in our region. When are you going to come to Latin America and really expand?" And the answer from the person was, "Well, you guys don't even do, you're still doing open surgery. You don't even do lab." And if you flip that on the head, the way we think of it is, you know, you're doing open surgery, you're not doing lab. What a great opportunity to leapfrog and go straight to robotics, right? You don't need to do 20 years of laparoscopic surgery. So we have that opportunity to take somebody who is, to bring them directly to what people are doing in the West today, right? But what does that then mean, right? So we've got a surgeon in London who can then operate on a patient in, let's say, Angola, okay? What does that, it's not that the surgeon just sits at the console and operates. In Angola, you're going to have to upskill people. So in comes the robot, but that acts as a catalyst to drive up the skill set. So then you have to have the nurses who can deal with the robot pre, during, and post. You need to have surgeons that, should the signal break down, that they can take over the surgery. You need to have the infrastructure. You need to have the 5G network within the hospital. So what you suddenly get is a catalyst that drives innovation within that center that they were not thinking of. And that's democratizing healthcare. That's bringing, in comes a tide and all the boats rise, right? And then there's efficiency and stuff like that. I can see a situation in dental where one dental surgeon can sit in one location and treat 5 patients anywhere in the world. And I think this is going to become a reality within the next 5 to 10 years. Let's go.
Thank you. Peter?
I may have some views on telesurgery.
I was just about to say that.
They may be somewhat conflicting with Cash's, but it was a great example of Angola. My opinion and my question to you, Cash, is why bother? Why not teach the surgeon to do really good surgery in Angola, train that team anyway? Why have you invested in teaching them robotics when you can teach them all surgery? Yeah. And I think when you... going around in my head just then was my own experience. Yeah. This time last year, my company, well, I was running my distributor meeting for my company. We brought all our distributors from around the world to Milan, and it kicked off at 5 p.m. and at 1 minute to 5, I ran out of the room in excruciating pain and ended up in an ambulance on my way to a hospital, and I went to one of the hospitals in Milan, and I was in the hallway for 27 hours on a trolley, and then I had my appendix out the next day. 27 hours, right? We talk about democratizing surgery by sending a robot to Angola, yet we can't even sort out our own healthcare systems and deliver surgery, bed spaces and surgery in the right way. So to me, it just seems like really over-egging to deliver that. What I do see the benefit of in telesurgery is super specialization. So I really like the idea. I'm not sure if there's any surgeons in the room how they would feel about it, but I like the idea of surgeons doing the same thing over and over again and getting much better at it. I like the idea of super specialization. And I think that one of the things we've seen in the UK with specialization is that elderly people don't like to travel. So the idea of taking the healthcare to them, like we used to, because people basically used to get operated on at their local hospital, and they don't now. They go to the specialist centres. I like the idea of that going out to them, and someone who's really good being able to deliver the surgery.
Right. So let me just answer a couple of those things very quickly, right? So one is we think about democratizing healthcare, and we think about Angola, and we think about Asia, but let's take the UK, right? Patients right now are going from North Wales to London to get their procedures done. If you live in Gibraltar, the Falkland Islands, Guernsey, you have to leave your family, go to London, stay there, get your operation done, then go to a hotel for a week because you've got a catheter in you can't fly home, right? So there's efficiencies right there. In Sweden, right now, I live in Sweden. If you go to Sweden now, the weather's not like this, right? And if you live in the north of Sweden, there's only 4 main cities, right? There's Malmö, Lund, Gothenburg, and Stockholm. If you need a serious procedure done, you got to fly to Stockholm and spend. What if you no longer have to do that? So there's a specialization aspect. You can have a surgeon who's super specialized in one kind of procedure, and they can do it anywhere in the world, right? Or in a country. But you also have the ability to stop patients traveling, even in the Western world, because we have huge gaps of healthcare, right? So healthcare provision, even in a country like the UK, in Germany, in France as well. So I think it's going to be on 3 levels. There's within one hospital group, you know, like St. George's has 6 or 7 satellite hospitals. You could have one surgeon on call, and he's on call for 5 or 6 hospitals. You can do cross-border. So a group like Santa Maria Group in Italy can service the hospitals they have in France, in Croatia, in Poland, from one of their centers. And then we can go further. I mean, we can go underground, we can go into space. Remember the 2 astronauts that went into the space station to deliver something for a week, and then there was a problem, and they were up there for 8 months. If one of them had had an appendicitis...
Yes, I think there's a really hot debate
it's
now.
It's a death sentence.
We've started something here, haven't we?
Yeah.
Maybe.
I would love to actually, I mean, telesurgery is definitely a big subject of democratization, but, you know, I like the subject of an idea of Paul, you know, mentioning something about dentistry and the digital side of things. I mean, Paul, how do you see democratization in the dentistry robotics right now?
Well, thank you. And actually, I'll come back to the data, and I hope, Olga, you'll get a chance to come in on this in a moment. But one thing we can see straight away, and actually applies in surgery, and I think you probably agree with this, maybe both Peter and Kash, is that data does democratize, and rightly or wrongly, robots end up being a catalyst for data, particularly in surgery. But as I said, in dentistry, it's kind of happened the other way around. So the challenge we have in dentistry is actually a little different to surgery. What I've learned on my dental journey in the last year and a half is that crowns are bad. We've probably, many of us, had crowns. They're not always, and quite often are not ever, the right treatment, because they involve reducing your tooth down to a stump and then replacing what probably is perfectly good tooth with some dental ceramic. However good the dental ceramic is, much better to stick with what Mother Nature gave you. And what's taught in dental schools today is something called partial bonded restorations. Pretty obvious. It's minimally invasive dentistry, and we all know the benefits of minimally invasive surgery. But it's not done in a large number of cases. So, for example, I have a crown. That's a crown, and I have a good dentist. I wasn't even offered an alternative, but all that was wrong with my tooth was the front surface was damaged. I should have had a partial restoration. And actually, robotic technology, as I was explaining before, completes the gap. So the metaphor's not perfect, but bear with me here. If you imagine dentistry is a little bit like designing a glove to go on a hand and then making sure the hand is suitably shaped to fit the glove. And the 2 things go together. The end result is you want a beautiful glove, you want a beautiful tooth. Today, we can design the beautiful glove. That's a solved problem. What we can't do is make sure that the hand is suitable to fit it, unless we destroy the tooth and go for a crown. And so what robotics does is allow you to pre-plan the treatment, so you can design the tooth reduction, the tooth preparation, exactly to fit the restoration. And that's democratization, and it's enabling a treatment that is clinical best practice. The literature attests to this, but it's not often performed. And even in a high-end dentist in the UK, I wasn't even offered that treatment. And I think that is an example of democratization in dentistry.
Thank you. Olga, what about software? I mean, we understand and we've learned from your peers that it's so important for the clinicians and for the younger generation of physicians to understand how to use those, you know, very expensive tools, and they're typically complex. How does software bridge the gap of adoption of democratization?
Yeah, it's a great question because accessibility to all the things, it's why we are doing digital transformation, actually. And Now, with using modern technology software, I mean immersive technologies, AI simulations, cloud platforms, is possibility to give possibility young surgeons, young doctors to train and tone skills as much as possible. Again, it's possibility to train muscle memory for surgeons. Important before you be able to work with real patient, you have to tone your skills. Again, it's possibility to work from different places. As I understand, there are different ideas about using robots, but believe me, I tried our education platform with my colleagues from Italy. I'm from Ukraine, and we work together and studying some lessons about anatomy from different countries. So it's also a way to close these gaps and help surgeons and doctors and students to being very, very close to these devices, being in other countries, for example. Again, Cash said about robots in Cambodia or so. Again, we can create software for studying, and these young surgeons from Cambodia can firstly understand what they will work, how it use. It could be simulations with testing. They are not broken from first time. And then, of course, it also helps to adopt it faster and a more convenient way for producers of devices and for user of devices. So I believe that digital education, it's a way to integrate all these complex things to life of hospitals, of universities, of any institutions.
Thank you. The previous panel was about investment. It was about finding the new modalities, finding the new opportunities. Paul, why do you think dentistry and robotics dentistry is the future? Why could it be attractive from the investment standpoint? And how does Lupin Dental emerge in this particular space?
Thank you for the question. Well, if we're in the year 2000, so in the year 2000, I think Intuitive was worth 100 million. I looked up this morning, 200 billion this morning, 2,000 times increase in value. I do believe we're in the year 2000 in dentistry. We're one of 3 companies that have technology that is approved and in use. And the key thing is this. What will be the value creation mechanisms in the next 10 to 20 years? And in dentistry, it's ripe for change. Why? Because the 460 billion dental market is majority driven by the time taken for the dentist to perform treatments which take too long. And there is a huge unmet need in the dental market, which will be met by automation and robotics. It will be met by increasing the productivity of dentists. We estimate just for our procedures a 3-fold increase in productivity. And that productivity turns into value creation. So if I was betting my money, I'm here as CEO of Lupin Dental because I want to be involved in another unicorn. I've had my first one, but I think that dentistry is going to be the next creator of unicorn businesses because we're in the year 2000. So in 20 years' time, look at a 2,000 factor increase in value.
Thank you. Thank you. Peter, very quick questions here. I mean, we are quite, should be mindful of time. When creating a successful robotics company, we always need to think about the team. They need to be aligned. Commercialization of these devices, very, very complicated. So you really need to make sure that your team understands they can sell, they can perform. I mean, how do you do that? How do you create the commercial team alignment in the very first place? I mean, what's your take on that?
I think the key is really understanding the whole pathway that the product goes through. I think, for me, understanding the pain points in the operating room. So when I talk about me, my background is the operating room. It's minimally invasive surgery, so that's what I refer to. So I understand the difficulties that a surgeon faces, whether that's ergonomic challenges, whether that's access challenges, instrument challenges. I understand that. And I think when building a team, that's the knowledge that you've got to make sure that they've got. When I look to hire people, I believe that we can teach pretty much everything. So I hire not so much on experience, but definitely on cultural fit, alignment, attitude, motivation. I think that's the most important thing for me.
Cash, and the last one to you. I know you're, big podcaster. I know you've got your Our MedTech Lives out almost like every week.
The last episode was fantastic. Everybody should listen to it.
I was just about to say that. I mean,
I'm
we
sorry.
talk about adoption. We talk about adoption. We're talking about, really getting the robotic surgery out. I mean, but what is the problem? Why can't we get it? I mean, is there a specific issue that you've uncovered with this particular episode with Gardner Harris? What did he say? I mean, what he explained? What is the problem? Why it can't be everywhere?
So the podcast is Our MedTech Lives. What we're trying to do is encourage more people to come into our fantastic industry, and those people who are in the industry, how they navigate their careers from learning from veterans like this. You've been on my podcast. The last one that dropped this Tuesday, go check it out. It's the dark side of our business. It's when the profit, in my interpretation, the profit and the pressure that some people are on makes them make some decisions that are not in the benefit of the patient. And we all entered this business to help people, to make people live longer lives, pain-free lives, and to be disease-free. And this particular podcast talks to the side when that goes wrong. And it's a cautionary tale for all of us. So Gardner Harris is the author of the book, No More Tears, that looks at Johnson & Johnson. I encourage everyone to read the book and take a look at the podcast. It's on Spotify or on YouTube.
Thank you. And Olga, just to wrap it up, because without software we can't do anything. So talk about the future. Like, what will it be like, from your software company perspective,
I think, I believe that next decade it will be more bridges between software, modern software, the most modern software and hardware, and it will be really ecosystem, and all will understand that they don't need to afraid scary robots, and because it's very easy to teach how to use it. And so it will be not hardware, software, something. It will be some digital ecosystems, and it will make life of users much more easier.
Thank you. Thank you so much, all of you.
Thank you, Stan.
Thank you
Thanks,
for
Stan.
listening,
Well done.
taking time. Thank you.
Thank you.
Thank you so much. Fantastic panel. Thank you. Digital OR and robotics. Everyone, please make sure to catch up with our speakers off stage. Please make sure to stop by their booths upstairs. This is why we are all here today, to network, connect, speak to people, make new connections, run business ideas, get funding, and have fun. We are getting the stage ready for our next presentation, and it's a very dear presentation too for MedTech and for Sigma Group, because it showcases support that we have from Malta. And it's my big pleasure to invite to this stage our next speaker, Mr. George Gregory, Chief Executive Officer of Malta Enterprise. Please make a big round of applause for Mr. George. Thank you.
Keynote by Mr. George
Welcome.
Gregory, CEO
Good to
at
see you.
Malta Enterprise.
Is there a presentation?
Good afternoon, everyone. Distinguished guests, innovators, researchers, entrepreneurs. It's a pleasure to stand before a room with people who are shaping the future of healthcare. Each of you, whether you come from industry, academia, or the startup world represent the passion and the ingenuity that drives forward this sector. And for a Malta enterprise, events like this are much more than conferences. We are living in an era of extraordinary transformation. The convergence of biotechnology, artificial intelligence, data science, and advanced manufacturing is reshaping how we diagnose, treat, and even prevent disease. The MedTech industry sits at the heart of this transformation, combining precision, creativity, and compassion to improve lives on a global scale. But innovation does not happen in isolation. It thrives in ecosystems, and that is where the Malta story begins. Over the next decade, Malta aims to strengthen its position as a specialized, high-value hub for medtech and life sciences, a place where research, clinical development, and commercialization come together seamlessly. We are moving from being known as a manufacturing base to becoming a dynamic center of excellence, innovation, and collaboration. Guided by Vision 2050, our national strategy focuses on sustainability, digitalization, and talent development, ensuring our growth is competitive, inclusive, and future-proof. Malta's strategic location at the crossroads of Europe and North Africa gives companies based here access to diverse markets. But more importantly, it allows us to act as a bridge between regions, industries, and ideas. So why do medtech companies choose Malta? First, regulatory excellence. As an EU member state, Malta offers full alignment with European regulations, giving companies seamless access to Europe's 450 million customers. Our Malta Medicines Authority is among the most respected in Europe, efficient, responsive, and even authorized by the FDA to issue certifications, which is a significant global advantage. Second, strategic location and logistics. From Malta, companies can reach multiple regions efficiently while benefiting from a business environment that values agility and partnership. Third, our people. Malta boasts a skilled multilingual workforce with decades of experience in pharmaceuticals, precision engineering, and medical devices. And we are investing heavily in the next generation through academia, research, industry partnerships, and workforce training schemes. And finally, our values, sustainability and innovation, which go hand in hand. Vision 2050 ensures that every step forward strengthens both our economy and our environment. Malta Enterprise is proud to offer comprehensive support frameworks for medtech startups, scale-ups, as well as established firms. From startup finance that helps founders turn ideas into companies, to R&D and innovate schemes that funds research and technology development, our goal is simple: to reduce barriers and accelerate growth. We also support skills development, helping companies train and upskill their employees in technical and regulatory areas critical to success. And for larger projects, our invest and business development schemes attract high-value investment that create skilled employment and expand Malta's industrial and innovation capacity. This is not just about incentives, it's about partnerships. Every company we work with receives tailored support from our dedicated relationship managers because we understand that innovation needs flexibility and collaboration to drive. One of Malta's greatest strengths is its ability to connect public research institutions and private enterprise. We work closely with the University of Malta, MCAST, Mater Dei Hospital, and a number of international partners to turn research into real-world solutions, whether through clinical trials, data-driven diagnostics, or next-generation medical devices. These collaborations not only build capacity, but create a pipeline where discoveries can be developed, tested, and commercialized right here on this island. Global investors are increasingly recognizing Malta's potential. We have seen a rising interest in areas such as oncology research, artificial intelligence in diagnostics, and digital health, fields that have the power to redefine modern medicine. Talent remains the foundation of everything we do. Malta's quality of life and welcoming culture makes it an appealing destination for international professions, and we can make it easy for them to relocate and contribute. And because we are a small nation, we are agile. We can adapt quickly, regulatory or market changes, ensuring that our ecosystem remains competitive and future-ready. MedTech World shines a global spotlight on Malta, connecting innovators, investors, and thought leaders from across the world. It strengthens our ecosystem, drives visibility, and opens doors for collaboration and investment. Together, we are building not just a hub, but a community. Ladies and gentlemen, as we look forward ahead, our ambition is clear: to make Malta a small island with a global impact, and the destination and global impact on the future of healthcare. We have the vision, the talent, the partnerships, and the determination to achieve it all. But innovation does not happen in isolation, it happens through collaboration. So I invite each and every one of you, whether you're an investor, a researcher, or an entrepreneur, to partner with us. Bring your ideas, your expertise, and your passion to Malta. Together, we can shape a future where technology and humanity work hand in hand, delivering better care, better lives, and a healthier world for all. Thank you.
Thank you so much, Mr. Gregory. George Gregory, CEO of Malta Enterprise. Make sure to catch up with Mr. Gregory and Malta Enterprise at their booth upstairs. Now, I think it's time to take a little break. We will have some coffee and be back to this stage in 15 minutes, 3:20. Make sure to be back here because we will continue the conference program. And we're going to talk about data and MedTech, featuring amazing speakers. A little heads up, we're going to have someone from NVIDIA. That's very exciting. Make sure to be here in 15 minutes. I'll see you soon. Guys, please come back. We're waiting for you to resume our conference. And we have a very exciting panel ahead. I am personally very excited because I host tech conferences myself. And this next panel is about data-driven medtech. And it will explore how real-world evidence, artificial intelligence, digital tech platforms are driving smarter decisions, faster innovation, and new models of healthcare in an ecosystem that is actually data-driven. So what's going to happen with the data? And it's my big pleasure to invite our esteemed panelists on the stage. Let's go. Dr. Eva Maria Hempe, Executive Director of Healthcare and Life Sciences at NVIDIA. Dr. Ryan Gregg, Consultant Cardiothoracic Radiologist at NHS Golden Jubilee. Esther Reynal de Saint-Michel Ricardo, Founding General Partner at Thena Capital. Kevin Siam, Managing Director of Zaburus. And Sean J. Chang, Managing Director of Accession Ventures. Please make a big round of applause for a great panel. Thank you.
Data-driven MedTech, 360 view.
Hi, good afternoon, everyone. My name is Ryan. I'm a cardiothoracic radiologist, and I think with today's session, we would like to ask a simple question. How much of the MedTech revolution is real, and how much is still waiting to happen? Technology we know is quite breathtaking, but is it really there yet for healthcare? With me today, I have 4 excellent panelists to discover all of this. Hopefully, we'll have enough time to go through everything. But essentially, I want to start first by giving you 1 minute to introduce yourselves and then answer quickly this question: what does data-driven MedTech mean in your own world? You want to start, Kevin?
Sure. Great to be here. Thanks for having me. MedTech Malta. My name is Sean Chang. I'm a managing director at Accession Ventures. We are a health system strategic fund investing on behalf of some of the U.S.'s largest health systems and hospitals. The way that we work is that we pull capital from a number of different health systems focused on innovation and care delivery. And we deploy that capital in anything that really touches hospitals. So you can imagine that's a pretty broad mandate. I lead the MedTech and Life Sciences practice, so it's really anything that's FDA regulated, but also there's a practice in healthcare IT and digital health, and then also a services practice that looks at larger brick and mortar businesses. Within MedTech, we're investing out of our latest fund is $285 million, and our focus is pretty broad in terms of I think keeping the providers happy as well as pushing for patient outcomes. What data means to me in MedTech is probably threefold where I get excited. One is in the short term, it's about improving efficiencies and reducing costs in running clinical trials and being able to leverage things like digital twins, dynamic clinical trials, to really make our capital efficient so that we can drive return on investments for our investments and also bringing that innovation to the clinic faster. I think in the midterm and long term, where I'm excited about is being able to drive data into things like robotics that then automates different parts of the hospital operations, from surgery through to things like delivering medical supplies, and also things like revenue cycle management. So beyond that, I'm very excited to explore and talk about it. I think we're at the cusp, but also very early days in MedTech and data. So I'd love to hear more about how my co-panelists think about this.
Yeah, thanks. Esther?
Hi everyone, I'm Esther Reynal de Saint-Michel Ricardo. I'm one of the founding partners of Thena Capital. So we're a UK early stage MedTech fund, investing in digital platforms and fast-track medical devices. I think, Sean, you've said quite a lot on what data-driven MedTech is, but so let me take a different perspective. I think, in a way, any regulated healthcare product has always been data-driven, or should have always been data-driven, right? I think, and I think we'll explore that topic later, but what's exciting is now we're talking about larger data sets and how we look at it. And at Sina, we invest in companies that, and in solutions that transform the patient experience. And I think the opportunity to do that at a much larger scale with the new access to larger data sets and the AI tools, I think we're coming to, it's going to be transformational. So,
Thank you. Sean?
Yeah, hi everyone. Happy to be on this panel. I'm Kevin Sam. I'm the managing director and founder of Zapirus. We ourselves are a data company, actually, powered by AI in-house and also large language models. And so we're very familiar with that, this topic, right? But when you talk about data, there's layers of data. There's like patient level data, there's research level data, which is scientific technology, there's clinical data, company level data, people level data. So I'm excited to dive deeper into all those topics of data and how MedTech is more and more data driven right now. The whole world is, right? Because we've moved on from physical libraries to access information to the age of the internet and Google to tap in search engines as being able to access data quick. We're already there, but expanding into the age of AI and agents. And so transforming data and outputting that data in a much more efficient way, to Sean's point. But then that creates a different layer of complexity there, right? In terms of what you do with the data, how do you interpret that, what's been presented to you. So lots of topics to discuss, and I'm looking forward to this session.
So I'm Eva Maria Hempe. I lead healthcare and life sciences for NVIDIA in Europe, Middle East, and Africa. Occasionally people wonder, like, what am I doing here? I work for a chip company, but actually I do not work for a chip company. If you're worth $5 trillion, I don't know where we stand right now, but we were at least 2 weeks ago worth $5 trillion.
You just checked, don't lie. You just checked just right before this.
Basically, there's no $5 trillion chip company. So we're actually a full stack computing company. What we really are about are libraries. It's about finding bottlenecks, like finding things that are done right now still on CPU, not because CPU is the best technology to run it, just because that was what was available when the libraries were written, and we're trying to accelerate, which is parallelize as much of like data processing as we can. And so there's data here. To me, data is the basic of all of AI. So AI in general needs three main ingredients. It needs data, it needs compute, and it needs algorithms. And yeah, so I think there's a lot of potential for AI, but also just plain old machine learning, which also needs data, in MedTech, particularly things like software-defined devices, being able to really use algorithms, the whole interface between the technology and diagnostics, I find super interesting, and I hope we're going to be talking about that as well.
Yeah, all nice points. So tagging onto that, Eva, from the infrastructure side of things, do you think we are close to using healthcare data in real time rather than collecting the data and then using the data afterwards?
We can do it, and we are doing it. The question is it widely spread? But I mean, one application I think is actually really cool. I'm not a surgeon, you are, but I was actually using a surgical robot on a pig, and I was trying to sort of navigate in there, and I'm like, this is so hard. I mean, you only have this laparoscopic camera. Like, how do you know where you're gonna cut? And so there, you can use data by kind of doing augmented reality and overlaying what you see with what you're trying to do or what you're not trying to do. We also have companies we work with, like Pangea Data, who are looking at care gaps. So they can actually guide a physician through certain questions. And this impacts lives. I mean, I talked about hypophosphatasia. 2 weeks ago, there's like 8 years until those people get diagnosed or more when they have like bone problems, pain, and so you can play this data from a patient record in there. You can help a physician ask the right questions and get to the right answer. So these things are possible today. Is it widely spread? Not yet.
So I think what I'm trying to explore here is how much we're translating, AI into real world impact that, even the most remote hospitals can potentially tap into. And so I think, Kevin, you definitely analyze MedTech data, market data. And is there any particular sector that you think is showing any genuine commercial traction, or kind of they're stalling? What do the adoption curves tell you about where we are at the moment?
Yeah, I mean, given that this is a data-driven MedTech panel, I wanted to get this right. So I asked my head of data to pull a report for me. So I'll be reading some numbers, factual numbers from that report. And it's funny you say surgical robotics, because that's top. That's number one. That's number one. And from a diagnostic standpoint too, and a thought just came when you were talking about that stuff, where in Canada we have a public healthcare system, and a lot of the times it's the wait times between diagnosis, processing that data and diagnosis, to therapy. And so a lot can be done to speed that up in a system that is budget strapped, not like a well-funded private system, right? And so that's just a thought that came up. But to your point about which sectors are seeing the highest increase, surgical robotics, to my surprise, was number one. And we looked at this trend from 2023 or 2020 to date, so from COVID to now. Yeah. It's on a rapid increase. I think it's because of the application of surgical robotics, and I think Sean has some interesting insights about that. Secondarily, neuromodulation is the second one that's the fastest growing. Combination products and wearables are actually not really growing that fast, and the thing that's on decline is point-of-care instrumentation and diagnostic imaging, surprisingly enough. So
that's interesting, actually.
that shocked me as well. Yeah.
I'd have expected that.
Yeah. And the worst segment is digital therapeutics. that's plummeting faster. That ship is sinking faster than any other.
Maybe not entirely unexpected.
Yeah, but Sean has some cool insights, actually. We were talking about it earlier.
Yeah, happy to speak about that. And I think, I've been observing robotics for, more than a decade now. And you have bigger companies, obviously, like Intuitive Surgical, and then others like J&J, Stryker with the Mako systems. I think what we were seeing in the last 2-3 years, maybe 5 years, is a economic pressure from the hospitals and health systems that we keep a very close ear to, since we're investing on behalf of them. And the pressure is around just creating more efficiencies and reducing costs. And so you'll see that in recent couple of years, there's a movement towards ambulatory surgical centers, so ASCs, as we call them in the U.S. There's been some major movements there in terms of acquisitions, and it's very much a shift in thinking, I think, from a fee-for-service, large health system point of view towards one of the future where there's more unit economics and incentivizing physicians to reduce costs, in some way a value-based care way, but very much a free market value-based care way. And so under that context, where you can save time, costs, improve physician quality of life, is in robotics. And we're seeing, in combination with a lot of the great stuff that NVIDIA is doing and other companies, an improvement in the automation efficiency and accuracy side. And so there's this convergence towards a unit economics that actually works, right? Whereas before, there was a lot of subsidies, I think, from a lot of the robotics companies. There was, I think, inefficient reimbursements. And now we're seeing pressure from the reimbursement side, a want of efficiency from the hospitals, and then improvements in technology, right? And so that's a really exciting time to be investing in this space right now, and I'm really excited for the next 5 years of where that can go.
And a question, I think, to both you, Sean, and Esther, then, as investors, how would you distinguish the noise from, those companies that are really using data efficiently and strategically in their every day-to-day workings?
I think for us is, and you've started touching on it already, but different element is when it comes to clinical validation, actually, is that data, where is it taking you? What have you built? And has what you've built, is it useful? What is it driving? Improving patient outcomes, how well proven that is, and also, or is it driving, saving money at the same time, right? So I think that's one element. And is it going into advancing something at the same time? That's one. The second is from a regulatory point of view as well. How quickly, is that data strong enough to accelerate your regulatory roadmap? As we know, depending on the countries, the regulatory roadmap is not really clear with kind of AI platforms, etc. So I think that positioning and how well that has been thought through. But also it's the kind of data that's being used. So we look at a lot of companies that collaborate with pharma or are envisaging to exit to pharma or to collaborate in the future. The data that is needed for that is really different, right? It's a lot more longitudinal data as well. So that's then suddenly the companies who are thinking about early enough, it's not just about how they use data, how they source the data, and how proprietary that is. I think this is really key to us, and that's when it's not just noise.
Yeah, I completely agree, and I think one thing I would add is our bar is pretty high for investing in something that's based on an AI thesis, and so we haven't really done too much of it, but it has to impact your gross margins or EBITDA depending on what stage of company you are, or at least have a sense of it when we underwrite the deal. And what I mean by that is, I think about Hinge Health, which just recently went public, and in their S1, there's a section around AI, and then they they demonstrate a case where they're leveraging AI in various ways on the operations side to improve their gross margins, and that makes their IPO story just that much more attractive. And I don't know where their share price is, but it's something that I think is received positively. So the bar is pretty high that you have to prove out. At the end of the day, economically, you're improving one of your bottom lines or gross margins for us to invest in a AI thesis. That's how we really see the world. It's a little bit financially purist, but I think we have to keep the bar high.
Yeah, and I think now potentially we move a bit more to the emergence of synthetic data and kind of how the AI models are now trained, or LLMs. And maybe kind of starting with Kevin, across your analytics, again, is it something that's increasingly being seen in terms of the use of synthetic data and VR kind of rising in funding rounds and filings?
Yeah, that's an excellent question. So we ran a fund search experiment. So we decided that let's just count the number of those mentions across all sources in the globe. And if it's the ratio in public sources of mentions of those keywords, theoretically should match the ones that are happening behind closed doors. Theoretically, right? So we could extrapolate that. And so we did a count, and we found that mentioning of synthetic data and VR and all that declined since late 2022 at an average mention rate of about 2.5 times from 2022, where the peak was at December 2022, was the peak of those keyword mentions. And we think it's because the release of ChatGPT was November 2022. That's why it's peaked, yeah. So since then, it's declined at a rate of 2.5x in terms of topic of conversation and all that stuff.
That's impressive, actually.
Thought that was kind of fun.
But is that both you lumped synthetic data and VR together?
Together.
Because it's quite different.
I know. I just lumped it all together as a whole, yeah.
And so we've I think synthetic data is obviously quite good in healthcare, where you are kind of separating a bit from the patient side and the transfer of data. It's kind of maybe better for privacy and potentially reducing bias as well. Do you think that it is genuinely helping kind of companies today and the way that they are training their models?
Yeah, we're already starting to see that. As I said before, you have the three ingredients, so data, compute, and algorithms. And the problem with data is we are just in most applications of AI where data is sparse. So we all have our expectations set by ChatGPT. ChatGPT benefits from like a historic quirk, or however you want to call it, that basically we have the internet. And you have 10 to the 13 or something tokens out there, which were more or less publicly and openly available when they were scraped to train the big language models. It's no longer the case. We're increasingly seeing fragmentation there as well of people trying to kind of protect their data and wanting to monetize it independently. But basically when GPT 2 and 3 were trained, this was all available. In pretty much every other domain, including healthcare, you don't have as much data to start with, and then it's not as accessible. It's much more siloed, it's often private for good reasons, because it's personal identifiable data. So you have this data scarcity, and then you have the other problem of combinatorial explosion. Like every factor you're adding, you're basically further splitting your data sets. So in order to even have a chance to get somewhere close to the expectations which we raised all around with ChatGPT and other domains, we need to tackle the data problem. And in many areas, it is about simulating data. It's also even for self-driving cars, which is something we've worked on for 10 years, we do not have enough data. And particularly for the edge cases, for the rare things, for the children running in front of cars. Hopefully never happens, but you need this kind of data. So then you simulate it. And similar in healthcare, you can start to simulate some of that. And we're doing this for different cases. So the one is if you want to enrich your real patient data to kind of get more powerful data, to train more powerful models, we're seeing that happen. We're also seeing interesting things where we're trying to cross modalities. So if you want to reduce, particularly if you have to do recurring CT scans to monitor certain diseases, of course it comes with radiation. So people are trying to work that you can do MRIs instead and basically calculate back to CTs. You can also basically get data to train people. So we're seeing all of those applications and they're happening. And then what you said as well, like one of the ways to preserve privacy and avoid sending terabytes of data around the world is kind of take this data, train a model, and then kind of transfer that model. And with that, you're also preserving information content. So if I have 400 people, I train, or 4,000, however many you want, I train this model on, and then I create 400 images again. They're no longer real people, so you no longer have to have the problems of personal identifiable data. You can do much more with them. You no longer have questions around ethics. Well, you just have the question, like, can you do the model in the first place? But I think it's a very promising path forward, which allows us to overcome some of the fundamental limitations.
And maybe to build on that, what I find interesting, I think there's a risk there is your first model, especially if it's based on a specific population, that when you transfer your model, you know, the ethnicities, the demographics, that, you know, it shifts. And I think it's really interesting when those models then are updated, you know, they are used elsewhere, and then they're updated on new populations. So I think it's just, it can never stay static, right?
I guess, as always, you always have to be very cognizant of what data went inside. Like you can, and you need information content to come from somewhere. I mean, we also have use cases like if you have a data set which doesn't have enough male brains and you need to average this out, you can turn female brains into male brains to sort of even things out, but it needs to be based on information content. You can't just be making it up. So you kind of need to know like what went into it to then make an informed decision on what can this do. And I think that's true for all types of AI applications. I mean, the same if you're asking like ChatGPT something that it cannot know, or because it's something proprietary. I don't know, like how much is this hospital going to spend on doctor salaries? it will come up with some number, but as you know that it probably can't know this because it is not public knowledge, it's been trained on public knowledge. You just have to be very careful with those things, and that just holds true everywhere.
And Sean, does it make a difference for you in kind of when you were evaluating companies, whether kind of their main data asset is real clinical information or synthetic data?
It doesn't make a significant difference for me in a R&D sense. You know, I think you could, in certain extent, circumstances, use synthetic data to, you know, train your algorithms or reduce your patient base. You know, improve the power of your clinical study before you get to the big leagues, right? And you know, we used to do this in emerging markets. You know, run clinical trials there, right? And then you get to the, you know, real clinical trials in the US once you've already learned what the efficiencies and designs are, right? And so I think data can replace that now at a lower cost. But I would say once you get to the big leagues, the real clinical trials that matter, I would have probably significant questions about the fidelity of the data, whether it's real or not. We've been, I think, tracking this space, the digital twin space and synthetic data space for, you know, again, a decade. You know, there's been companies since the early 2010s that are, you know, doing this where you could prove that statistically significant, you know, population of synthetic data is equivalent, but I've not seen the really proliferation of utility there. So I think that tells me that there's still a reluctance, you know, perhaps driven by the FDA side or perhaps driven by the operating side to still do real human data trials at the end of the day to get approval.
John, I have a question, and maybe some people in the audience might have it as well. Can you describe to us what synthetic data is and how that differs from?
Yeah, so to me, it's, you know, taking human data, you know, from a population, and you've got, let's say, 80 attributes for each of these humans, which is really hard to collect, right? And being able to run a sort of randomized, you know, combination of those 80 attributes and expand the population from the 400 people that you collected to 4,000 now. And you know, to a statistical, you know, test, both of those sets pass in a, you know, statistical p-value way, right? So that to me is synthetic data. And then you can run that 4,000 patient retrospective trial at least against some sort of input, which is your therapy or your diagnostic. Yeah.
Thank you. And kind of moving on now to the final segment, because I'm aware that time is ticking, kind of more into the bringing us down to reality. So Esther, you know, valuations have now soared in a lot of different fields in healthcare, particularly, you know, anyone that mentions the word AI automatically sees a jump in maybe their valuation. Do you think all of this is irrational, or is it just what the deep tech scale really costs? So essentially, if there's a correction tomorrow, who do you think will survive?
I think that's a question. I think I've been asked a version of that question so many times in the last few months, and I think I'm probably all of us. So I think it's wondering how much of that is also creating that kind of bubble. But obviously AI now, everyone's talking about it. So investors, a lot of investors want to have exposure to it, right? Any kind of AI. So from the fact that from that point, obviously it's increasing because it's increasing the number of players in the market, right? I think when it comes to more specialist subsectors like MedTech, where I think the applications adoption at scale is not yet proven. You know, you have some strong cases, but it's not a lot of them yet. So it means you probably have fewer investors, right, looking at it. Valuations still have gone up in MedTech in anything to AI, but I think it's back to criteria we've discussed before. You know, I think the strong companies who are showing all the fundamentals. You know, AI now is a fundamental of MedTech, whatever company it is, right? But truly, fundamentally data-driven companies, and those that are extremely well managed across the board, even operationally, as you mentioned, with data at the core of how they run their business as well, were even more attractive to, you know, specialist investors who know what they're looking for. So I don't think from that aspect in MedTech it is a bubble, because I think that is there to stay. You know, AI being used by companies is there to stay. Whether there's going to be a bit of bump when we see that actually the regulatory roadmaps are a bit slower than we anticipated, adoption at scale is going to be slower, then yes, maybe you might have some softening of it, but
I guess we're probably around about the peak of the hype cycle, isn't it? And hopefully we'll start to correct. I'm aware that we just have 5 minutes left, and I think we've heard.
Maybe can I just say one thing? I think one thing which you also have to keep in mind when you think about the size of the market is that we are looking at a huge skill shortage or a huge labor shortage. And I think, to me, that is what is really driving this market. It is, and you hear this in all other areas as well, this is about like not just being more, like the market, you can't expand it in healthcare, because at some point if we're spending like 50% of GDP on healthcare, like it's just not sustainable. It's also not sustainable that we're missing millions of healthcare workers. So I think that's the real opportunity, is to do more with less workers and taking some of that money you would have spent on labor and using it for technology, and hopefully having also some left over to actually save and contain healthcare costs at a reasonable level of GDP.
Yeah, certainly. And I mean, not going to get into it now, but obviously then there are the arguments with regards to liability and all that kind of encompasses with that, and the ethics, I guess. But for the final lightning round, which can start, Sean, and move onwards, 3 things. What do you think will be mainstream in 5 years? What do you think, as in one item that will be mainstream in 5 years, one item that won't be mainstream in 5 years, and are we in a bubble or not?
Okay, tough questions. I'll try to take a stab at them. I think in 5 years, we're going to see a proliferation of the use of robotics, so embodied AI, as we call it, because the chipset's there, to Eva's point. I think the technology is there. It's about moving that data in the right way according to local policies and laws to get to the level of accuracy and insight. And I don't see anywhere else as exciting as robotics and automation, just because the market demands it. And again, to Eva's point, the labor side, for specific skill sets, just require it. And there's I don't need to repeat it, but the radiology sort of, paradox, right? Where there's not enough radiologists, but then the technology is not yet there. So I think in 5 years, I believe that there would be established segments where robotics will get there, driven by the convergent technologies that we see. I think that what we probably won't see is much the more superficial level AI usages, maybe even performative. You have to include AI in your deck, to get anything funded right now. I don't think we'll see that in 5 years. I think it'll be more, post AI in that way. So I think those are generally my thoughts. Whether we're in a bubble or not, I do think that in early stage investments, and this is generalized, not in MedTech, but I would say in general tech, there is a lot of bets on the same companies, right? And the assumption for each of those investors is that their company is going to win, but really only one of those is going to be the NVIDIAs of the world, and one of those is going to be the Microsofts of the world. And so I think in that way, a number of investors will be wrong and lose their money, and in that way it is a bubble.
Yep.
but I don't think it'll be one that bursts and then, I think, destroys the economy type.
Same questions? Oh, sorry.
Okay. Try to be quick to give you time. Mainstream. I think AI-driven diagnostic was bringing earlier diagnostic to quite a few conditions to match with improvement in earlier therapeutics. I think we'll see that quite a lot of. Not mainstream. I don't think prevention will be big anytime soon. And I think the bubble, I've already responded.
Okay, I'll try to keep it quick as well. Yeah, it's good. In 5 years, okay. And then the bubble thing. I have so many comments. Oh my God. So I think innovation is gonna speed up actually because of software, and we're in the full software space, right? And you look at the tech industry, it goes quick, and AI goes quick, and hardware is slow. Our industry, MedTech, medical devices in general, is connectable to AI, whereas drug development and drugs aren't. That in and of itself is going to speed up innovation in that space, I think, to make it faster, right? So in 5 years, I think we're going to see a lot more connected devices, advancements on the individual components like surgical and all that stuff, but then they're all going to start to talk to each other and do more together, right? In terms of bubbles, I think it's kind of like there's bubbles and then we're expanding our bubble. Like we're bringing the software companies in, and through combination products with drugs, we're bringing that industry in as well. So I think the bubble's just gotten bigger, and it's going to continue to get bigger.
I take a bit of offense with the thing that hardware is slow. Actually, we managed with software to shrink the hardware cycle down to a year. So we're bringing out a new chip every single year because we're basically doing so much of it in software. But that's like an aside. I think what we're going to see more, what's going to be mainstream in 5 years, is a lot of more routine tasks being heavily automated through agents, and that also allows us to make better, more data-based decisions for things that we just don't have time or bandwidth today. What I think we won't have anymore is physical artifacts of all sorts, like the CD to carry your MRI scan from floor 5 to floor 7, or the immunization certificates, which is, in my country, still a paper booklet you're carrying around. So hopefully all of that will be gone. And I think a lot has been said about the bubble. I think there's a question of what is the market, and I think it's without a doubt that there is a lot of value that can and has to be created because the demographic catastrophe we're faced with is just super real.
Thank you very much, and that's all the time we have. Hope it was useful for everyone here, and thanks once again.
Thank you for listening.
Thank you.
Thanks.
Fantastic panel. Thank you so much. Thanks. Okay. Thank you. All right. Happy to see so many people in the audience. It's afternoon. We still have about an hour of fantastic content on this stage. Now, it's time for some company showcases, for case studies. That's one of the most exciting things that happen on this stage. While we're getting the stage ready, I would like to introduce the next speakers presenting their companies on this stage. We're going to have 3 company showcases: Emit Knowledge, Cardi AI, and Lupin Dental, starting with Lumit Knowledge. And I would like to invite to this stage the CEO, Marjan Nikolovsky.
Company Showcase by Emit Knowledge.
Thank you for the soft introduction. Seems like a resilient group since there are still people in the zone for presenting, so I've been listening to the presentations. So I would like to ask you a question. How many of you forgot to book the next medical checkup at the hospital? Well, I guess it seems like you are doing a regular job, so managing your calendars. So today we are going to talk about solving this problem Or in other words, we as human beings, we do wear multiple hats and having multiple roles in our lives as sons and daughters, as partners, as parents, co-workers, and so on and so forth. And somewhere between those lines, we need to take care of our healthcare. And what this means is whether it is a single checkup or managing a chronic condition, the responsibility is ours to manage. And what if we could do it differently? Or what if the hospital could actually call us and say, hey, Marian, it's time for you to do the 3-month glucose average. We have an available slot next week. Would you like to set this up for you? But rather, what we have today actually is the opposite. So the continuity or the care ends once the appointment ends. So usually it goes, the doctor is going to say, see you in 6 months, and those 6 months are suddenly becoming 1 year. And this is where our product, PEX, product experience, come into place. So PEX basically helps the hospital to take control over the patient experience, over the patient journey. So starting from the website visit up to the managing the appointment, the booking itself, and then to the planning the retention or scheduling the follow-ups. In other words, how it works is that as a patient, you open the website, and then our AI chatbot interacts with you. It guides you to the process by asking you to provide symptoms and so on and so forth. So it is going to recommend you the right service that's the right service for you, so you can book it. So after you book it, basically, you continue with the hospital. You're getting the service, and then there is an automatic follow-up scheme, which is basically activated for every patient. So those see you in 6 months are actually going to be see you in 6 months instead of see you later on in life. Yeah. We have 2 case studies actually. So one is in Denmark, where we were able to increase the number of bookings by 10% and to reduce the number of no-shows by 8%. And then in Macedonia, my home country, we're collaborating with the biggest private hospital. They're using our online booking model, from which we're able to learn that irrelevant of the geography, the patients are struggling with the same challenges when it comes to managing their health. From a perspective of a hospital, the benefits are that their patients are going to be happy, but on the other hand, their calendars are going to be full, which means bigger revenue for the hospitals, and they can focus more on how to improve their care or aim towards premium healthcare instead of having only a transactional healthcare, which means you get a service, you pay for it, and then it ends. The way we integrate with the hospital is, in a way, it can go standalone as a product, but usually we integrate with the existing ecosystem. So if there is a technical landscape that exists within the hospital premises, we integrate with those services. So we don't need to reinvent the wheel, so to say. Today I'm here for 2 things. Basically, we are looking for 2 types of partnership. First is the hospitals who actually would like to go in a direction of proactive healthcare and to have like a patient-centric healthcare and a premium healthcare for their patients. And on the other hand, we are looking for business development and sales partners who would like to grow with us. In other words, that can work together with us to spread PEX to their network of contacts and co-create value with us. In the end, I would like to wrap up with what we are trying to achieve, or to sum this up. So basically, we want to make healthcare proactive and with continuity and as human as possible. And on the other hand, we would like to help all of these clinics and hospitals to grow their business and have their patients happy and have meaningful relationships with their patients. So here I'm closing up. Thank you a lot for listening me out. If you have any questions, I'll be outside of the stage. Thank you, guys.
Hello. Okay. Thank you so much, Marjan Nikolovsky, Image Knowledge. Next up, Cardi AI, and presenting his company is Vlastimil Hrabal, the Chief Executive Officer. Please, a big round of applause for Vlastimil.
Hello, hi. Let me introduce the startup from Czech Republic. It calls Cardi AI. We are a medical, or we are a company with a MDR2A certification. And what we are actually doing is that we are saving people's lives. In the last couple of months, we saved 300 lives in Czech Republic itself. What we are doing long-term ECG remote monitoring, detection of the heart arrhythmias, and evaluating what type of arrhythmia the people have. 5,000 people are dying every day in the European Union due to the cardiovascular diseases. So it's one of the biggest killer, or it's the biggest killer in the world. Heart arrhythmias are one of the biggest contributions to the cardiovascular issues. If the heart arrhythmias are not fixed or catched in an early stage, it leads to stroke, heart failure, or early onset of dementia. There are around 2 billion people around the world which are under the high risk of cardiovascular diseases. So as the AI is helping everywhere around us, we also created a product which through the AI can do like preventive screening of the general public and do the prevention of the cardiovascular diseases. So we developed a solution which is a combination of the hardware and the software. It's a combination of the belt and the mobile application. The data are captured by the belt. It's sent to the cloud, evaluated by the AI, and within 5 minutes, it's given the results to you as a user and as well to the doctor. What I want to say is, this is how we communicating with the patient. Whatever we find, we categorize as a green, yellow, orange, as per the criticality of the heart arrhythmia. And you can download the medical report, CE mark MDR2A certified. We are not comparing ourselves to any watch and wellness products because it's always short-term and it's mostly through the PPG signal, not ECG data. So we are a long-term monitoring which you can have like 3, 6, or 12 months. You don't need to wear it like 24/7. It's enough to wear it like 2-3 hours every second day. And you see on the bottom the difference between the detection rate of current Holter, which is used in the hospital, versus our system based on 3,000 users. So it's 6 times higher detection rate of the heart arrhythmias compared to the 24-hour Holter ECG monitoring, which is the golden standard everywhere around us. Most of this, the reports which we are generating, it's sent to the user, but in the same time it's sent to the cardiologist. So my cardiologist, after I stop the measurement now, in 5 minutes he will get to know if I had the heart arrhythmias or not and what type of heart arrhythmias. This is one of the most important parts, and it's the long-term monitoring. So you see the systems, they are monitoring you 1 day, or the patches are monitoring you 1 week. But more than 80% of the arrhythmias we found when we are monitoring more than 1 week, and 50% we found after the 3 months monitoring. So it's really important to monitor continuously and long-term. We are MDR2A certified. We done the clinical study with 98% specificity and 94% accuracy of the solution, and we have B2B and B2C models. So we are selling the devices to the hospitals, but we are also giving it or selling it to the end patients. We done currently more than 250,000 ECG monitorings. We saved more than 300 lives. We have 6 times higher detection than whatever you will get in the hospital for the tracking. As initial production indicators, we have more than 3,000 users. We have first insurance companies which are reimbursing us, and we recently entered the market in Romania, Bulgaria, and Slovakia. We are available in more than 30 hospitals, and more than 15% of all cardiologists in Czech Republic are already working with us. So these are the first indicators about the production. So as you can see, before it was non-certified product. Currently we know that we have 7 times higher revenue in October compared to the previous months. And we opened 3 new markets. We are preparing ourselves to go to India, Singapore, Saudi Arabia, and United Arab Emirates during the next couple of months. This is the expansion. So the primary field is Europe with the MDR certification, then expansion to the Asia and other regions. Last couple of months, we won a couple of awards. We got the award as the best AI-enabled startup in the Central Europe, and the whole team is built around Tomáš Skala. It's a professor of cardiology. The whole solution is designed by the cardiologist, and it's used by the cardiologist. It can be used also in the neurology as well, in the GP. In neurology, specific cases are patients after ischemic stroke, where the detection of the heart arrhythmia like atrial fibrillation is crucial, because if you have atrial fibrillation after ischemic stroke, its correlation to the second ischemic stroke, which is mostly deadly one. That's also how we saved more than 300 people in the last couple of months in Czech Republic. We raised still now 3.5 million euro. We are preparing ourselves for the Series A, as we are still a startup company. We are operating with the certificate only second month, but we already have the 30 hospitals and 15% of the cardiologists in our network. The next round will be Series A, starting in January the next year, with a target amount of 5 million to get. So thank you very much for your attention, and join us on the journey of saving more lives around us. Thank you.
Thank you. Cardi AI, everyone. Thank you so much, Vlastimir. And up next on this stage is Lupin Dental, and presenting it, Chief Product and Innovation Officer, Karim Turba. Please make a big round of applause for Karim.
Thank you.
Company showcase by Lupin Dental.
On January 2025, Lupin Dental performed a world premiere. We prepped the teeth of a patient while fully awake, aware, and moving in a total automated and minimally invasive way. This milestone is even more remarkable because we did it in less than 3.5 years of development with an initial limited funding of only 24 million euros. Yeah, I know, 24 million euros seems a lot, but believe me, in our domain and in regard with the tech that we cracked, it is tight. But the story of Lupin began long before this fateful day. It began 10 years ago, where two friends, who actually are two of the most renowned dentists in their own expertise, Dr. Garib Gurel and Professor Stéphane Koubi, had an amazing idea. They spent their career, they spent their life trying to perfect and to streamline the art of tooth prep for porcelain restoration. And they wanted to turn their art into science. Lupin Dental digitalized their expertise, and the robot basically mimics Gurel's and Koubi's hand so that every dentist can have them. We are very satisfied and frankly very proud of the result of our first in human. Less than 100 micron, an average 46 micron, between what we planned and what the robot actually executed. To illustrate it a little bit more, it's less than half the thickness of a human hair on a moving patient. Today, we performed more than 30 cases, and we are reaching a steady pace of 3 cases per week in our first market, India. Let me explain to you now why Lupin Dental chose the fully automated robotics as the core technology. To do so, I'm going to walk you through the 4 stages of dentistry today. First, we have traditional dentistry. Traditional dentistry relies mostly on manual tools and the dentist skills. You are as good as your experience and as your clinical expertise. It's like flying a twin-engine aircraft, for example. You must be in full control of everything, and you can rely only on your skills and instinct. Next, we have navigational dental surgery. We added digital scan, we added 3D imaging, and now the dentist can see beyond the surface. It's basically a GPS for the dentist. You're still flying the plane, but now you have advanced navigation to help guide you. After that, we have assisted hand-guiding dental surgery. Assisted hand-guiding dental surgery introduces tool that physically guide the hand of the dentist. It improves a little bit the accuracy, but you still need the human control. To go back to our plane analogy, it's like cruise control. You set the journey, you have a steady speed, but the hand of the pilot must always be on the stick to be able to do some complex maneuver. The latest stage, Lupin Dental, fully automated robotic dentistry. Here the robot performs complex procedures with a very high precision and very high repeatability, under the supervision of the dentist, of course. It's like you are on autopilot, where very advanced technology takes over and ensure a very safe flight. To do minimally invasive dental placement, you need this high-level accuracy and high-level repeatability only the fully automated robotic can provide. But why minimally invasive? Because the alternative is too often the crown, and the crown is killing the tooth. Only veneers can today protect the gum, preserve the teeth, and avoid long-lasting risk. But like we said just before, to be able to master those kinds of techniques, you need years of clinical practice. With Lupin Dental, every general dentist can now deliver safe and repeatable treatment, giving access to high-quality dental care for many more patients. We don't create value only for the patient. We also create value for the dentist. Like we said before, it enables him to do repeatable cases. So our system is simple. It's a pay-per-case system based on an annual commitment over 5 years. The dentist will double its revenue, and it will triple its EBITDA, and we got a bit of this value. So it's not only a clinical breakthrough, it's also a very solid business plan. This explains why the growing interest of the market. Today we have 3 devices in India, one also before the end of the year, and we are very advanced in negotiation in Southeast Asia and in the UK. So this early commitment shows that the market is ready and we have a clear trajectory. In 2027, 2 years after our first in human, Lupin Dental will reach break-even and profitability. So to sum it up, we've proven the technology, we've proven the commercial and the clinical impact, and we have a clear path to profitability. Today is the right time to join the adventure. Invest in Lupin Dental. Thank you.
Thank you so much. Well done. Great job. Thanks. Lupin Dental and Karim Turba. Okay, what a great case studies. What a great companies present today at MedTech World in Malta. All right, everyone, now we're getting the stage ready for our next panel. We have 2 more panels today, and they are very exciting. So the next one is going to be focusing on mergers and acquisitions in the field of medical technology. Who's buying who? And most importantly, why does it matter? We're going to focus on the latest M&A processes shaping MedTech, examining buyer motivations, market consolidation, and the impact on innovation, and of course, the competition among MedTech companies. I have one. Okay, that's for you. Very good. Very excited to invite our panelists to the stage to talk about the latest M&A processes in the field of medical technology. Coming up on this stage, Barak Singer, Executive VP and Head of Healthcare at the Trendlines Group. Hirak Parikh, Principal Venture Investments, JJDC of Johnson & Johnson. Ivani Franklin, can we move a little, sorry. Ivani Franklin, Managing Partner at MedSide Capital. Thomas Busby, Partner at Mirrors Capital Advisors. And Yves Privo, Founder and former CEO of EZ. Make a big, big round of applause for a fantastic panel. Thank you.
MedTech M&A. Who's buying who and why it matters?
Did you want us to match this? Yeah, switch. Do you want to switch seats so you can match the image? It's like what is the game with the chairs that we play? Musical chairs, yeah. Wonderful. Welcome, everybody. So what we'll be discussing today is M&A activity, who's buying who, and why strategics are making such decisions. So this panel will focus on M&A activity in the medtech space, the trends that we're seeing, what's driving these strategic decisions, post-acquisition, how that's impacting innovation, acceleration, how startup companies can prepare, the different types of investors that are making these decisions. The panelists here today are well-rounded from all perspectives, so we've got bankers, strategics, innovators, multiple exit founders, family office, fund managers as well. So all sides of the table are represented, and hopefully we have wonderful learning experiences and advice. We won't have enough time today for questions. We'll all be in the back at the end for Q&A and connections, and hopefully be a healthy discussion today. So without further ado, my name's Ivani Franklin. I'm managing partner of MedSide Capital. My family office began about 5 years ago when we made the exit of NAMSA, which is now privately backed by a PE firm called Archimed. In the past 6 years of NAMSA's history, we have made about 25 acquisitions and integrations, and I'm an active investor, primarily seed through Series A, B, C, through a variety of vehicles. So I'll let the panelists introduce themselves, and then we'll jump right into some strategic discussions.
Hirak Parikh. I'm with Johnson & Johnson on JGDC, which is the venture arm for J&J. We invest in both pharmaceuticals and medtech. I'm primarily focused on medtech. We've got a worldwide team that we try to cover the globe between the 12 of us. I'm based in Boston, primarily cover the East North America region, and this is my second time here. Welcome. I'm happy to be back here in Malta and looking forward to the panel.
Hi, everyone. My name is Tom Busby. I am a partner at Mirrors Capital Advisors, where I co-head our life science and healthcare investment banking practice. We assist middle market companies, predominantly with enterprise valuations between 20 million and just over $1 billion in merger and acquisition, build to buy, and capital raise initiatives, primarily from the private equity and growth capital communities. Been raising capital professionally for a little over 20 years, been dedicated to life science investment banking for the last decade. And this is my second time in Malta as well. Really happy to be here.
Hello, my name is Yves Privo. I'm a founder and former CEO of Easy, and Easy is a company that developed an online eye testing solution that allows people to do an eye test from home. And we had a software as a medical device, digital refraction technology, CE certified. We were on the run to get FDA approval, and then we were acquired a few months ago. And yeah, I think over the last 10 years, I learned all the hard lessons of building a startup and getting to the end, including fundraising and going through regulatory processes and scaling to 1 million ARR.
Hi, I'm Barak Singer. I'm with the Twin Lines Group. We invest in the MedTech field. We have today a portfolio of 25 companies. We also had 10 exits until today. Like most of my colleagues, this is my second time here in this conference in Malta, and I'm looking forward.
Great, thank you all. So I think a great place to start is the strategic drivers around acquisition. So from each of your perspectives, what is driving, whether it's innovation, portfolio expansion, diversification, what is driving the reasoning and parts of how you evaluate when to make an acquisition?
I can take that. From a J&J perspective, we are strategic investors, and unlike other CVCs, we are very, very closely tied with the operating companies. So we don't really make investments in pure white spaces or investments, it's nothing wrong with the company. If it's not strategically tied to some of our businesses, we won't make it. So I would call there some bread and butter investments, meaning these are things that our businesses need in the current moment. So that's a majority of our investments. But at the same time, we're also looking at what we call adjacencies to our businesses. So it could be not a white space, but something that is up and coming. Maybe it's a new modality, let's say like PFA in cardiac. That would be something that we want to disrupt ourselves and be disrupted. So that's probably one big area that we look at. We're always on the lookout for interesting things that could be businesses of the future. But we won't probably make an investment unless we have like an anchor investment. So a couple of years ago, we bought Abiomed and Shockwave. So now our cardiac business is growing. So now we are investing a lot in the cardiac space. So that's kind of how we look at it in terms of our investing strategy.
So if I could, from my view, I think the drivers for acquisition haven't changed in a long time, and there's really three. Either you have a company that is trying to enter a white space market where there is an unmet clinical need and you have a product that can totally attract that market. You have an asset that is going to allow a strategic to fortify a franchise that it has already built and expand that franchise. Or you have an opportunity to buy an asset to defend that franchise, sort of the fear or greed difference. I think, Ivani, what is important, though, is that we shouldn't be able to block all strategics in the same sort of category. Every strategic has a different strategy. Every strategic operates their corp development and business development functions differently. And every strategic has differences in what types of companies they want to engage with. And so that's where you have certain companies like Merit Medical. They enjoy going into white space opportunities. Cardinal Health would be another example. So you have very different strategies at play here, but the drivers, I think, have been unchanged.
Yeah, I think we were in the fortunate position that we had multiple offers along the 10-year journey. But I think it's really important as a founder to also think what kind of acquirer can actually help you achieve your mission. And I think it becomes pretty clear if there's not a business rationale from one of the acquirers, then what are they going to do with your technology? And it probably ends up on the shelf. And I think that's not something that I would be really looking for if you have built a company for 10 years. You want to see your technology thrive and be scaled to millions and millions of people.
Yeah, if you look at the M&A market, I think it's a mix. On one hand, you see this mega transaction, like you spoke about, Shockwave and Abiomed, which basically the large corporates are buying for their P&L in many cases. It improved the balance sheet. And there is consolidation after that. On the other end, there is the acquisition of innovation, which we are focusing on. In our case, if you look at our exit, in many cases it was pre-revenue or initial revenue. So for us, when Johnson & Johnson acquired two companies, it's good for Johnson & Johnson, it's good for the balance sheet. But for us, in a specific field, we have fewer companies that can acquire our companies. So we prefer to see it the other way around. For example, and I think we'll speak about it later, we see all the spin-offs these days, including also in Johnson & Johnson with the orthopedics. So when there is spin-off and we have new companies that are focused on specific field and large private equity financing them, for us, coming with a startup that we invested in, we have more opportunities for M&A, which is better for us, but it's always a mix.
So let's talk about that next then in terms of consolidation. So post-acquisition or merger, what's everybody's opinion on whether that accelerates innovation, yes or no? And how does it impact it?
So I think when we look at consolidation, it's usually a byproduct of some greater, more macro financial drivers. And not to bore everyone here with a financial discussion, but when we have high interest rates, you see companies starting to divest different business units, and that's what we have right now. Arguably, we have more strategics that could acquire businesses today than we did a few years ago because we had lower interest rates and we've had things moving around. With consolidation, I think one thing that doesn't get spoken about as much is the impact that private equity is having right now in medical device. So private equity has long time tried to be garnering the CDMO community. They enjoy that manufacturing business. More and more you see groups like RC Capital, 1315, Gemspring, as well as a rash of others that are trying to buy medical device businesses to consolidate. In terms of moving the innovation needle, overall, I think it's a good thing because they want to see products that not only have high innovation, but a strong business case.
Yeah, like I said before, for us, making a big anchor acquisition like an Abiomed or Shockwave just acts like a big boost. 5 years ago when I started at J&J, we really didn't have a cardiac business. We've kind of been in and out of it. We didn't have a cardiac business, but now we have 3 big businesses that are very P&L. A big corporate needs something that's going to move the wheel and make money. But from an innovation perspective, that becomes like sort of jet fuel for us because now we have like a hunting license to go find all the innovative products to make those businesses better, right? So Abiomed, great pump, it's just an impeller pump, right? But the idea is that acquiring is we want to make it bigger and better than what it is. So we've been super active, as you all guys know, and people in this audience know that we've been looking at lots of structural heart, we're looking at lots of things in cardiac, and it's also acting as a boost for some of our other businesses like Biosense and Cerenovus as well, from that perspective. So, like I said before, for us, specifically for J&J and the differences, which, Thomas can talk about, we are looking for adjacencies to our existing businesses where we have a right to win. Meaning there's some way, either we are scaling the product or there's some technology that we can give where it becomes multiplicative. Otherwise, we'll divest them, right? Like if they're not growing.
How about from a founder perspective?
Well, I think you quickly go into, especially in the medical field, let's put it this way, you quickly come into the problem of scaling, which is, you just cannot build a sales force to go and call on doctors or on hospital systems and those kind of things. But also, you're always stretched between being really focused on building one thing and being really good at that. But obviously, if you go to a big hospital system or an insurance company, you just don't cut it because they're not interested in one-point solution. They want to see, bigger solutions integrated into each other. So I think, I think it helps innovation a lot if consolidation takes place. But of course, it needs to happen at the right time and not too soon, I would say.
So that's a good maybe next question is the right time. From everyone's perspective, in terms of diligence and how startups can prepare themselves for M&A and deal readiness, anyone want to speak on from each table seat how you prepare or what you would suggest?
Yes, so as I said, we invest really in the beginning of the life cycle of a startup, really when the founders come to us. And one of the struggles that we have with some founders that we always tell them, you should start speaking with the strategic almost from the beginning. And usually there is a challenge between founders that are totally afraid from confidentiality and intelligence and things like that. And on the other hand, founders that after they make the connection with the strategic, maintain the relationship, but hassling them too much and sending email every week. So you need to build a relationship with the strategic from the beginning, not with one or two, with everyone, because sometimes you feel you find the right potential partner and the right champion on the other side, But then J&J decided to spin off the orthopedics, and you lost this candidate or someone moved. So you need to work with the strategic on a constant basis from the beginning, go to the investors' conferences, to the industry conferences, and be prepared, because you cannot have a sell process when you don't know the buyers years and years before the time. This is what you want to do. You want to be in contact with them until the moment one or two of them will come to you and say, okay, we want to upgrade the relationship. Maybe it will start with a strategic investment, maybe it will go immediately to M&A, but you need to be in the position that everyone knows you, everyone knows your plan, you speak with them, this is the regulatory plan, this is the reimbursement plan, this is the timetable. Sometimes things will happen, it will go slower in most cases, but they follow you, and you wait for the moment you get approached from one of those companies.
Not to be too provocative here, but you asked us to be. I would argue that diligence by a strategic makes having a colonoscopy without amnesia a whole lot easier. Diligence by a strategic, they will go through every single nook and cranny of your company. Preparing for that phase is very important, and that is where it doesn't need to be Miras or myself, but surrounding yourself with advisors who do M&A day in and day out is going to help level an asymmetric playing field between buyer and seller. When you have a young startup company with 20, 25, 30 people being bought for hundreds of $millions by a strategic with thousands of people working there, you need assistance to be able to align what sort of requests are appropriate. So by way of example, one of the first requests that you get after an LOI is, give me all of your board minutes from the inception of the company. My response to that would be unnecessary at this point in time. Those are privileged communications, and if you want them, they're going to be redacted. Reason being that that strategic doesn't need that information at that time, and it also would be a request that would fall out of line in typical M&A processes. This is where surrounding yourselves by advisors is going to help streamline that diligence process and allow your company to keep performing. Oftentimes when you see a reprice in a deal, it's because the company has taken a nosedive in performance while going through that 6 months diligence phase, and now you get a reprice. By putting advisors around you, you're able to enhance the bandwidth that you need to get that deal done and keep things moving appropriately.
Do you feel that there's ever a time that's too soon, kind of to his point, and then Yves, I want to hear from your perspective, at what point, and speak very specifically, is it at the preclinical stage? Is that too soon? Is it at the clinical stage? Is it IDE? Is it, at what point in the process is too soon where you don't feel inundated, but you don't feel underprepared, or, speak very specifically about perhaps inflection points?
Yeah, so for us, from a MedTech perspective, you're not going to get acquired if you're not revenue positive. And that's kind of where we step in on the venture side, is sometimes it's too soon for the acquisition to take place, but it's not too soon to invest, right? So, Barak's aware we invested in OrthoSpin that we acquired later on. So we invested first. That's kind of our job on the ventures team, is to shepherd them through that process and maybe walk them through some of the stuff that Thomas was talking about. Is like, how do you get ready for acquisition? What are the things that you're going to ask? And he's not wrong, right? You're going to get a very, very thorough diligence. And in that diligence, if anything is uncovered, then the deal's off, right? So you want to surround yourself with really good advisors. And a couple of these on the stage, they've been through that process, right? So founders that have done this before, they are talking to strategics well before it's ready. And the point is that it may be not a bridge that you're going to cross in the present moment, but you have to be prepared to cross it in the future. And from an investor perspective, we love working with repeat founders because they know what's involved, right? It's not coming as a surprise why they're asking for stuff, or working with like really good advisors like Miras that that can prepare the company for doing that. So our job on the investment is to prepare the company to get there. So the acquisition will take, and the acquisition could take multiple forms. We may do an option where we'll give you an upfront, and once you hit a certain milestone, usually it's FDA approval for a medical device, not before that, or it could be like once they cross like a certain milestone in terms of sales, and then we can put our sales force and get into like 20 countries or 100 salespeople.
Well, I think it's a difficult one, I would say, because you would spend a lot of. I mean, if J&J calls you, and you're like really early in this in building your company, of course you feel flattered and you are like enticed to do a lot of work for it. But I think it's exactly that moment that you have to think, maybe I should turn the tables and ask first questions on why they would be interested and what would interest them even more, right? And instead of spending a lot of time on due diligences. And I think I made the mistake myself as well, with multiple companies, and the larger the company, the more people involved, and the longer the process, and it takes a lot of resources and a lot of time. And it could have been more efficient by turning the tables earlier. And I think that's also making the relationship more adult, I would say, right? So you're more in the driver's seat, and you start building the relationship, and then at the point that you are actually getting to a value inflection point, such as a FDA approval or clinical trial, that's the moment that you may be, willing to let them look under your hood.
I guess I'd just say, so Brock, I couldn't agree with you more that you should be talking to strategics early on. Very few people get into this industry because they want to hurt others. Most people are here because they want to help everyone. But you heard Hirak say, we're only going to acquire a business that's producing revenue. So that's a little ways away. So I would say for entrepreneurs out there, be very careful about the conversations that you're having with investors and strategics. Yves and I were talking just a moment ago, be careful about putting a timeline out there that is 2-3 years out, and you have very little control over that. Because the next year when you go to follow up with that strategic and things have kind of fallen off the rails, they're now going to look at you with a more critical eye. So every time that you have that strategic interaction, be very thoughtful about the words and the facts and the plans that you're sharing. The other thing I'd say is, you don't have to go to bed with the first girl that asks you to dance. If you have a strategic that comes to you and shows interest, my thought is, let's go talk to every other party at that point in time. Investors, other strategics, tertiary strategics, because very likely someone else is going to feel similar. And that's incumbent upon you as the CEO to maximize optionality.
So what about advice on best practices for that engagement? So each of you are representing different entities and types of methodologies for investment. What advice would you have for startups on how to start that engagement? So you have each opinions on when to do so, but how about how, and how do you make the connections? How do you make the outreach if you don't already know somebody within the strategic?
Well, like in everything, if you have connections, if, for example, if one of your investors is familiar with the strategic, it's always better to start with an introduction, a warm-up. It's the same with investment. It's better than a cold call. So you start with that and you build it. And in some cases, if there is a new strategic or someone that you don't know, so you go to industry conferences and you build a relationship. But I'm all for building the relationship from the beginning. It's true, you need to know the other side. There are a few strategic that we are being more careful with them because, we have people on our board, including people that work with, in strategic companies. And some companies, not even, speaking about, like you said, bad things, but some companies like to develop internally, and some companies are more open to take something external innovation. And you never know, to the comment that usually you will be acquired after revenues. Yes, this is the case, and these days you see more and more strategic sitting on the bench and waiting for more sales. But if we'll take our example of Orthospin, an external fixation orthopedic company, where JJDC invested, they followed the company, they invested. I'm always saying that this was the best first in human we ever had. They invested after the first patient. They waited, we did the first in human, one patient, and they make the investment, they laid the A round, they laid the B round, and then they acquired the company. So not every time it's the same, but in our case, it was a great practice, and also great practice to start with the strategic when they make a strategic investment without, going for options and offers and things like that, which, really narrow the opportunities, because we all know that in M&A you want to do competitive situation?
Yeah, I'll just say a couple of things. I think Thomas and these guys are completely right that you want to engage with other strategics. And speaking from a strategic perspective, we're not trying to steal your idea or steal your company. You know, we have other things to do than worry about those kinds of things. So the best thing would be like do your research, you know, find out the strategics in that space. And the second thing is, you know, in your interactions, try to not keep anything confidential. There's a number of times I would tell, you know, decks that come in and say like, please take all the confidential stuff out. Even if it says confidential, I cannot share it internally because we don't want to do that, right? We want to have a conversation. We want to know how you're doing. We don't want to know your secret sauce because if we get interested, we will sign an NDA. There'll be a very thorough diligence when the time comes. Like that is probably not the time for it. It'd be just like, hey, you know, I met you last year. This is the progress that we're making, and you know, keep us informed because then at some point, you know, we will make an investment. You know, we will make an acquisition offer, whatever, right? So I think using those interactions in a smart way helps. You know, leveraging a connection helps. You know, your board is going to help with the stuff. Your advisors are going to help. Like your team is bigger than yours. And then, you know, one company I was talking to, and he was a little bit shocked, was he said that I interacted with more people on a diligence team than work in my company.
When you speak with a strategic or an investor, I can impress upon everyone to really do your homework. Find out if that investor invests in your space. Find out if that company has had success in that space. Many entrepreneurs tend to overvalue their technologies and undervalue competition. It behooves of you to be very critical of yourself and really look at competitors, not only who are existing in the market, but other startups. Because when you go to Hirak and you show him a new opportunity, he's been mapping out that whole market for probably a few years, knows all the competitors and where they're at. When you do engage with a strategic, just ask him for feedback. Hey, Hirak, I'd love to get 10 minutes for you. Can I get a little bit of feedback? Explain the market that you're attacking, the unmet need that you're going after, and why you think you'll win in the marketplace. If they're interested in the backstory of the technology, they'll ask. But you want to focus more of that conversation on where you're going in the future, not everything you've done to get to that conversation.
Yeah, so I think, of course, networking, that's a basic role of a CEO. But I think one other thing that I now, in hindsight, learned is, especially in the beginning, you can get quite a good network through informal investors, right? So there's a lot of executives in big companies that are, you know, also investing in all kinds of startups on the side. And I used to work in Pfizer, and I was doing the same thing. So I think that's also a great way to build a network and get some inside knowledge from these companies right from your own investor base.
This might be limited perhaps to Hirak, but how maybe from J&J's perspective or from a strategic perspective, do you decide whether to acquire externally or to build internally?
Yeah, so you know, from our perspective, you know, we understand that, you know, we have really good R&D teams, but we obviously don't own innovation. I mean, there's lots of great ideas across from lots of different people in the world, which is kind of why JGDC was created 50 years ago, with the intent that, you know, everything is not going to be invented here. And you're correct, right? There are businesses and there are certain leaders who feel like, no, this has to come internally. And I think that's very short-sighted. And, you know, we will make investments sometimes in two companies that are kind of working on the same thing. I mean, we're very, very careful in making sure there's no contamination. Because you never know. There's a lot of uncertainty. There's a lot of risk. You know, the world changes rapidly sometimes. You know, a new technology comes along and then, boom, like in 2 years, like, you know, PFA has taken over in the last 3 years, right? Like 6 years ago was nowhere, right? Like there was cryo, like, so change comes very rapidly, very quickly. And like I said before, you know, we are of the opinion that we want to disrupt ourselves, then get disrupted by another competitor, another company. I mean, it happened in robotics, right? Intuitive's been eating our lunch for a long time, and Medtronic and J&J, we've been catching up, right? So we've learned something from those lessons, and we don't want to repeat them too often, otherwise we won't be around for another 135 years. So I think our view is like, let's make these investments. You know, we put small dollars to work. We work with a lot of people in this room with the intention that, you know, we're not the only people putting the checks in, and then the company still belongs to you. You are own master of your own destiny. And yes, if you get to a point, yes, we'll write the big check and acquire you, but that's kind of how we're looking at it, right? We're looking at trying to engage initially, make this investment, shepherd you through a process through 3 to 5 years. And yeah, if you hit those milestones and it's still on strategy and we still feel this is an area, we'll acquire you, right? As Barak well knows. So that's kind of how we look at it.
Do you notice a trend or a change in trends maybe over the last 5 years, or you mentioned over the last 50, of internalizing versus the external acquisition?
I mean, to be perfectly honest, a lot of the R&D stuff has been sort of like reduced in some extent. I mean, it's a lot cheaper for a startup to develop something than for a J&J. Like I think someone quoted it yesterday in yesterday's investor talk. It's like 10 times more expensive for a J&J to go through a process, which is we have a huge bureaucracy. People charge us more, right? They're going to charge a small startup less than they would. So the smarter thing is to invest or acquire that startup.
I'd only ask as a shareholder of J&J, I've been positively predisposed about the shift to inorganic growth. It can be a better use of dollars to spend on buying those technologies and leveraging your sales force than all of the R&D.
And how about maybe from your perspective, kind of post-acquisition, can you speak to your experience on integration and how, once that company, your company was acquired, how did that impact you and integrate within a greater portfolio? And were you well, maybe I shouldn't ask that openly if you were happy or not, but we'll keep, not maybe too provocative, but I'll stop there at the beginning.
Yeah, so I cannot really allude to that because I didn't join the integration team. So I have my colleagues that are working very hard to integrate technology into the US ecosystem. So I think that's good, right? So the team has a good home. I think, there's always risk, I would say, if you acquire something, and there's a lot of tacit knowledge that even in the best possible integration will go out the window, and that's something, of course, you have to basically also factor in. So I think it's that also comes back to timing, right? So the further down you are down the path, the more solid the integration will probably be. In terms of what I'm a happy man. I mean, I'm ready for a new challenge, and I think also after driving a business for 10 years, it's exciting to think about new opportunities again and new businesses, and especially being here in the last day and a half already, I got so many new ideas that I'm quite excited for the future.
So maybe kind of while we're on that side of the table, how, and for your portcos, Barak, and yourself, Eve, how do you evaluate the right strategic partner if you have multiple buyers? How do you make those decisions or impact those for your portcos, or even in your perspective, your personal
Well,
company?
at the beginning, when it's before M&A, you do your homework about the potential acquirers. But when you are in an M&A process, and at the end of the game, you want the best deal for the investors and for the founders or for everyone. So when you are before an M&A, when, for example, if the company want to do structured acquisition or get some option or start with distribution or things like that, this is extremely complicated. Finding the right partner and what kind of terms you can leave it and what not. But if you are in an M&A process, at the end of the game, you want to have a few bidders, and whoever will give you the best offer will win, because at the end of the day, you give it to the other side. But I must say, in our case, if I look at Orthospin and Epifix, a scoliosis company that we sold to OrthoPediatrics, in both cases, the founder stays with the company, the team stay, they even grow the team a little bit. So we were quite happy also with not only the transaction itself, but also, at the end of the day, we want the devices that we are in healthcare. We want to see, devices that go to the patient and successful. So for us, it was mostly positive experience also post-acquisition.
So how about on a global scale? Many startup companies that we're all speaking with daily are trying to decide, okay, United States first, Europe first. From the investor perspective, how do you prioritize those? What are your suggestions for where startups should? You want to speak already?
I will start because it will be very simple.
Okay.
US first, and if we have any discussion, it's always why should we, like if we have a company that is selling and they are saying, okay, let's go to Latin America, or let's go to other places which are important, but for us, at the end of the day, the market is the US, most
Why?
of the acquirer are US, so the US is the market.
But say why. Explain why. Explain why.
Yeah, sorry?
Explain why.
Because this is the largest market, this is where most of the strategic are. You can tackle this market like I spoke with someone from Europe, which I'm from Israel. Europe is easier for us, it's closer. But on the other end, you know, you go to Netherlands, there are certain rules. You go to England, there are different rules. You need to tackle every country by country. So if you are a company with 100, 200 million revenues, you go globally. But when you are a startup, you start and focus on the, at least for me, on the US.
Yeah, I can second that. From personal experience, I think we were not the only company in our space. We definitely had the best product, the best clinical evidence, the best team, most revenue on the technology, but still we were not in the US, and I think ultimately our competitor that was in the US did much better in fundraising, did much better in strategic collaborations with, you know, strategic buyers, and I think if I would do it all again, I would probably start in the US because, yeah, it's where the magic happens.
I'll let you two speak, and we're at time, but from a buyer perspective.
Yeah, from a buyer perspective, I think this is generally right. But from a J&J perspective, we're also like really watching China very carefully because there's a lot of technology that's coming from there, especially on the biotech front. On the medtech front, you tend to be a little bit 5 years behind. You know, they are coming with not just like copycat technologies, but better technologies. So we are really watching that. A lot of that is being built mostly for the China market, but also some of that is very low cost, which can go in Latin America, it can go other parts of Asia as well. But yes, I think generally as of now, it's true, you know, you want to build, you know, to get it for the US market, but, you know, things are changing. You know, from our perspective, from a corporate perspective, we are paying very close attention to some of those sort of, you know, bigger changes because like, you know, change, it comes very suddenly and then, you know, very rapidly in a couple of years. So, you know, we are watching from our perspective. I mean, we are a US company, so the market's important, but, you know, we are also a global company, so it's important for us to be able to scale worldwide.
I guess I'll put a cherry on it really quickly. And being an American, it's easy to say, yes, come to America. But from a factual standpoint, our capital markets are more robust than any place in the world. Our legal frameworks are stronger than you'll find any place else in the world. We have a higher density of talent and education than you will find oftentimes. But it's capital markets, I think, really that drives the interest in the United States. We also spend more on healthcare than any other nation. And we are more interested in spending money on healthcare, even if it's out of our own pockets. In other nationalized systems, you have downward pricing pressures, which can, on an economic basis, kind of curtail the opportunity. So I'm biased here, but we're hearing that, by and large, come to the U.S.
Well, thank you all, and we're out of time, but appreciate everyone for joining, and we'll be in the back if anyone wants to speak further.
Thank you.
Bravo, thank you so much. Thanks, fantastic panel. Again, everyone, make sure to catch up with our speakers off stage. This is the greatest connections that are made during conferences, and that's why we love conferences. Now, it's a great pleasure for me to introduce the last panel of the day, but definitely not the least. Middle East is one of the key regions for MedTech development and for MedTech World Summit specifically, because the next event for MedTech is taking place in Dubai in February 2026 at Festival City. Make sure to book your tickets and be there with us. Now, the next panel, I'm really happy to invite to the stage Dick Dirk Richter, Chairman of Saidala Healthcare Angel Investor Network, Marwan Abdulaziz Janahi, Senior Vice President at Dubai Science Park, Dubai Knowledge Park, and Dubai International Academic City TCOM Group. And moderating this panel is Rachel MacArthur, Editorial Director of MENA Healthcare Digital Inc. Media, Gateway to the Middle East. Bravo. Thank you.
Thank you. Thank you for the applause and thank you for the kind introduction. And amazingly, we got all our names pronounced correctly, which is amazing to see, especially when we're not in the region. So great job. Thank you so much. So hello, everyone. Nice to see some familiar faces and nice to see some new faces who are hopefully interested in the Middle Eastern market. By means of introduction, my name is Rachel. I'm a healthcare media professional in the Middle East. I cover the Middle East and North Africa. And I have a confession to make. When we're kind of workshopping this title, it moved around a little bit. I personally still have an issue with it being Gateway to the Middle East, because the Middle East, it's a huge, huge region, very nuanced. We have differences in territories. They're not all created equally. The GCC, which is the Gulf Cooperation Council, consists of the UAE, Kingdom of Saudi Arabia, Bahrain, Oman, Qatar, Kuwait as well. We've got the Levant, which is Lebanon, Jordan, Palestine, etc. We've also got North Africa, and the Maghreb, which is Egypt, Morocco, Algeria. Very different digital transformation journeys in healthcare, very different populations, very different money. So where is the money? Well, your gateway is the GCC. And we've got some amazing panelists with us today who are representing the UAE and the Kingdom of Saudi Arabia. And what makes them stand out, obviously, so Marwan over here is Emirati. He's from the United Arab Emirates, so a great ambassador for the UAE anyway, but he has been with Dubai Science Park, which is a free zone in Dubai, and it facilitates entry into the Emirates or the wider UAE, and he'll be able to tell us more about this. I'm just giving a little bit of background. Dirk has been Dirk has been in the UAE for quite some time as well. His credentials include the Department of Health Abu Dhabi and the UAE Presidential Office. Now he's going it alone with a great team of people with Saidala. Saidala is Arabic for farmer. So that's another fun fact. And he's got a wide range of experience from the clinical side to the investment side. So these are two very well-versed gentlemen to be chatting to later if you'd like to connect. So that's enough of me waffling on, but right. I'm going to focus, for the sake of this argument, for the sake of this panel, I'm going to focus on the GCC, because this is arguably where the money's at. This is where the transformation journeys are quite advanced compared to, like, for example, the likes of Egypt. They are, moving forward, but again, very different populations. The UAE has ambition to be at the forefront of technology and MedTech in the region. So Marwan, looking at the MedTech industry, which is why we're here, what specific subsectors is Dubai currently trying to attract and build? Which startups are you looking for, and which startups are coming?
Thank you very much for that question. And it is true that there is a big transformation happening. And the reason for that transformation is because the governments, generally speaking, in the GCC want to do better for their citizens and for people who live there. They want a better healthcare system. They want people to have ease of access to healthcare. And they want people, obviously, to continue working and developing the economy. So healthcare is a pillar of how it makes people comfortable and basically have trust in the system. So it is very high on the agenda. Now, the question is, how do we do that? How do we develop that healthcare system? And medical technology is obviously one part of it. You need to have the latest and greatest machines, digital, let's say, infrastructure, connecting hospitals, using technology for making decisions, etc. But that is only one part. You also need the human element, which is the doctors and the nurses who will be, and the technicians who will be using those tools, and also, connecting the dots to the university. How do we engage also the universities to be part of that investment which the government has put in? So if you look at the triple helix model, which is the industry, lots of investment, both multinationals and the government. The government obviously subsidizing and providing lots of infrastructure that's available. And then you obviously need the academia or the universities to always develop and come up with new ideas. And I think that is what is quite unique about Dubai and the region.
And I think we're going to come to that part as well, the academia part, a little later, because local R&D is something we're quite keen on in the region, right? So, yeah. And in terms of, the areas of MedTech, yes, the subsectors, devices, technology, pharma, digital pharmacies, like what's?
It's difficult for me to pick on one subsector because all of the sectors, in my opinion, are growing. So if you look at longevity, for example, digital health, pharma, biotechnology, all of those areas are growing. I mean, and what is driving that is growth in population. And, we are experiencing a massive growth in population, and I think we are still not stopping. There are so many plans, so many things to be developed, whether it's projects, etc., not just in the UAE, but in the entire GCC. So all of those sectors will definitely grow with it. More people to live, more issues for sure. People wanting to live longer. Many people are choosing Dubai specifically to retire. So what are we doing with an aging population, for example? So I can't really pick on one sector, but I think maybe that's something we can talk about later. It is very important to validate whatever sector you're choosing. The market entry and the market access of it needs to be carefully studied before doing anything.
And you made a very valid point there about retirement, because we do have the retirement visa, there's the investor visa. A lot of people are moving to Dubai to live there or work out there. The digital nomad visa, and then they bring their parents who are enjoying the retirement life in Dubai as well. And I know Dubai and Abu Dhabi as well, they do really want to create a healthcare system that's sustainable, that's based on value-based model, precision medicine. There's the Emirati Genome Program as well, and they're envisioning a future where prevention before cure, right? So Dirk, obviously, I've mentioned your credentials before, the Department of Health, Abu Dhabi, UAE Presidential Office, and now in investment as well. So you've worked quite heavily across the GCC, the UAE, and also the Kingdom of Saudi Arabia and others. From your strategic view, what is the single biggest policy or economic driver, be it the push for value-based care, digital transformation, or new insurance models, that makes this vision a practical reality for non-GCC medtech right now?
I think the region, and talking about retirement, about population getting older, has a huge transformation in terms of healthcare delivery first, which is then underlined by technology. I mean, in the past, a very young population, you have more single episodes, so one surgery, young patient, everybody healthy, do the surgery, go home, that's it. But now, population getting older, chronic diseases play a more important role, so you come to a system of more chronic diseases, of more complex patients, and which also requires a different kind of healthcare, but also different kind of financing. So if you pay for each single episode, which we mostly do across the whole GCC, it's not sustainable in terms of cost. So you have to bundle, you have to take care of chronically ill patients with multiple diseases. Saudi, for example, are about to decentralize their hospitals, so they have low regional clusters. And very interesting, they have a capitation model in future. They will have, so it's not paying for each episode, but you get some thousand dirhams, whatever, for each patient, and you have to take care of the whole healthcare, which is very interesting. but also requires, and then we're talking about MedTech, requires processing of data. And I think that's one of the big trends beyond the devices and everything happening everywhere. Managing data, and we have a lot of data. You mentioned the genome project. We have Malafi in Abu Dhabi, a central patient record for the whole emirate. So richness of data, but then you need technologies to manage the data and to draw conclusions from what you have. I think that's one of the important, when it comes to technologies, I mean, we need the same technologies like everybody across the world, but in terms of specific, I think the data is our asset, but also companies who can work with those data.
Yeah, I mean, over there in that region, they always make this joke like data's the new oil, right, of the Middle East. And it is true in the sense of data is going to be very valuable, and they're looking for companies that kind of utilize that data or you know, filter it down to the meaningful data that's going to serve patients across the region. And just referencing, you know, the speed at which we adopt things in the region in terms of the GCC, I'll use the pandemic as an example. I mean, I'm from the United Kingdom, I'm part Arab, but I mean, comparing the UK response to the pandemic versus the UAE's response, all I can say is I was glad to be in the UAE at the time, because it was, you know, and it just shows like how quick they were. And it just shows that when there's an idea and there's a need for an idea, how quick they were to adopt. And it was managed, and I feel it was managed much more efficiently, and even the restrictions were lifted quicker due to the acceleration in technology and the adoption of technology. Dirk, your investor hat, are you seeing the private capital follow these trends? You know, what market or recent deals tell you that this opportunity is real and accelerating? Because I know you're working on that at the moment.
Yeah, I mean, investing in something, you usually look at the second step, at least, at scaling. So, I mean, looking at some of the relatively small markets, maybe except Saudi Arabia, the other markets are relatively small. So whenever you invest in something, I mean, there may be some very specific things how to work with for example, our genome project in Abu Dhabi. However, it's a 10 million population in the UAE. So if you invest in something, I think you always have a global perspective. You start somewhere, but then you need to consider at least the bigger markets in GCC, which is the Kingdom of Saudi Arabia. We also look at India. So I think it's always a kind of global perspective, because you need bigger markets to be sustainable in the long run. So for us, it's more about topics which are also scalable across the region and beyond.
So scalable and knowing what they're dealing with, knowing the type of data, knowing what's needed in the region, that's probably the foundation of it all.
And I mean, what I learned from a long career in healthcare, sometimes it's also a question of timing. There's great innovation, but bad luck if you're 10 years too early with what you have. So maybe we are the only ones in the world who really have this very sophisticated data infrastructure. So it doesn't help if you invest in something which is performing very well in our region, but there are not only a few countries which have the same infrastructure. So it's also about timing, investing in things that are only helpful in the local markets right now doesn't make sense if you look at a global perspective and at investing. So timing is important in healthcare. Sometimes fancy sport cars and then back to the region don't help 50 years ago when you only have sand in the region. So there are certain things that timing is important also in investment. So what is the global perspective, which is sometimes more important than the local fit of certain things.
Oh, absolutely. And what you mentioned about the infrastructure, etc., and what I mentioned very earlier is that the region, nuances of the region, very different, very, very different territory. I would say in the GCC, and correct me if I'm wrong, I would say UAE and KSA are kind of, they go back and forth in terms of their acceleration. I think that's followed by Qatar, because they're leading, I would say, in precision medicine, the precision medicine area, Sidra, and the Qatar Foundation is doing very well. Then it's Qatar, Bahrain, Oman is probably catching up. Is that the right split? Okay. So the GCC varies, and those are the Gulf countries with the smaller population. It varies compared to the wider Middle East, like I said, the Levant and North Africa. So let's talk about mistakes. Because a lot of people come in, no hates, But a lot of companies, as a media professional, when I'm reporting on the media industry, they come in, don't know much about the region. They just assume, we're great in the UK, and therefore we're great here. No, if you know your region. So, Marwan, what is the single biggest mistake you see non-Middle Eastern companies make when they're trying to enter the UAE? Because they come to you, I'm sure you receive many a pitch deck every week.
Day.
Yeah, every day. What are the mistakes that make you go, oh, this is frustrating?
So I think the biggest mistake I see is that, for example, if someone has a product or a solution to a problem that exists in the region, they would assume that their product or solution would work. Because let's take diabetes as an example. Yes, it is a problem in the GCC. 20+% of the population do suffer from diabetes. So this company would assume that because they are in that space, it would work because it has a sizable market. But what people underestimate is the way to market is as important. So who do you partner with? Is it the private sector? Do you go through the government, for example? There are so many ways, and it could be a combination. So that's one thing that I think people usually underestimate. And they would think, for example, it would take a month or two. It depends on how complicated that product is. Sometimes it takes a year or two. And the biggest fallout is because they haven't planned for a year or two. Then they would say, well, our budgets have run out and we need to go back. So that's and because I'm not an expert in everything, it's very difficult for us to say this is what you should do in oncology, this is what you should do in diabetes, for example. It is really up to the company to do their homework and spend as much time as they need to have confidence and then start. And one of the things that we do to kind of mitigate that is to provide a very affordable and easy way to start. So we say, well, since you're still exploring and finding out your way, why don't you have a very small setup that is not expensive, easy to set up, and explore while you're still at that baby step. And once they have that foundation, and then they can obviously grow and expand.
And I see Dirk nodding away in agreement. So it's knowing that it's not a one-size-fits-all approach globally and translating to the GC audience, doing your research, doing your homework, a bit of luck, knowing when to launch or when to enter. Dirk, what else? What other mistakes do you see when you're reviewing pitches?
I think, first of all, I'm fully agreeing with Marwan. It's really understanding the region, the country, which also requires more than a post box in being really in the country or in the region, if you talk about the wider region. The other thing is, I feel there's some, even when it comes to investment, companies who are not very successful in their home country, so then run away and try somewhere else. That's what we also see when asking for example, for bigger investment from the UAE. And then you ask, and coming from the US, where you have a vibrant VC landscape, so why don't they get money in their home country? Sometimes you find out if you dig deeper. So I think it's really offering quality. It's not that this market is an emerging market anymore. Maybe it's emerging in terms of innovation and health tech, but it's a very sophisticated, Saudi, UAE, Oman, very sophisticated healthcare system. So what they need to present is quality. And that's also something I sometimes feel it's not really the case in all the people who try to enter the region. And then, of course, being local, trying to, and there's some successful example, also startups I work with who really stay in the region, came to the region, even get investment from the region, which everybody thinks is hard to get. So I think it's really about local, but also offering the highest quality globally.
Another point that I want to add is both Dubai and Abu Dhabi and also Saudi Arabia have done very large investments in healthcare. Companies like Mubadala, ADQ, PIF, we're talking hundreds of millions. Now, that doesn't mean that all other companies think the same. These are sovereign wealth fund backed companies who think 10 years, 20 years ahead and have very, very big budgets, right? So it doesn't mean that everyone else have the same ticket size or think as long-term as they do. So I think because those investments make the news and make a very big splash, people make an assumption that it's easy to raise funds. The reality is it's not easy, because depending on what you're raising, whether it's a small ticket size or a mid-sized ticket size, you need to make sure that the investor you're talking to understands your business, your value proposition. And healthcare is not something that everybody understands. So it's, that awareness, I think, of what you're trying to solve is very important, and also going and speaking to the right people.
Of course, 100%. And when you were mentioning this as well, what came to mind was I'd seen an interview with the Saudi Minister of Health, His Excellency Fahd al-Jalajal, and he was talking in Arabic. He was talking to an audience, and he was saying, we welcome companies and we welcome startups, we welcome entrepreneurs to come and work in Saudi Arabia, but show us what's in it for us, which is valid, to be honest. Any country should be doing this. Show what's in it for us. Don't just say, we're just going to come do this and then go. He wants research on the ground. And it's the same with the UAE. It's like, show what's in it for the population, what's in it for residents, how you can help the local communities. Dirk, comparing the Kingdom of Saudi Arabia versus the UAE, are there any different regulatory or commercial strategies? For example, navigating the clinical side of things, because obviously you need the healthcare, connections, and it's always good to have an advisor who has a background in healthcare. Looking at the SFDA, the Saudi Food Drug Administration in Saudi, versus MOHAP, the Ministry of Health and Prevention in the UAE, how crucial is it actually in appointing a local representative to help you out, and somebody really embedded in the local community?
I think, when it comes to regulation, of course, Saudi FDA is well established. It's still building something, but nevertheless, they are in a way ahead of the regulatory game, because they really do more assessments, while the UAE Ministry of Health so far, we now have this new EDE, this new Emirates Drug Establishment, which will hopefully catch up. But so far, when it comes to regulatory, most of the things went through the Ministry of Health, and they fully relied on FDA and other big regulatory authorities. So there was not really an ambition which has changed to look at things yourself. At the same time, I feel navigating the regulatory environment, doing the right moves, it's very beneficial to have a local advisor, somebody who knows the local ecosystem. When it comes to healthcare, I think Saudi is much more government-led than the UAE. There are many more private hospitals in the UAE. In particular, Dubai is, of course, most of it is private. So there's also a kind of different landscape when it comes to ownership and shareholding of the healthcare environment. But I think for regulatory, it's always helpful to have somebody who understands the local ecosystem.
For those, by the way, who are not aware, the UAE is we are a private health insurance model, so I'm more likely to get healthcare quicker in the UAE than it is compared to the UK, where I'm waiting for a GP appointment. Saudi, it varies. It's private health insurance for expats. The government, the same in the UAE, government covers healthcare for citizens, but it is, majority private healthcare insurance, which I feel is I know insurers get a bad rep, but at the same time, it almost helps in technology and acceleration, I guess, because there's more openness and more time for entities to innovate. Is that correct? So when it comes to the GCC first strategy, right? So we've got a company now; they're ready to enter. I know who you're going to choose, but is it choose one market within the GCC and dominate that? Or is it, no, you can choose several at the same time? What would be your advice without being biased?
It honestly depends on the product. But, as someone who also, have started a company a few years ago, I think the most important thing about a company is people, right? So where is it easier to hire people, or where can you find, let's say, better people easier? And Dubai does win that in compared to the other GCC countries. So I would start there. I'd rather have someone good who can drive the business or who can manage my business, because if I'm from Malta or somewhere else, I can't be there. So I need someone who understands what I'm offering and can run the show, basically.
So don't spread yourself too thin, which is actually, to be fair, our side of things, we do see that. We see when companies enter and they just want to focus on the entire GCC at the same time, it gets a little tricky, whereas when they go in with UAE mindset, KSA mindsets, and focus on that for a while, it then becomes easier because their connections get stronger as well. And everybody wants to help each other anyway. Dirk, is that the same?
Yeah, I think so. I mean, there are, of course, several criteria. One is market size. I mean, you would start with the biggest or second biggest, which is the UAE. Then the other thing is support and flexibility. I'm probably both of us biased in a way. I think UAE is a little bit ahead. But it makes sense to start in one of the bigger markets. And I think we consider UAE as a launch pad because you have a lot of things that you don't have in the other markets. So starting one of the very small markets doesn't also make much sense. So I think UAE is a good way to start because I think a little bit also clearer in terms of smaller, not that complex, but yeah. But I would not, I think it gives the same recommendation already. Starting in all the GCC countries at the same time doesn't make sense. They're too different in a way to try to do all of them. In particular for a startup having limited resources, I don't think it makes sense to start across the whole region right away.
Yes. But also, there are companies that, for example, can do well in a tender business. And Saudi Arabia has one of the very large tenders that they do. So if you do win a tender in Saudi Arabia, by all means, start there. That's not wrong.
So let's talk about the money. Dirk, what is the funding landscape really like? I mean, the Series A gap for MedTech. Is there ample capital from VCs, family offices? I know a bit of a trend at the moment in the UAE specifically, sovereign funds. What makes a non-GCC or a foreign startup investable for a MENA-based investor?
I think first of all, and Marwan already highlighted, you have to understand in a way the big sovereign wealth funds like Mubadala, like ADQ, others that everybody knows, they have a totally different strategy and different ticket size and also different stage of companies. So they do big investments. I mean, Mubadala have a huge life sciences team only doing investments in life sciences, but a totally different company. It's not Series A, it's maybe a fund of 20 Series A companies, but so that's something. Investable, first of all, I think they should have a relationship with the region, localized in a way, which we discussed already. So most of the funds, family offices wouldn't invest in some company being abroad, no relationship to the region. And one of the reasons for this Saidala fund is to really close the Series A gap. So helping family offices, bringing knowledge, bringing experts, bringing infrastructure around Series A to make them investable, to minimize the risk, but also educate them in terms of this is the risk you need to take, but the rewards are very high. But I think we have a lot of money in the region, but from our Series A and life sciences perspective, it's allocated to different areas. I think it's really important to create trust. And then I think there is a tendency for co-investment. So if you bring one family office who are keen to invest, you usually get more than one because they tend to co-invest. So sometimes really the first one is the most important, like any investment story. I think if you have the first VC anywhere in the world, the others will follow. It's the same in the region. And probably you have to add from your experience as well.
Yeah, I mean, I think family offices prior to COVID didn't really put any sizable investment in healthcare, but COVID was really a wake-up call, and it was also a showcase that innovation can save lives. So I've seen a lot of family offices wanting to get into healthcare, wanting to do something, and that's very, it's a great time to be in the life sciences and healthcare sector, because you now have not only the very large investors and the very small ones, but also people who are looking at a ticket size of $5 to $10 million, which was not the case 6 years ago.
And the right advice is crucial, and I think you both have that in common, because Dirk, with your healthcare background and the people on your team, sometimes family offices don't understand the potential of a startup until, as a healthcare specialist, you're going, no, this is really good. This is what we need to do. And I feel family offices are paying more attention to healthcare and medical care, medtech right now. Marwan, from your side, as a free zone Dubai Science Park, you facilitate connections. For example, a newly landed foreign startup, you can connect them to a major hospital if they wanted to discuss clinical validation, or maybe an academic institution for local R&D, connecting an entrepreneur with that. So it's always turned to the local experts on the ground if you want to do it right. Is that correct?
Correct, yes.
Okay, fabulous. So we're nearly out of time. So to end, and again, once again, thank you to everybody who made it to this last slot. It's not an easy slot, so thank you very much, folks. In 15 seconds, what is your one must-do piece of advice for a MedTech CEO or founder in the audience who wants to enter the GCC within the next 12 months? Who would like to go first? No.
Go to MedTech Summit in Dubai.
Oh, Dylan will be thrilled with that.
I mean, for sure, definitely spend time, network, meet the right people, understand the pathway. What do you need to do? What's the right way to enter the market? So yeah, that's my advice.
Amazing. And to be fair, I have covered MedTech, the Dubai Roadshow the past few years, and they do bring in the right people, and they do really connect you. A lot of VIP guests from the UAE do attend. So if you do want to just find out more, and you know what, sometimes the best question is just coming up to somebody, not pushing your business card in front of them or going, I'm doing this, that, and the other. It's just going, hey, you live here, what is it like? What can you tell me about the population? What can you tell me about the healthcare and medtech industry here? So always be curious. Dirk?
Yeah. So maybe if you don't find the way to Dubai, Abu Dhabi is also an option. That's the first kind of advice. Yeah, but otherwise I agree. Localized, understand what you do, what the requirements are, and then I think it can go very well, even in Abu Dhabi.
100%. And, again, we're not sponsored by any events here, but there's MedTech Dubai, there's Arab Health, which is now known as WHX Dubai, there's Abu Dhabi Global Health Week, which is steered by the Department of Health Abu Dhabi. So again, come to these events, and, the core MedTech, I would say, attendees, as in the ones that go every year, we also see them come to these other events, and they truly take an interest. Even Dylan, he comes to the region and he takes an interest in the people and the founders and the ministries and the government, and it's all about really investing time. It's like a relationship. If you're going to make an effort with your partner, it's going to last. If you're just going to ghost them or just talk to them once a year, it's not really a marriage or a relationship. So look at it that way. So finally, in one or two words, what do you think is the biggest trend that will define GCC MedTech in the next 24 months? So, for example, AI diagnostics, genomics, localization, longevity, value-based care. What would you put your, money on?
So like I said, I've seen growth in all, but if I were to choose, I would pick longevity.
Longevity, okay.
Yeah, I was about to say the same. I think longevity is probably the biggest.
But real longevity,
yeah, real
right?
Longevity,
not the
based on
you
science,
can be, okay.
based on data, and adding value. I mean, longevity, I agree, is everything. But I think, that's it.
Fabulous. Well, If you're in the longevity business, come to the GCC in the next 24 months. If not, come anyway and check out the region and see what it's about. We get a lot of bad press at times, but we are very friendly people and we are a great community. So once again, thank you for being here. Thank you, Marwan Abdelaziz Janahi, Senior Vice President of Dubai Science Park, Dubai Knowledge Park, Dubai International Academic City. And Doug, congratulations on your new venture. Where is it? Saidallah Healthcare Angel Investor Network. Congratulations and good luck with the rest of the projects. And MedTech Malta Audience 2025, thank you so much for being here with us.
Thank you. Thank you. In fact, the happiest people I know are the ones who relocated to Dubai. Yay. Habibi, come to Dubai. That's right. Yalla. Okay. We will see you in Dubai in February 2025. Make sure to check the dates, the tickets, and see us at Festival City. We will all be there. But before that, I will see you tomorrow morning. We're here on this stage tomorrow morning, 9 a.m. We start for the day 2 of MedTech Summit in Malta. It's been a fantastic day. Please enjoy this evening, dinners, parties. Make sure not to stay up late because I'll be here for you tomorrow, 9 a.m. sharp. Make sure to be here. Stay hydrated. Have fun tonight, and I'll see you tomorrow. Ciao.